It's seeing quorum. We will call our meeting to order. This is meeting number 67 of the Standing Committee on Health. We're doing our study on C45 on cannabis, and today our panel is focused on prevention, treatment, and low-risk use. And I welcome all of our guests by video conference and here at the table. As individuals, we have here today Michael DeVilliers, Assistant Professor, Policy Analyst at McMaster University, Mark Kleiman, Professor at Public Policy, Marion Institute of Urban Management in New York University by video conference. Welcome. From the Canadian Nurses Association, we have Dr. Linda Balneves, a registered nurse and medical and non-medical cannabis researcher, and Carrie Schuhandler, Policy Advisor, Policy Advocacy and Strategy. From the New Brunswick Medical Society, we have Dr. Serge Melanson by video conference from Moncton. And from Nova Scotia Department of Health and Wellness, we have Dr. Robert Strang, Chief Medical Officer of Health by video conference from Halifax. So thanks very much. And we'll start with 10-minute introduction remarks by each organization. And then we'll go to questions from the members. So we'll start with the Canadian Nurses Association. Dr. Balneves.
Actually, Carrie will be starting our presentation today. Thanks.
Okay.
Thank you. Thank you, Mr. Chair. Good morning, Mr. Chair and members of the committee. My name is Carrie Schuhandler, and I'm a registered nurse and policy advisor for the Canadian Nurses Association, the national professional voice representing more than 139,000 registered nurses and nurse practitioners. I'm pleased to be here today with Professor Linda Balneves, registered nurse and medical and non-medical cannabis researcher, who will be able to answer questions that are more technical in nature. Dr. Balneves currently serves as an associate professor in the Rady Faculty of Health Sciences College of Nursing at the University of Manitoba and is a nursing leader in the fields of shared treatment decision-making, complementary and integrative healthcare. She has published and presented on topics related to knowledge translation, integrative oncology, treatment decision-making, and medical and non-medical cannabis. At the outset, I would like to thank the committee for studying this important issue and for inviting CNA to provide its recommendations. Legalization of non-medical cannabis will impact public health, and as such requires a preventative approach to reduce the risks of health risks and social harms associated with cannabis use. CNA welcomes the federal government's work to table Bill C45, which will guide the legalization, regulation, and restriction of access for non-medical cannabis. CNA supports the passing of the bill and believes that legalization is an excellent option for addressing the harms of cannabis. CNA recently conducted a national survey of nurses to assess the readiness for legalization, determine knowledge gaps, and resources needed to collect input on the sections of Bill C45 that pertains to the scope of CNA's work. While the 2-month survey remains open until tomorrow, preliminary results indicate that a majority of nurse respondents favor the government's move toward legalization and that the focus should be on preventing access and associated harms for young persons through a variety of mechanisms, including considerations around packaging, labeling, display, promotion, and sale of cannabis and cannabis accessories. Legalization can support the regulation of quality, dose, and potency while minimizing social harms as well as the costs of prohibition. In addition, legalization can improve access to research into potential harms or medical benefits. In reviewing the bill, CNA was pleased with the moderate public health approach taken on the complex issue of cannabis legalization. In its current form, Bill C45 promotes the removal of harms associated with the prohibition model while recognizing the need to protect vulnerable populations, including youth. CNA has provided 4 recommendations for amending the proposed legislation, all of which are outlined in our brief. We encourage the committee to include all of CNA's recommendations in your final report, including those related to the sale and promotion of cannabis and cannabis accessories, and considerations around promotion and use related to alcohol. Cannabis should not be treated the same as alcohol. Harms of alcohol use and current alcohol policy can be downplayed at times and should not necessarily serve as the model for cannabis policy simply because it's one that is already established. Additionally, cannabis is different in that there are therapeutic indications and particular formulations for medical use. Thus, medical access should not be forgotten in the wake of legalization. While these other recommendations are not the focus of our presentation today, we would be pleased to answer any questions on the full range of recommendations put forth in our brief. This morning, we'd like to focus on 2 of the 4 recommendations, namely those related to youth criminal penalties and the inclusion of a comprehensive public health approach to legalization of non-medical cannabis. Our first recommendation regarding youth criminal penalties is specific to Section 8 and related subsections that state, For a young person, aged 12 to 18, to possess cannabis of one or more classes of cannabis, the total amount of which, as determined in accordance with Schedule 3, is equivalent to more than 5 grams of dried cannabis, is guilty of an indictable offense and is liable and/or is guilty of an offense punishable on summary conviction and is liable to a youth sentence under the Youth Criminal Justice Act. A criminal record can not only limit an individual's ability to travel to certain countries, it can also lend itself to considerable social harms. In particular, for youth, a criminal record can be a barrier to volunteer opportunities, which are often required by school curriculums and can play a role in scholarship decisions. A criminal record can also reduce career opportunities and contribute to poverty and poor health outcomes. Legalizing cannabis while maintaining criminal penalties for youth can disproportionately disadvantage young people, particularly those from marginalized or racialized communities, potentially barring them from opportunities to equitably advance and contribute in our society. Given evidence that 21% of 15 to 19-year-olds in Canada have used cannabis in the past year, such legislation could potentially impact a large number of youths. Alternatives to a traditional punitive approach to addressing both minor crime as well as problematic substance use have demonstrated success. Examples such as drug courts, which use a restorative justice approach, offer an alternative to traditional justice processes. These models offer full engagement and accountability of the offender and help to address the broader range of contributing issues such as poverty, health, or social justice issues which may have brought the person to commit the offense in the first place. Consider a 15-year-old struggling with problematic cannabis use, caught possessing more than 5 grams for personal use. He uses non-medical cannabis to self-medicate for undiagnosed anxiety and depression, which is exacerbated by the stress associated with living in poverty. Would criminalizing possession or even a significant fine help this teen? Or would he be better served through a drug court system with a restorative approach where the teen can be accountable in his own healing, provided with opportunities to link with health and social service organizations to address the root causes of poverty, and treatment services to address undiagnosed mental health and substance use issues? With this in mind, CNA recommends that youth possession of cannabis not be subject to criminal penalties, that the government use a restorative justice approach as the guiding principle for addressing youth possession, and that such depenalization eliminate current or future repercussions for youth by removing the provision under Section 8 and related subsections of the Cannabis Act. Our second recommendation is for the government's investment in a public health approach to cannabis, including a comprehensive public education program. CNA strongly supports the recommendations made to the Federal Task Force on Legalization, Regulation, and Restriction of Access to Cannabis to learn from other jurisdictions such as Colorado and Washington and invest in a comprehensive public health and public education program, including those related to cannabis use while driving, well in advance of legalization. Canada spends more than $1 billion annually to enforce cannabis possession laws, arresting about 60,000 Canadians for simple possession. This accounts for about 3% of all arrests. Legalization should remove significant social harms, but also remove the financial costs associated with enforcement under the current model of prohibition. And thus, with this in mind, CNA recommends that once legalization is in place, the government use a portion of the savings from enforcement and/or revenue from sales to invest in initiatives that contribute to positive health and social outcomes. Such investments should include tools, training, and guidelines to support public education programs for cannabis harm reduction strategies, programs for substance use prevention and treatment, and research to better understand the harms of non-medical use as well as the potential benefits of medical use. Cost estimates for these measures can be derived from jurisdictions where cannabis has already been legalized, from public education programs that have been launched, and from current federal government investments in public education related to tobacco use. Nurses are the largest group of healthcare providers in the country and often a person's first point of contact with the healthcare system. As such, nurses are well positioned to contribute to the development and delivery of this kind of health education. Results of a Nanos research poll commissioned by CNA in August of this year, which will be tabled, note that more than 9 out of 10 Canadians support or somewhat support nurses educating Canadians on the risks associated with non-medical cannabis use. Preliminary results of CNA's national survey of nurses noted that 49% of respondents indicated that they felt comfortable initiating a conversation or responding to patient concerns about the risks associated with non-medical cannabis use. Based on these results, CNA is committed to providing additional educational resources on non-medical cannabis to support nurses caring for people across the continuum of care. I would like to close by emphasizing that legalization of cannabis is an excellent opportunity to reduce harms associated with non-medical cannabis use, but we must get this right. CNA encourages the committee to urge the federal government to incorporate all of the recommendations put forward by CNA. Thank you.
And thank you very much for your contribution. Okay, now we're going to go by video conference to the New Brunswick Medical Society, Dr. Serge Melanson.
Thank you and good morning. My name is Dr. Serge Melanson. I'm the Chief of Staff and an emergency room physician at the Moncton Hospital here in New Brunswick. I'm speaking today on behalf of the New Brunswick Medical Society, the professional association representing more than 1,600 physicians in New Brunswick. As a professional association, we believe that we have a key role to play in advocating for improvements to healthcare delivery in New Brunswick. We have led the way in various initiatives, such as the promotion of team-based healthcare delivery. We have also been successful in promoting healthy living initiatives and policy changes to protect youth from health hazards such as smoking and the use of tanning beds. We recently launched a campaign to make New Brunswick one of the top 3 healthiest provinces in the next 10 years. We've also collaborated with schools to improve healthy food choices and promoted the mandatory use of ski helmets to prevent head trauma. Je remercie le Comité permanent de la santé de la Chambre des communes.
I would like to thank the House of Commons Standing Committee on Health for inviting me to speak today about the concerns of New Brunswick Medical Society on the issue of legalization of recreational marijuana. In June of this year, our organization released a position paper on recreational marijuana. This paper included recommendations to the government of New Brunswick with respect to an appropriate framework to limit the harmful effects of marijuana use on New Brunswicker. Moreover, we are working to create awareness of the health issues associated with cannabis consumption, and we recently launched a public education campaign on marijuana use.
Cannabis use can lead to negative health impacts. While Canadians will have the choice to consume marijuana legally in a little less than a year from now, it is essential they understand the risks. Making cannabis legal does not make it safe. We understand the goal of the federal government in legalizing and strictly regulating cannabis is to decriminalize use of the drug and reduce illicit sales of the substance. But we believe there are still substantial concerns to address when it comes to the particulars of legalization. Our position on legalization is in line with that of the Canadian Medical Association and their recommendations built on Canada's experience regulating alcohol and tobacco. We also support the guidelines developed by the Centre for Addictions and Mental Health for low-risk use of cannabis. One issue of particular concern to us in this discussion, from a prevention and low-risk use perspective, is the proposed minimum age for legal possession and purchase of recreational marijuana. We believe very strongly that the proposed age of 18 under Bill C-45 sends the wrong message to young Canadians that it is safe for them to consume marijuana at that age. There is clear scientific evidence that the brain of young adults is still developing up until the age of 25, and that marijuana consumption can have adverse effects on brain development. While we would ideally like to see the legal age for recreational marijuana set at 25 in Canada, we recognize this is not likely feasible and that 21 may be a more realistic age for the prevention of illicit purchase by young adults. Over the past 14 years of practicing emergency medicine in Moncton, I've seen firsthand a significant increase in the amount of cannabis use and its negative health effects in patients presenting to the emergency department, whether it be as their primary cause of their medical problem, something that is worsening an existing chronic disease, or something that may be unrelated to why they're there. I deal with the effects of cannabis use in the ER in a number of situations. These can be patients experiencing unexpected effects due to cannabis being laced with dangerous chemical additives, patients experiencing a cannabis-triggered issue called cyclical vomiting syndrome, cannabis triggering serious mental illness, and patients experiencing serious health issues such as chronic lung disease as a direct result of cannabis use. I see patients who have consumed cannabis, adolescents and young adults for the most part, who then to go on to develop their first episode of psychosis, schizophrenia, and bipolar disorder, and other significant mental health issues. teens or young adults consuming cannabis will have a higher likelihood of developing these mental health issues if they continue to consume cannabis. Some young people may also be under the impression that these medical issues are curable. The reality is that these are lifelong diseases. Young Canadians are taking a significant risk in consuming cannabis. We believe that there is a clear association between cannabis use and the onset of psychotic disorders because the brain of these young adults is still in development. Étant donné que nous savons que la consommation récréative de...
Since we know recreational marijuana will be legalized, and there will likely be fallout from increased use from a healthcare standpoint, it's important that the provinces and territories be adequately resourced to deal with this fallout. If Parliament proceeds with Bill C-45, then the Government of Canada has the responsibility to ensure that provinces and territories are properly equipped to respond to increased pressure on the healthcare system. Moreover, the Canadian government must ensure that provinces and territories have the resources to properly measure the impact of legalization so that they're in a better position to adapt their awareness and education efforts, as well as their intervention and treatment services to the situation over time. This will require population health research to measure the negative effects of increased use of cannabis on our communities and citizens.
Government at all levels invest the necessary resources to support a strong and ongoing education and awareness campaign. If Canadians are to be presented with the choice to consume legal cannabis, they must have easy and clear information on the risks associated with making that choice. In closing, I would like to make it clear that a decision by the Government of Canada to legalize the use of cannabis must be advised by these precautionary principles. Government has a fundamental responsibility to protect its population. It is of particular importance on the legalization of cannabis for government to ensure that it is living up to its responsibilities to all Canadians. Merci.
Thank you very much, Doctor. I want to just say I live in Nova Scotia, but I was treated for cancer at your hospital 9 years ago, successfully so far anyway, and I just had great care, and I just want to say thank you for that. Now, moving to the Nova Scotia Department of Health and Wellness, Dr. Robert Strang, Chief Medical Officer of Health by video conference from Halifax. Dr. Strang.
Good morning to the committee, and thank you for the opportunity to speak to you today. I'm appearing on behalf of the Chief Medical Officers of Health for the 13 provinces and territories, and I'm providing a collective public health perspective and not jurisdictional positions from any of the provinces and territories. My remarks will be focused on this morning's topic of prevention, treatment, and low-risk use, but by necessity will touch bases on other topics such as legal age, labeling, and packaging, which have been discussed in other sessions. I have assumed that by prevention it is meant the prevention of population and individual harms in relation to how cannabis is produced, distributed, retailed, and used, the prevention or at least delaying the onset of use by those below the legal age, and the prevention of harms to populations who may be at increased risk. Prevention is not just about providing information and education about risks and harms. Appropriate education and social marketing can be effective, but only if it's part of a comprehensive strategy. Policy decisions related to how cannabis will be sold, how it will be priced, how it will be labeled and marketed, and the level of availability and accessibility are the most critical when it comes to preventing population harms, harmful individual use, and minimizing underage use. To be more specific, to have the strongest prevention approach, cannabis should be distributed and sold through government monopolies where the primary objective is protecting public health and safety and not revenue generation. As recommended by the task force that advised the federal government, there should be no co-sale of cannabis with tobacco and alcohol products. At the outset, price will need to be set to maximize purchase from the legal market, but over time, price needs to be used as a key tool in decreasing overall demand as well as encouraging consumption of lower harm products, such as products with lower THC concentration and non-smokable forms. Product promotion, such as advertising, marketing, sponsorship, and product placement, including at the retail environment, needs to be prohibited at the federal level and complemented by similar provincial restrictions. Product packages should be plain with clear and prominent warnings about risk. At the retail level, prepackaged products such as cigarette-type joints should not be allowed, as though those can facilitate marketing, promotion, and glamorization of cannabis use. The number, location, and density of retail locations, along with hours of operation, needs to be carefully developed to balance access to legal products, accounting for the current legislation's ability for personal growth and online mail order purchases, and the balance with prevention objectives. Over the long term, a minimum age of 21 would be better than 18 or 19 at balancing between shifting young adults to legal supplies and decreasing use by those under age 18. I think I'm going to explain this a little more because this is a key point that keeps coming up. We know that one of the objectives is to move people from an illegal to an illegal market, and certainly setting age 19 or 18 will bring young adults into the legal market in the short term. But if we really want to, if one of our key objectives is to decrease use amongst youth who are under 18 and will always remain in an underage, no matter even if our age is 18, if they are using cannabis, they are going to have to access from an illegal source. We know from clear evidence from around tobacco and alcohol that setting an age of 21 versus 18 or 19 will over time have a greater impact on decreasing cannabis use rates and therefore keeping those individuals out of any market for cannabis for those under age 18. So if one of our primary objectives is to have set circumstances that decrease use of cannabis by those who are underage, we're far better off with an age of 21 than of 19. So moving on, public smoking and vaping of cannabis should, at a minimum, follow the current approach to public tobacco smoking and vaping to prevent further normalization of cannabis smoking and renormalizing smoking behaviors in general. The approach to bringing edible and other concentrated and derivative products into the legal market needs to be done extremely carefully to minimize the normalization of cannabis consumption and protect children and youth. With respect to edible products, it must be made clear through legislative requirements that products which contain cannabis, plant materials, and extracts and active ingredients are not food products. Since it is easier to loosen regulations than to tighten them, the initial regulatory approaches should err on the side of being more restrictive. Adjustments can be made as time progresses based on comprehensive monitoring and research. And such monitoring and research will need to be adequately resourced and established. Programs that shape social and physical environments to support health and well-being in general, such as supporting healthy pregnancies, enhancing early childhood development, ensuring adequate housing and income, are all important measures for primary prevention of problematic substance use in general, and are and will be important in preventing problematic cannabis use. Along with this submission, I'm pleased to attach a more detailed position paper from the Provincial and Territorial Chief Medical Officers of Health, as well as the Urban Public Health Network, which are the medical officers of health in urban centres, and that more detailed report has been provided to the committee. With respect to treatment, I do not have experience or expertise in the treatment of cannabis use disorders, but I would say that there are no treatment approaches or therapies that are specific to cannabis use disorder. There is a need for improving appropriate access to treatment of people with cannabis use disorder today as part of the need to improve treatment and access and for people with a range of substance use disorders. And whether the need for treatment will increase or decrease will really depend on decisions and the implementation of policies that I've discussed previously. With respect to lower risk use, an updated set of guidelines for lower risk cannabis use, the development of which was led by Canadian experts, was publicly released in June of this year. These guidelines have been endorsed in principle by the Council of Chief Medical Officers of Health. And in summary, these guidelines recommend that the most effective way to decrease risk is to abstain, that the older one is when cannabis use is initiated, the lower the risk of developing problematic use and adverse health effects over the lifetime. Higher THC concentration products have greater risks, so low THC content products should be used. Synthetic cannabinoids, such as shatter, have more acute and severe risks and should be avoided. To protect lung health, routes of intake that involve smoking or combusted cannabis material should be avoided. Along with that, methods such as deep inhalation and breath holding that increase the psychoactive ingredient absorption also should be avoided. And frequent or intensive use has the highest risk of harm, and the recommendation is for occasional, if people choose to use, that occasional use, such as 1 day a week or on weekends, is recommended. Avoiding driving while using alcohol and/or cannabis is extremely important. Populations that are at higher risk from harms from cannabis and therefore should avoid use are pregnant women, people with a history or close family history of psychosis or substance use disorder. And the combination of risk behaviors, such as early age of onset and frequent use, likely magnifies the risk. These low-risk cannabis use guidelines should form a key part of public awareness and educational initiatives related to cannabis legalization, should be incorporated in product labeling, and should inform legalization policy decisions by all 3 levels of government. With respect to Bill 45, the Cannabis Act, the Provincial and Territorial Chief Medical Officers of Health and Urban Public Health Network recommended in the paper I have provided that this initiative be guided by public health goals and objectives written into a statute. We were very pleased to see the public health orientation adopted by the federal government for this initiative and the explicit articulation of public health objectives as codified in the Purpose Section 7 of that Act. We encourage provinces and territories to adopt a similar public health orientation and include explicit articulation of similar objectives in their statutes. Lastly, we suggest that the bill be amended to replace the word illicit with the word illegal. The term illicit is stigmatizing in nature, and stigma and discrimination reduction are important aspects of this initiative. So we suggest avoiding using the term illicit whenever possible. We suggest using the term illegal instead, as it is a simple, clear, and unambiguous term that refers to the legal status of possession of the substance, and it avoids the stigmatizing nature of the word illicit. Thank you for your time and this opportunity, and I look forward to our discussions.
And thank you very much for your addition to our report. Now we're going to go to Michael DeVilliers, Assistant Professor, Policy Analyst. The clerk is pointing out Mr. Kleinman, Professor of Public Policy, Merit Institute of Management, New York, by video conference.
Chairman, committee members, I bring to this presentation 40 years of experience in the prevention and treatment of drug problems. I've been a counselor, a community developer, a teacher, and a policy analyst. And I think my experience is really, my interest is really in drug policy broadly defined to include alcohol, tobacco, pharmaceuticals. And it's within that context that I view this new drug industry that we are establishing. When we think about prevention of drug problems, we usually think of providing people with information to help them make informed decisions. Another necessary part of an effective drug prevention program is development of a regulatory framework for drug industry practices. This is a critical part of what we mean when we talk about strict regulation. Alcohol, tobacco, pharmaceuticals, and cannabis are not ordinary commodities. Each year in Canada, alcohol and tobacco alone are associated with approximately 40,000 premature deaths, 6.5 million days in hospital, and a cost to the Canadian economy of over $30 billion. I want to emphasize that those are annual figures. The alcohol and tobacco crises have been with us for a long time, so long we don't think of them as crises. And despite our efforts at prevention and treatment, they persist year after year. Recently, a new drug epidemic has emerged. The opioid crisis began when a drug company aggressively launched a misleading advertising campaign for an opioid painkiller, oxycodone. The same company is now taking the same drug to the developing world with the same misleading information. During the campaign to legalize recreational cannabis, Canadians have received repeated assurances that this new industry will be strictly regulated, like other legal drug industries, and that this will provide the needed safeguards of the public's health. A half-century of international drug policy evidence tells us it is not so simple. Across our established legal drug industries, we see frequent failures in the striking of that important balance between industry revenue and protection of public health. The result is an enormous amount of harm that stresses our communities, families, and treatment programs. The state of the union is that we have 3 legal, regulated drug industries and 3 public health crises. Early indications from the emerging legal cannabis industry suggest that it may be on a similar trajectory. Mr. Chair and committee members, perhaps it is time for a new approach. Many of the decisions in the development of legislation require the striking of that balance, sometimes a choice between facilitating the success of a new drug industry and protecting public health. The logistics of cannabis legalization, as I'm sure everybody is realizing now, are incredibly complex. The stakes are high, outcomes are uncertain, caution is wise. Accordingly, I hope that the Standing Committee on Health will assign priority to the protection of public health and the prevention of harm. I will provide 4 specific suggestions for doing so. The first issue is a minimum legal age for cannabis use. Research shows that young people acquire their cannabis through their network of peer relationships. This is very important. The peer networks of young people, say 15 to 17-year-olds, are more likely to include 18 and 19-year-olds than they are to include 21-year-olds. Consequently, a minimum age of 18 or 19 will, over the long term, as we've heard, give easier access to cannabis for 15 to 17-year-olds than will a minimum age of 21. My first recommendation is that the government should choose public health protection over a larger legal market by setting a minimum age of 21. The second issue is the importance of a full ban on advertising and other forms of product promotion. Research shows that advertising increases use of a drug, and that increases in use of a drug are associated with increases in related problems. Advertising, even with strict limits, will increase cannabis use and related problems. My second recommendation is the government should choose public health protection over market growth by legislating a full ban on all forms of cannabis product promotion. The third issue is the importance of a non-profit model or options for cannabis supply. We already have 3 legal, regulated, profit-driven drug industries which have not succeeded in protecting public health. We can reduce the risk of creating a 4th by removing the profit motive from cannabis sales. An essential difference is that a nonprofit retail model would serve only the existing market with no product promotion or product innovation intended to increase the size of that market. My 3rd recommendation is that government should choose public health protection over market growth by restricting the retail of cannabis to a nonprofit organization with public health governance. The 4th issue is the importance of social justice for prevention and treatment. Between now and the widespread availability of legal recreational cannabis, which will require an amount of time well beyond July 2018, people are expected to continue to just say no to the use of recreational cannabis. It is unrealistic to expect that to happen. Charges for simple possession of cannabis amounted to well over $17,000 in 2016. Issuing of more criminal records will continue to have a devastating impact on the social determinants of health of these mostly young Canadians. Prohibition also poses a problem for those who are dependent on cannabis and are seeking treatment to improve their lives. In my experience as a counselor, I never encountered a patient who was helped by a criminal record. It actually impeded their efforts. My 4th recommendation is that the government should immediately decriminalize possession of small amounts of cannabis. Mr. Chair, that concludes my prepared statement. Thank you again for this opportunity. I will do my best to address any questions committee members may have.
Thank you very much. And now we're going to go to Professor Mark Kleiman, Professor of Public Policy at Marin Institute in New York by video conference. Professor Kleiman, floor is yours.
Messieurs, Mesdames, bonjour. To address this distinguished body as part of this genuinely historic process, I've been working on cannabis policy for almost 4 decades now. My firm was the advisor to the Washington State Liquor Control Board as it implemented Washington's cannabis legalization. I would urge you in this process to pay attention to results, not slogans. The case for legalization of cannabis is not its lack of risk, as we've heard from the other witnesses this morning. The case for legalization is the inability to control the illicit market and the harms the illicit market does, and the fact that lots of people would like to use cannabis and can, in fact, do so harmlessly. There's a tendency in public policy debate and in policies themselves to lurch from one extreme to another. And at least in the U.S., we're in the process of lurching from considering cannabis an evil weed to considering it a harmless herb. Each is an unfortunately imprecise characterization. For almost any drug, the majority of the users of that drug do so harmlessly and indeed with some benefit to themselves. That's what keeps them using it. And a minority winds up losing control of their consumption and engaging in problematic use. Tobacco in the form of cigarettes is the one exception to that, where most of the users engage in problematic use. That minority of heavy users, however, accounts for not only almost all of the damage involved with the use of any drug, but a large majority of the consumption of that drug. I don't have the numbers for Canada, but in the US, more than half of all the alcohol sold is sold as part of consumed as part of drinking binges, even though most drinking occasions are not to intoxication and are harmless. 80% of the alcohol consumed in the U.S. is consumed by people who drink more than is good for them. We see comparable numbers with cannabis. So the goal of legalization ought, I suggest, to be the availability of cannabis to those who want to use it temperately, while minimizing the number of people who get in trouble with it. So access without excess. That is not, as again we've heard from others this morning, a goal that's automatically served by a free market. Because that same 80-20 rule that drives public health concerns, that the 20% of the heaviest users are going to do themselves most of the damage, also drives marketing concerns. If you were in the business of selling a drug that some people become addicted to, they are your best customers. So what from a public health point of view is a diagnosis, from a marketing point of view is a target demographic. And that's equally true whether you're British American Tobacco or Imperial Distillers or the Ontario Liquor Board. If your goal is to maximize the amount of money you make, you're going to focus on cultivating heavy users. And that's precisely opposite to the public health objective that we ought to be serving. There's a widespread belief that we should regulate cannabis like alcohol as if we'd been successful in regulating alcohol. That seems to me an obvious fallacy once you've stated it. I think it would be wiser, if we're going to imitate some currently illicit market, to imitate the tobacco market, where, short of prohibition, government takes aggressive efforts to minimize problematic use. That's a policy regime I've called grudging toleration. Seems to me that we ought to be grudgingly tolerating cannabis, not allowing its promotion. A key element in promoting or controlling heavy use is price, again, as has been noted. It's important to understand that the natural tendency of the price of cannabis as a legal commodity is towards zero. A joint is a small amount of plant matter, dried plant matter, in a wrapping. The legal product that's closest to that is a tea bag. If we allow a free market in cannabis, the price of a joint will tend toward the price of a tea bag, and that's not where we want it to go. We already see in Colorado and Washington steady and rapid decreases in prices in the legal stores. My colleagues, John Calkins at Carnegie Mellon and Steve Davenport at the Rand Corporation, estimate that Colorado and Washington legal prices are falling at 2% per month, and there's no bottom in sight. The way to counteract that, if you're not going to have a public monopoly, is with aggressive taxation. And that cannot be taxation based on retail price, because as the retail price goes towards zero, the tax will go towards zero. The right way to tax cannabis from a policy point of view and a health point of view is to tax the active agent, THC. So we need a specific excise, not an ad valorem tax. And it should be substantial. Something like $50 a gram of THC would more or less maintain current illicit prices in the newly illicit market, and that seems to me a reasonable objective. Information is another key element of any prevention policy, where we're trying to prevent is substance use disorder. Restricting marketing seems to me like a very important idea, not merely because the advertising itself will attract new users as it's intended to, but because the presence of advertising dollars will influence the editorial content of advertising media. It's striking that in the US, the first mass market magazine to warn about the dangers of tobacco smoking was the Reader's Digest. Not because it was the most progressive or intellectually adventurous magazine, but it was the only one that was supported by reader subscription rather than by advertising. So controlling cannabis marketing will have a big impact on the way cannabis is described in editorial content. Every cannabis buyer has to confront some seller, either somebody taking an order over the phone or a clerk in a store. So that point of sale contact is the one place where we can make sure of connecting with every consumer. It seems to me it would be wise to require those people to have training in pharmacology and in substance use prevention, so that people aren't getting, particularly new consumers, aren't getting their first information about cannabis from somebody who sells cannabis for a living and frequently is a very heavy user himself. And those retail clerks ought to have a professional qualification and a professional obligation to give advice in the interest of the consumer and not in the interest of the store owner. So they ought to be more like pharmacists than like package goods clerks. Two things that we might want to encourage both at that point of sale and also in publicly funded information are the notion of use to less than intoxication. Right? The striking difference between cannabis today and alcohol today is that most occasions of alcohol use are not to intoxication. That is not the case for cannabis. Getting stoned is a common synonym for cannabis use. It is possible that we might introduce to the population the notion that one may take a puff in order to improve the taste of food or the sound of music or the pleasure of conversation, rather than having cannabis intoxication as the primary activity one is engaging in. I have no reason to think that that will work, but that's something we could try. The other thing I'd like to see emphasized both at point of sale and in mass media is the importance of abstaining from combination use. 40 years ago in the US, cannabis and on the one hand and alcohol and tobacco on the other were virtual opposites socially. They represented different cultural forces. Now in the surveys, heavy tobacco use, heavy alcohol use, heavy cannabis use are all the same population. One beneficial possibility about cannabis legalization is that it could substitute for other more dangerous drugs. We ought to undertake policies to encourage that possible beneficial tendency. Thank you.
And thank you very much. So now we'll go to our question period, starting with 7-minute round of questions, and we're going to start off today with Mr. Ayoub, fresh off a town hall meeting on cannabis.
Exactly, Mr. Chair. If you want to take your hearings, I'm going to ask the question in French, so if you don't, if you need it. Justement, Monsieur
Yesterday evening, I was at a town hall meeting with more than 150 people who came to get information from my region, and the facts are quite troubling. And before I give you these facts, I'd like to say that I'm really impressed by the panel we have here this morning. There's a lot of experience on different levels. We come from various spheres of specialization. In my region, which is north of Montreal, in Blainville, 45% of young people from 17 to 24 years of age have admitted to having used cannabis over the past year. 45%. And the average in Quebec is 35% of young people of this age. 28% of 11 to 17-year-olds have used it over the past year versus an average of 24.9% in Quebec. Yesterday, we said that it was urgent to take action. And this morning, it's even more urgent. There's even more urgent need to take action. So when I hear sometimes people say, from my members say, in all due respect, we shouldn't move forward with this, we need more time. Over the past 100 years, the approaches we've adopted have shown to fail clearly, we haven't been able to prevent young people from using cannabis, and the consequences are across the board. Yesterday, we also mentioned some points at the town hall meeting. For me, it's not the trigger's not money. It's preventing and protecting the health of our young people. Right now, we're pushing our young people to the illicit market. We're pushing them to organized crime. And these people don't just sell cannabis, they sell other harder drugs that we don't want our young people getting their hands on. So I'm worried if they're these young people under 25 years of age, they are suffering the consequences of this. But we're also forgetting that any youth age 18 years of older can vote. We give them that responsibility. And we make laws and we tell them you have the right to vote for someone, but you don't have the social awareness to make decisions for your own health, maybe perhaps from 21 years of age, but some provinces in 19. So I don't understand this logic. Every province is obviously free to choose its own age of majority for alcohol or cannabis, but we differentiate between the various products on the market. So I'd like to hear from our nurses. I really liked what Mr. Duvillier had to say. I am almost entirely in agreement with you, although not on the age, and the price. The price is also important because on the street, we said yesterday 3.5 grams cost $20. That's also a really important factor. If our prices are above that of the market, it won't really help anything. So I took 4 minutes, but I can tell you it really was very informative what I heard yesterday about the age, the consequences, and the various logic regarding the age. So from the Nurses Association, if you have any comments, or Mr. Duvillier, or any others?
The Canadian Nurses Association approaches the question of age from a harm reduction perspective. So all of the things that have been discussed over the multiple days that we've been hearing, we feel that they all need to be very carefully balanced. We do recognize that brain development continues to occur until age 25, according to the research, and that there are harms associated with cannabis use. But as we've heard just now and throughout the preceding days, we recognize that setting an age too high could continue to leave Canada's the people in Canada who use cannabis the most at highest risk from harms of the illicit market, and that includes crime associated with purchasing in an illegal market. It includes harms associated from an unregulated product where you don't know the potency, you don't know what the safety of what's in there. So we really think that the emphasis needs to be, instead of on an age itself, educating all members of the population, especially vulnerable people or potentially highest users, by developing education involving all stakeholders so that you can have a conversation with youth, so that it's not a paternalistic approach, so that they know of the harms and can make an informed decision.
I'm just adding to that, it's well established, the stats are well known that Canada youth are among the most prevalent users of cannabis around the world. And by us raising the age, we're potentially keeping their cannabis use still a very hidden, in the shadows, health behavior. We need to be able to have youth be able to go to health professionals and be able to talk about their use, be able to talk about the problems associated with it, and to receive the appropriate education and the referrals to harm reduction programs in order to address problematic use. We also need to be able to kind of open the dialogue with our youth about the potential harms, many that they may not be aware of. We've seen research that suggests that many youth begin to use cannabis in social settings. They see it as almost a social lubricant. They don't don't associate harms with it, and they may not be aware of what the long-term harms are related to career and education attainment, as well as the cognitive development issues and the mental health issues that have been raised by other panelists today. So we need to make sure that we're opening that dialogue and we're being respectful of youth's ability to make decisions around their healthcare behavior.
Right. I think the only point I would add is that something that I found that we hear a lot, and I find it a bit strange, is that we frequently hear a comment that it's easier for young people to get cannabis than alcohol and tobacco. And the reality is that the studies say exactly the opposite. And specifically, I'm talking about the Ontario Drug Use and Health Surveys that the Centre for Addiction and Mental Health does now. And they've been doing these surveys for 40 years. I mean, they know what they're doing with this. And their data show that actually what underage people report is it's easier for them to get alcohol and tobacco than it is to get cannabis. And the reason is because their peers of legal age are their suppliers. So in other words, if you're 19, or sorry, if you're 18, you can get alcohol and tobacco from your 19-year-old peers. But your 19-year-old peers don't have legal access to cannabis. So it's not so easy. So I think this is an important part where we really need to look at the data when we hear comments that, sort of get people excited and worried. So anyway, I'll leave it with that.
Ms. Gladue.
Thank you, Chair, and thank you to all of our witnesses that are with us today. I agree with what my colleague across the way has said, that young people are smoking cannabis. They are smoking it, and whether it's legal or illegal, they are smoking it. And so we certainly shouldn't be in a rush to worry about whether it's legal or not. What we should be doing is trying to prevent harm. And we've heard in the week that we haven't even been here a full week yet, only 3 days, we've heard a consistent message that the key to getting young people not to smoke cannabis is a public education, a public awareness, a training for them, similar to the effort that was done with tobacco to change public opinion, to make it, I like the grudgingly tolerating. I liked that phraseology, but that is definitely what's needed. And in the 2 years since the Liberal government announced they were going to legalize cannabis, that public awareness campaign has not appeared. And so certainly that's something that needs to be a priority. But we did see pockets of excellence. We had testimony yesterday from individuals that had brought forward a training for parents. And I understand Dr. Melanson from New Brunswick, that you did some public awareness training, and so I was wondering if you could expand on what your experience has been in Moncton.
Thank you, Mrs. Gladue. Essentially, my first-hand experience as an emerge physician after the past 14 years has been also recognizing an exponential increase in the usage of cannabis in patients presenting to the emerge department. And really highlighting your point on public awareness. And one of the things I brought up in my address earlier was this concept of a medical condition that's only now starting to become recognized and studied. It's referred to as cannabinoid hyperemesis syndrome, or cyclical vomiting syndrome. So this is a condition where mostly young people, young adults, will present themselves to the ER department after days of uncontrollable vomiting, unbeknownst to themselves as to what the cause may be. After an extensive panel of medical tests are conducted and we concluded that there is nothing medically or organically wrong with them, we then begin questioning them a bit more thoroughly on their use of cannabis and discover quite often that they are using cannabis on a fairly regular basis. They themselves often believe that they are well informed in regards to the harms of this drug, but when we educate them on the association of their cannabis use and the likelihood that it's related to the cyclical vomiting syndrome, they're often quite surprised. And when we provide them with additional information and counseling on how to abstain from cannabis use, we often see this debilitating condition essentially disappear. So I think that speaks very much to your point that as much as people may believe they are aware of the health risks associated with cannabis, there needs to be a more focused effort on providing more relevant and important information to these consumers of this drug.
Very good, thank you. I would say, picking up on one of your points, potency has been raised as a big concern. The cannabis of today is much more potent than previously. And I think it was the Nurses Society that said they wanted to see really good control over the quality, the dose, and the potency that people are getting. And so another way of protecting the public from things that are not well controlled is to get rid of one of the suggestions that's in C45, which is to allow home grow. Home grow has absolutely no quality control on the product, on the potency, on any of these things, and also provides easier access to children. So I wonder if the Nurses Association would like to start, and then we'll let everyone comment on whether they think allowing home grow is a good idea.
I think the risks posed by homegrown cannabis mirror some of the risks that we have associated to access to alcohol, tobacco, and pharmaceutical drugs in the home. And again, it really points to the need for public education related to the potential harms of cannabis, particularly to children that may consume it, not being aware of those risks. And I think it really points to the need for regulation around self-produced cannabis in terms of the source plants or seeds that will be used as a way of limiting potency, limiting the number of plants and plant material that is available within the home, as well as ensuring that there's regulation related to storage, labeling, and the use of that product in an edible form that may be, again, more attractive to children. So we support regulations related to safe storage and production. And again, it supports the need for open and non-judgmental conversation between parents and children about what cannabis is, how it can be used safely, and why there are restrictions around use in people that are under the age of 18.
Good. Yeah. I was really interested to hear about the statistics on what alcohol and tobacco cost us. 40,000 deaths, 6.5 million hospital days, and $30 billion annually. Because the conversation that we've been having is that we should legalize marijuana and treat it similarly to how alcohol and tobacco have been treated. But this brings to mind that perhaps those things aren't a success, so perhaps we shouldn't be trying to mirror what was done there. Perhaps we should learn from those and, consider a raised age. One thing that I would like to expand on is this idea of the nonprofit-driven supply. We heard this yesterday from our friends from Quebec, and I think it was you, Dr. de Villiers. So if you would talk, how will that work in Canada? What do you think that would look like?
Yeah, it's a really good question, and people have written about this. One of the popular models, and the group from Quebec, I think, is very in favor of this, is something that comes in a number of European countries where they have small co-ops. So these are user-run co-ops that would pay their staff salaries, but there is no motive to expand membership in any way, no motive to get the current members to use more of the product. And these are key ways of preventing this from becoming a problem. So these co-ops, and I think people are familiar with them. I mean, there's a lot of people in communities who will join a co-op to get vegetables and so forth. And so it's really an extension of that sort of very simple kind of concept. And the important thing that I think it brings is that there is, all you want to do is just serve the existing market and not expand it. What we know from decades of research around alcohol and tobacco is the more that you promote a drug through advertising, the more it's used, and the easier you make access, the more it's used. And so that's how you expand a market. Here's where the problem is. The problem is that as the market expands, so too do the number of people who have related problems. So that's why market expansion is important. The only other point I'll make very, very quickly is that Again, we have had a very difficult time internationally, not just here in Canada, of regulating our legal drug industries in a way that they achieve that balance of industry revenue and protection of public health. It's much more difficult than most people think.
Kleiman, you signaled a response. Yes.
Yeah, if I may, on the age question, it's a very difficult question. It's certainly true that 16-year-olds get their supplies from 18-year-olds, so that having an 18-year-old age is going to increase use among younger people. It's also true that criminal records are catastrophic, but cannabis arrest is much more dangerous than most patterns of cannabis use. So a possible compromise. In the U.S., states that vigorously enforce their law against direct sales from retailers to people under 21 do experience reductions in alcohol use down the age range and in drunken driving down the age range. So that appears to be effective. That needn't be coupled with criminalization of possession or use by people under whatever the legal age is. So if you enforce the law on the seller rather than criminalizing the buyer, I think you can get most of the benefit of the age restriction with relatively little of the cost.
Okay, thanks very much. Mr. Davies.
Thank you, Mr. Chair, and thank you to all the witnesses. Mr. Strang, I want to start with you. I want to quote from the final report of the Task Force on Cannabis Legalization and Regulation. They said, Canada's governments and many other organizations will need to work quickly to prepare for the implementation of the new system, increasing or developing capacity in many areas relating to production, distribution, and retail, quality control and enforcement, and research and surveillance. This increase in capacity will require new resources, human and financial, enhancements to existing institutions, and the creation of new ones. Having all elements in place will be necessary for the proper functioning of the regime. Now, some provinces are saying that they'll have difficulty being fully prepared for the legalization of cannabis on July 1. Given all that many of the capacities that I just mentioned will fall to the provinces, does Nova Scotia have any concerns in this regard?
Well, I do need to emphasize I'm not here representing the jurisdiction of Nova Scotia. I'm here representing the Council of Chief Medical Officers of Health. I think, but I will say that like many other provinces, we're working as hard as and fast as we can through a complex situation. My last point is that we really need to understand that that the current situation where cannabis is illegal but there's huge amount of use, so that is going to continue, and if we delay the shift to a legalization, it's not going to decrease use. It actually will continue the kind of gray zone that I have now where the rules are very unclear. So my own opinion is that it won't be perfect, but the sooner we move to a legal framework that we can then start to work at the other pieces, it'll create clarity for Canadians and create clarity for the health system and clarity for our criminal justice folks.
Okay. Dr. De Viller, you have recommended that the Canadian government immediately decriminalize possession of small amounts of cannabis. Why?
Yes. Well, certainly the numbers of tens of thousands of Canadians continuing to be to receive criminal records, and again, as someone has already pointed out, that in the great majority of cases, these criminal records will do far more harm than the use of cannabis by the majority of users in those cases. So that's the first thing. This can be done fairly easily too, and it's being done. Canada is actually a bit of an outlier in this regard. The last time I looked, there were 32 countries that have decriminalized cannabis. That is, they have stopped giving people criminal records for simple possession of small amounts of cannabis. Even in the U.S., we hear so much about, I think there's 7 or 8 states now that have either legalized or are in process of legalizing. There are actually twice that number that have consciously decided to choose legalization over cannabis. sort of legalization they've chosen decriminalization over legalization. So that's important. I mean, so this is something that should have been done a long time ago. I wish it would have been done when this campaign began. I wish it would have been done when the idea was introduced to the House of Commons in June of last year by Murray Rankin. There is a simple solution to this called the Director of Public Prosecutions Act that could be invoked to ask enforcement agencies and Crown attorneys to cease and desist with charging people with cannabis.
Mr. Schuhandler,
Professor Kleiman.
I'll be coming to.
He wants to respond to that question.
Okay. Quickly, Mr. Kleiman.
Yeah, this is a question on which I've changed my mind over time. I used to think that punishing users was an important way of suppressing illicit markets, and if that were true, I think I'd still be for it. I think the evidence now is that no country has created enough of a threat on users to substantially decrease consumption, and that the main impact of punishing users is merely to punish users. So not merely for cannabis, but also for drugs that we keep completely illegal. I think the practice of punishing drug users is probably a mistake and ought to be abandoned.
Thank you. And I will be coming back to you, sir, with another question. Ms. Schuhandler, if I heard your evidence correctly, you said that the criminalization approach to cannabis has negative consequences. Is that correct? Did I hear your evidence correctly?
We were speaking specifically to criminalization for youth, but yes. Yeah.
So does it have negative consequences for youth, the criminalized approach?
Yes.
So you're probably aware that C45 retains a criminalized approach.
Yes.
It'll continue to criminalize possession over 30 grams, cultivation over 4 plants, selling. A 20-year-old selling to a 17-year-old would face potentially up to 14 years in prison. Will that approach continue negative consequences on youth, in your view?
I think that's an excellent question. I think for the purpose of our brief and the surveying of our nurses across the country, we wanted to focus on the disproportionate disadvantage for decriminalizing for youth, and did not dive further into the excellent points that you raised that we heard addressed earlier a few days ago by this panel. But I think that a criminalized approach can be dangerous, and that the role of nurses in this is really to focus on providing an open space for education, and so the move towards legalization is definitely a way to do that.
Right. Thank you. Is it Dr. Kleiman or Mr. Kleiman? I'm not sure.
Mr., please.
Okay, Mr. Kleiman, I don't know if I understood your evidence correctly, but I thought I heard you say when you're talking about the tax policy that you recommended a price of $50 a gram. Did I hear that correctly?
No, I'm sorry. $50 a gram of THC. So for ordinarily potent cannabis in the U.S., which is about now about 20% THC by weight, something like $10 a gram, which was the illicit price in the U.S.
Thank you for...
The goal ought to be to not have the price decrease.
Okay, thank you for clarifying that. Back to Mr. Strang. I think you mentioned that the public health goals underpinning C45 is the idea about taking products out of the illicit, I think you prefer the term illegal market. Is that correct?
Yes, we certainly, the goal is to bring people into a legal market, but a legal market that is set up, driven by the objectives of public health and public safety, not for profit. So
given that this legislation will not do that for edibles and concentrates and other products. So in other words, on July 1, 2018, those products will still be in the illegal market without any regulation whatsoever on quality, on packaging, on anything. And we've heard evidence that somewhere between 30 and 60% of the products being consumed by people in North America are some form of creams or nasal sprays or tinctures or edible of some type. Would you agree that we should be moving expeditiously to bring those products into the regulated market exactly for the public health and safety concerns that you mentioned? Or should we leave it to the illegal market? Sorry.
I don't disagree that we need to bring edibles as part of this, but the world of edibles becomes very complex, and I think it's appropriate that we do this in a staged approach. There's enough complexities right now, as I'm sure you're well aware from your hearings this week. We need to get through some of the other pieces and then grapple with the very complex area of edibles, because then control of consumption, who uses them, workplaces, schools, etc., becomes very difficult, and that requires considerable more thought and policy conversation.
Okay, thanks very much, Mr. Davies. Now we move to Ms. Sidhu.
Thank you all being here to sharing your valuable information. My question is to Dr. Melanson. We all know in 2015, the highest use of cannabis in Canada was among youth, was 21%. And Professor Kleiman said there's a huge amount is used in, no matter is legal or illegal. And my colleague did a town hall yesterday, and then she shared the facts 45% youth is using now. I did town hall in my riding roundtable, and the number of is double now they're using. And my question is that, Dr. Melanson, when you said in your statement, you saw a patient in ER when they are cannabis is laced with other dangerous drug, which is more dangerous, is life-threatening for all our youth. That is why our government, after extensive consultation with law enforcement, and introduce a legislation to legalize, strictly regulate, and strict access to cannabis. Don't you think this approach is better than that? Like when the youth are coming with the taking laced cannabis. So what is your thought about that?
Mrs. Sindhu, thank you very much for that very important question. My reference to the lacing of cannabis as it exists now was based on my historic experience with the fact that there is currently, as you know, no legalized market for cannabis. I would presume that there would be some benefit in having this substance controlled from a safety standpoint in terms of what additives or not are incorporated in it. But I suppose that's also under the assumption that once this substance is legalized, that the illicit market will entirely evaporate, which I think may be not the case. I'd also like to point out that there are other significant health risks to youth and young in particular. So as you likely already know, the leading cause of death amongst young people and youth is trauma. And we recognize that trauma, whether it be from a motor vehicle accident or high-risk behavior, is often associated with either alcohol, illicit drug, including marijuana use. And this is also something I've seen substantially of, despite being in 2017 and seeing all the public awareness around the use of alcohol and illicit drugs and high-risk behavior. So to answer your question, I think, yes, there is the potential to see improvements in regards to the mixing of illicit drugs, more potent toxic agents in cannabinoids as we see them today. But I unfortunately don't think that will remove the risks to youth and young people in regards to what kind of troubles they can get into.
Thank you. My next question to CNA. Our government made a historic investment, $5 billion throughout 2017, that can ensure mental health support for all as a 500,000 youth Canadians. Mental health services and research will benefit all Canadians. How will this specific area of funding and research support the government's goal to protect the health of Canadians and minimize the harms of illicit cannabis?
Thank you for the question. By legalizing, that removes a lot of the harms of illicit cannabis. But your question to funding for mental health, it's an excellent investment. We applaud the government's investment in mental health services because they are necessary. There's always room for improvement as well. And as we said in our testimony and our brief, that an additional investment through either revenue from sales or enforcement savings should go into mental health programs, substance use prevention and treatment programs. So I think that while the $5 billion is a great investment and indicates that there is a need for additional mental health services in Canada, there should be additional money taken from the legalization of cannabis to invest in mental health.
And just to add, for information's sake, I'll be meeting with the Canadian Institutes of Health Research on Monday in Montreal, and there will be researchers from across the country that will be discussing with CIHR priorities in non-cannabis research, the use of non-medical cannabis in Canada, and so there will probably be additional funding specific to research that will look at the social as well as the health effects of non-medical cannabis use following legalization as well.
Okay, thank you. And next question is to Dr. Melanson again. What do you see the role of healthcare practitioner, nonprofits, educator, and community organization and other non-government providing public education for youth on cannabis? I also applaud your work you are doing for public education, especially for healthy eating for kids. And what do you think public education for youth on cannabis?
Again, getting back to utilizing tools here in New Brunswick, where the New Brunswick Medical Society, that youth and young people access, so using electronic formats and also traditional means of getting the message to them, that despite the legalization of cannabis, does not make it without some degree of risk. And as the other panel members have mentioned a number of times before, an informed decision, understanding all risk, is what is key when using legalized marijuana, and that is the staple of the message we have provided to the citizenry in New Brunswick thus far. I would also point out essentially that the educational campaign would need to also be sustained and not simply reflexive of what is going on currently, and that a comprehensive strategy between provinces and across the country likely needs to be adopted to making sure that the message that our youth and young people in particular are receiving is consistent and not sending mixed messages. Thank you.
Thank you. And my next question says, Dr. DeLauer?
Mr. DeViller, please.
Mr. DeViller.
Yes, thank you.
C45 proposed very strict regulation of labeling, advertising, and marketing at the outset of legalization, whereas alcohol, pharmaceutical, and tobacco all entered into the legal market with much more relaxed regulation. Do you think this will make a difference in our ability to protect public health?
I think there are some positive aspects of Bill C-45 arising from the task force report. So, for example, it looks like the direction that we're going is that advertising for cannabis products will only be allowed in places frequented by adults. So that would include cannabis retail outlets, perhaps alcohol retail outlets, gambling casinos, maybe in promotions before adult-rated films. So there's a number of possibilities there. I think what that presumes is that only young people are affected by advertising and marketing. And yes, we should be trying to do everything we can to prevent marketing and advertising reaching young people. We're still not doing it with alcohol. For example, alcohol advertising is everywhere you look these days, and there's no way of shielding young people from that. So adults will still be exposed to advertising, and we should be very careful not to underestimate the power of that industry to influence behavior. Remember, this is the industry that back in the 1960s convinced everybody that smoking these dried leaves in paper would make you, more socially and romantically and career-wise successful without doing any harm to your health. And half the adult population bought it. Now, I think we're more sophisticated these days than we were back then, and that will help. But adults are still very susceptible to advertising. Advertising works. And we've seen public health has been making this statement for a long time now. And we see it's beginning to have an impact in public. We see prominent health journalists, Andre Picard, for example, writing about the way alcohol is so aggressively promoted and advertised. And even within the advertising industry, Terry O'Reilly is an icon in the Canadian advertising industry. And he was recently making some comments in his programs about the way in which alcohol very aggressively is targeted towards women. And CAMH data shows that alcohol use among women is increasing, just as it is among men. So I think we have to, this is why I propose that we really do everything we can to completely ban advertising of all kinds. Plain packaging is very important. I'm glad to see that being talked about. With regards to retail outlets, one of the things I'd like to see is a plain packaging approach to retail outlets as well. Because the principle, if you think of the principle, is that a pack of cannabis or whatever, whether it's cigarettes, it's an ad. Every time somebody pulls it out, it's an ad. Plain packaging minimizes that to a significant degree. And I'd like to see that same thinking applied to retail outlets as well.
Okay, thank you very much. And that completes our 7-minute round. We'll go to 5-minute round, starting with Mr. Weber.
Thank you, Chair. Thank you, panelists. Dr. Melanson, I find it interesting you talking about cyclical vomiting syndrome and how you attribute that to marijuana use, yet people going through chemotherapy and having nausea issues tend to go to marijuana to eliminate the nausea. And I just find it interesting that it affects some people some ways and some people the other way. Any comment on that at all?
That's a very excellent question, Mr. Weber, and I think that really underlines our lack of understanding of what the scientific value of cannabis truly is and its perhaps beneficial or harmful effects. You quite accurately pointed out, I myself, as well as a practicing physician, will often encounter patients who will give testimonials to the effectiveness of cannabis with reducing nauseousness. During the same work shift, we'll encounter perhaps a young person who is in the midst of a cyclical vomiting syndrome. And to be quite honest, the medical literature is not clear on what the physiological reasons for that are, which I think should give us great pause in regards to if we are going to be expecting the increased usage of this substance in our communities and not fully understand its medical implications or health implications. I think it really underscores the importance that research will play going forward in regards to studying the effects, not only from a population-based standpoint, but also from a medical physiological standpoint. So we need to make sure that that is heavily promoted. Otherwise, we will continue to operate in the dark, as it were, regarding the true effects of this substance on one's health.
That, I agree. Mr. Kleiman, a question for you. You mentioned that you were quite involved with Washington State in their legalization process down there. Is it Washington State who did not allow home cultivation, growing of plants at home? Is that true?
That is correct. Washington allows home cultivation for people with medical recommendations, but not for people who merely want to use for non-medical purposes. So that's by contrast with Colorado, which does allow home grow.
Oh, so it's Colorado that allows home grow for recreational use?
Yes, and they've had a big problem with that, with people who want cannabis to be sold out of state, using a chain of people purportedly home growing as a cover for essentially illicit cultivation. I was a big fan of home growing to start with, on the theory that you shouldn't push people into a market for something that they can do for themselves. I think it turns out the regulatory problems around home grow were harder than I thought they would be. And so the Washington approach now looks sounder than the Colorado approach.
Do you see Colorado going down that road because of the problems, eliminating home cultivation?
I know they're moving toward restricting the number of plants. Cannabis plant can produce a wide variety of amounts, but if you allow people to grow 6 plants, they can produce a fair amount for export.
Thank you. I'd like to get the advice or the thoughts of others as well with regard to home cultivation. We'll start with Robert Strang. What are your thoughts on home cultivation?
Well, I have 2 thoughts. I mean, it certainly creates a number of problems around continuing to normalize cannabis as totally socially acceptable. In Nova Scotia, we have had meetings with owners of rental properties, and there are a number of substantive and real concerns from their perspective as property owners about if they have tenants who are growing and the impacts on multi-unit dwellings. But I also think we have to be realistic. People are going to grow cannabis whether we say it's legal or not. So that becomes a bit of a conundrum and around enforcement. But overall, I think it would be better to have cannabis produced and bought and sold through a well-regulated legal market and minimize other sources.
Mr.
Related to homegrown, I just wanted to share some research. We've done a national survey of people that are using cannabis for medical purposes. And there's been an overwhelming sense that people that have been exposed to self-production prefer that as a route for their medical use. One, because they have control over the product. Many of them are quite good amateur botanists in terms of developing a product that is able to address the symptoms or health conditions that they're using it for. It also allows them to have ready access to their medication versus waiting for it through the mail system that currently exists. And again, it goes back to my point of the importance of regulating home grows so that we ensure the safety, not only for the people within the home, but for their neighbors and for the larger community. I also wanted to have a quick comment to your comment around hyperemesis syndrome. I just wanted to point out that the illegal status of cannabis has made it very difficult as a researcher to actually conduct research on cannabis. In order to actually do a clinical trial of cannabis, it can take up to 2 to 3 years in order to gain approval through Health Canada to gain access to the actual substance. So many of us in the research community are quite excited by legalization because it will hopefully open the door to the much needed research that needs to take place.
Interesting.
Okay, now we go to Mr. Oliver.
Thank you very much, and thank you for your testimony this morning. Mr. de Villiers and Dr. Malhanson, I wanted to come back to age limit and the advice you gave there. Totally understand the health lens that you've applied to this and the recommendation that the age limit be set at 21. But I just wanted to do a really quick backdrop for you because you are speaking to a federal act, not a provincial act right now. So federally, the definition of youth is 12 to 17, and you would be charged and convicted if you're 12 to 17 under the Youth Criminal Justice Act, and your name is kept private and the record is sealed or destroyed after set timeframes. Federally, at the age of 18, you are charged as an adult, and if you are convicted, then you have a record, a criminal record that's a public record. So if we took your advice federally and moved the age limit to 21, 18, 19, and 20-year-olds would be subject to criminal charges and would have public records, criminal records. I think the intent of the federal legislation is to protect adults from that. So people over the 18 and over are legally allowed to possess cannabis up to a certain amount. But it's a minimum age so that provincially or territorially, they can go to a higher age. They can say 21. And in that case, 18, 19, 20-year-olds who are caught in possession of marijuana would be charged under the Provincial Charges Act. So it's like a fine, a ticket, a seizure. There's no criminal record, so think ticketing or think liquor license charges. So it seems to me that is a better solution, that your advice of 21 is really aimed at provincial territorial age limits, or is it really your belief that the health consequences for 18, 19, 20-year-olds are so extreme that they should be subject to criminal charges at the federal level? So So given that, do you think the advice at the federal level is still correct, that it should be 21 before we legalize it? Dr. Melanson or Mr. de Villiers?
I'll just say a few things to that. I guess Mr. Oliver, your point around the New Brunswick Medical Society and myself taking a view of this through the lens of healthcare is essentially the lens through which we view most things. Your points on the legal ramifications, however, are very well taken. I think I'd just like to point out a few things that you've brought up. First of which, I think that the scenario you've laid out would seem entirely reasonable as long as our provincial jurisdictions are under the same understanding and exert that same degree of responsibility when applying their legislation. Secondly, in regards to the balance of criminality versus the healthcare risks, we've heard from a number of panelists here today on potential compromises or options that could be struck. I would just like to point out, however, your demographic that you laid out, the 12 to 17 and then 18 to 21, this unfortunately also tends to be the demographic that we very much see the first episodes of significant mental health.
So just to be clear, demographic, that's the federal definition of youth is 12 to 17. After 18-year-olds and older are adults. So just...
Agreed. I guess I'm trying to point out that that demographic also represents, from a health perspective, the demographic in which we see major mental health problems first begin. And I think the medical literature is quite clear.
I understand the health. I understand the health consequences. I'm coming back to your advice to this committee to move the age limit for legalization to 21. So versus giving that advice to your province of New Brunswick or the province of Ontario, and so understanding the health risks, I think the committee has heard lots about that. I'm trying to get right to your advice. Do you want the committee to change the age limit to 21? Is that still your advice, given those criminal charges consequences?
As you've pointed out, yes, we stand very strongly on the age of 21 and would not be prepared to lower that for fear of the health implications. And as you also pointed out, it would seem as though there are legal abilities to get around the criminality as long as the local provincial jurisdictions were able to cooperate in doing so.
My view is this is part of the reason why I supported decriminalization as a first.
I'm just going to, because I had one other question. So decriminalization, I think we've heard that, but decriminalization doesn't deal with the black market. It doesn't deal with the right to license and regulate the production of marijuana, and it leaves the province or the country in a much more difficult state. So decriminalization, we're really dealing with legalization in this bill, not decriminalization.
Yes.
So.
Yes, I understand, and let me clarify what my suggestion is that decriminalization, I'm not suggesting that to replace legalization. I'm proposing that as a first step, which will then offer a lot of benefits to making legalization simple. I say let's continue, decriminalize, let's make this a little simpler, and then proceed with legalization as we're doing. And the benefit of that is that we stop, there's I think a popular expression in emergency medicine, first stop the bleeding. And the bleeding in cannabis law reform are all these young people having their futures compromised with criminal records. Let's fix that and then take our time working on legalization. There are no recreational cannabis emergencies. We should take as much time as we need to get this right.
Great. Thank you for that.
Your time is up. Dr. Carey.
Thank you very much, Mr. Chair, and I appreciate my colleague, Mr. Oliver's questioning, and it bodes the question, and maybe I'll ask Dr. Melanson this one. Why wouldn't we just decriminalize up to 21 and then make it legal over 21? Do you think that might be a solution? Make it a ticketable offense, because nobody wants to see a youth have a criminal offense that follows them through their life. Now, even what we've heard through testimony, maybe that's not even practical right now, but why wouldn't we just decriminalize up to 21 and just make it legal over 21? What's your thoughts on that?
I think that from a legal standpoint, that sounds perfectly reasonable. I think we would have to make sure that, again, the messaging, which is also being lost in this discussion, to our young people and young adults is that by setting the age, we are also taking into consideration the legal ramifications, but are not condoning the use under that age. So your point is well taken, and I think it's worth the merit that you've suggested.
Well, you know what? I want to thank the witnesses today, and I am a little frustrated because the Liberals are rushing this through, and you, I think, are quality witnesses. I'd like to hear from you because this is transformational, and we all realize there's no other country that's really gone this route. It's a big experiment. It's complex. And what we've heard from most witnesses, what's important, even though people are anxious to get it through, what's more important is getting it right. And we take your point well, where you say government's responsibility is to protect its citizens, particularly their youth. And because this is a panel on prevention, treatment, and low-risk use, I want to just get back to that topic. And I think I'll ask this question again to Dr. Melanson and maybe Dr. Strang. The government's had 2 years to invest in public ad campaigns that raise awareness about cannabis. They've had 2 years to set up a data system for collection of data and also ongoing data collection. They've had 2 years to set up research. They've had 2 years to figure out how to bring people who are having problems with addiction into treatment modes, 2 years for education. And what we want to do is make sure we get this approach right to protect particularly our youth. So my question would be, do you think the government has missed 2 years of raising awareness on this issue? And do you think that waiting till after it's legal is the wrong and unsafe approach? Dr. Melanson, if I can start with you, get your comments on that.
Thank you again, Mr. Carey. I agree with certain features.
Wow. You know what? We finally had a witness that agreed with me.
I don't know, Dr. Melanson, I don't know if you can hear us or not, but we've lost you. Can you hear us?
Well, Dr. Strang, maybe I'll have to, maybe you could agree with me partially.
So we have, from the outset, I'm one of the senior officials from Nova Scotia on the FPT senior officials group that has been working for over a year, and from the outset we have been putting forward the need for a robust conversation with Canadians around cannabis and around the coming changes in the legal status of cannabis. There certainly is a lot more work to do on that, and it has been somewhat slow. I do need to make a comment, though, that we're spending a lot of time talking about education and social marketing campaigns. Those are necessary, but frankly, we know from the example of tobacco was used earlier. We have not reached the levels of tobacco use where we're in Canada where we are from education and social marketing campaigns about telling people about the risks of tobacco. We have reached those levels because of using other policy levers around price, significantly limiting advertising of tobacco, and moving forward on smoke-free places, other pieces. So my point is that while we do need social marketing and education campaigns, if those are necessary, but if we actually don't control access and price and advertising those things, then all those social marketing campaigns will be a waste of money.
Well, I take your point because you mentioned we do need a comprehensive strategy, because that is my point. We're 290 odd days out if the Prime Minister is going to keep this promise, and it appears to me that the federal government, with this bill and with the announcements they've made, none of the resources that are required have trickled down to the provinces and territories to help set up data collection, research, treatment, and education, which is part of that comprehensive approach. So I'd like to maybe ask
back to Dr. Melanson.
If he's there, perfect.
Yeah, we should allow him to finish his answer. Dr. Melanson, you're back.
Yes, I'm back, and sorry for the technical difficulties. I will be just very brief, and I just wanted to point out that our experience here in New Brunswick has been, as you pointed out in your question, the medical societies have needed to take a leadership role in this over the past year or two, and I would hope that our local governments, as well as federally, will be quick to catch up to the work that we're attempting to do in educating our public, because we've needed to do this from a leadership standpoint because there seems to have been a bit of a vacuum in regards to getting the word out sooner than later.
Well, with this approach, this panel, like I said, it's about treatment prevention. We keep hearing that if a young person, 12 to 17, possesses over 5 grams, they can be criminally charged. If an adult possesses 31 grams, they can be criminally charged. And maybe I could go across the panel. Do you think that there should be a decriminalization amount? Maybe start with the nurses?
Quick answer here. We're over time, so just if you could give us a brief answer.
CNA does think that decriminalization is a strategy to help to reduce harms of related substance use.
Yeah, I mean, I think 30 grams is a reasonable amount, that anything over that might be subject to something more than just confiscation, but not a criminal record.
We have to end it there, Dr. Carey. We have to move on to Dr. Ellison.
Thank you very much, Chair. Thank you, everyone, for coming. Dr. Melanson, we share a common professional background. I'm a recovering emergency physician from Winnipeg. Practiced for 17 years there. Now, one of the things you said about what we have to be prepared for, and correct me if I misunderstand, you predicted that we would be seeing increased use of cannabis after legalization?
Thank you for the question, Dr. Ellison. My understanding from other jurisdictions is that by decriminalizing and legalizing cannabis, those districts have seen increased reported use of cannabis, whether that actually translates in actual usage. But I think the evidence would support that in districts that have done so have increased the reporting of the uses of cannabis.
Mm-hmm. All right. The reason I asked that is that we had some testimony from Washington and from Colorado that actually said the opposite. They said that there was a brief increase, but that was transient, and particularly around young people, that the use among young people several months afterwards plateaued back to pre-existing levels, which was very near the national average, and that one of our witnesses from Colorado suggested that it was that the latest numbers show that it had actually gone down about 12% among young people since legalization.
Well, that's interesting. In fact, that probably would give me pause to go back to my own references, which I'm afraid I don't have available. But perhaps I would defer your questions to the other members of the panel that have perhaps a bit more experience and may be able to reference their experience in other jurisdictions as well.
Yes, Mr. Kleiman, working in the American system, what are the statistics that you're familiar with, particularly with Colorado and Washington?
We need a number of clarifications here. I'm sorry. Both, excuse me, both Colorado and Washington had wide open cannabis sales under the medical guise before they formally legalized for non-medical use. And at the beginning of their legal full commercial availability, prices in the, quote, recreational stores were much higher than prices in the medical outlets. So the primary consumers in the early days of legalization, both in Washington and in Colorado, were out-of-staters and a few respectable people who didn't want to go to a physician and get a phony medical recommendation. The price decrease, which we've now seen, is not reflected in the data that's being quoted. On a national basis in the U.S., adult use, heavy use of cannabis has soared over the last 2 decades, so that we've now gone from about 1 million people who are heavy daily users to nearly 8 million people who are heavy daily users. But all of that increase has been among adults. The adolescent numbers have been absolutely flat. And what explains that stability in adolescent use is an interesting question. One hypothesis is that the decrease in tobacco use among adolescents, which is correlated with cannabis use, is pulling cannabis use down with it. But I think the answer both in Washington and Colorado is if you're looking for the impacts of legalization, it's way too soon to tell.
Mm-hmm. All right, thank you. Thank you. Now, Mr. Kleiman, further to you, you had were concerned about the falling legal prices. You had suggested we have a high tax and increase the price of legal cannabis to discourage its use? Did I misunderstand you, or was that what you had said?
That's correct. A high tax to the equivalent in state monopoly retail. An alternative would be, as has been suggested by others, getting commercialization out entirely and allowing co-ops to do it, and then you could regulate those prices.
Yeah, again, I'm talking to Colorado, and just yesterday, one of our witnesses from Colorado and a witness from Washington agreed that their price has actually fallen well below the that of the black market. And in fact, what is happening too is that the share of the market, of the legal market versus the black market, is decreasing steadily. That the latest data they have, which is a little bit old, that in Colorado, the legal market is 70% of the market. And they're crunching some numbers now, but a witness yesterday suggested that it's likely close to 90% of the market now in Colorado is legal.
Yes, if you're thinking about the in-state market, I don't know the numbers from Colorado. We estimated about 2/3 was legal in Washington state, a growing share for the legal market, which you'd expect. As legal prices fall, the illicit market is going to disappear. It's simply not possible to produce illicitly at competitive prices with commercial illicit production.
So do you still think? Yeah. So do you still think it is a better thing to tax it and keep the price high, or would we not be better at driving out the illegal market by keeping the price low?
I think you want the legal price to be somewhat below what the illegal price would have been. That should be adequate to get rid of the illegal market. The thing that hasn't been mentioned here is the necessity for enforcement. You essentially have what's now a tax evasion market. And if you have a high tax and don't enforce that, then you're going to have entrepreneurs come in and sell untaxed cannabis as they sell untaxed tobacco. If you're going to have rules, you need to enforce them. And that seems to me ought to be part of the planning for this policy. So, yes, the prices should be lower than illicit prices, but not so low as to encourage heavy substance use.
Okay, thank you.
Time's up. Mr. Davies.
Thank you. After on our fourth day of hearing, it's quite apparent that one of the major focuses of the testimony and the attention of committee members has been the impact of cannabis and cannabis legalization on young people, on youth. We've heard that their Canadian youth are among the highest users of cannabis in the world, perhaps second highest. We've heard about the impacts on their health, their career prospects, the impact of legalization and criminalization on them. We've heard about brain development. We've heard that they apparently suffer from holding many myths and misinformation about cannabis. We've heard advice from people about how to effectively talk to young people about cannabis. We've heard different thoughts about their access to cannabis, whether they do or don't have easier access to cannabis than liquor. We've heard about their attitudes towards cannabis, yet we haven't heard from a single young person at this committee. Millions of Canadians use cannabis, have acknowledged it, use it today, have used it, and will continue to use it. The Parliamentary Budget Officer has estimated somewhere between 5 and 7 million Canadians will use cannabis once this legislation comes into force. And of course, millions of Canadians, I think, voted very clearly last election for a legalized approach to cannabis. We haven't heard from a single ordinary Canadian at this committee. Existing producers of cannabis, we have large established producers in this country right now who have been responsible for, I think, a decade of producing cannabis for the medicinal market, and dispensaries across this country, both in Ontario and British Columbia and maybe other provinces, who have been very actively serving the market, mainly while politicians have quietly ignored it and police forces. We haven't heard from a single producer of cannabis or dispensaries about their experience over a decade. And finally, this legislation that we've heard, it almost seems by design, is excluding edibles and concentrates and non-smokable cannabis products. Despite the health concerns, despite the obvious contradiction between the very purpose of this bill, which is to bring products out of the illicit market, to get rid of organized crime, to regulate these products for the health and safety of Canadians, and yet we haven't heard from a single producer of those products. So I think these are very, very important stakeholder groups, and I believe it's important to hear from them for the committee's full consideration of the most comprehensive evidence on this legislation. So therefore, colleagues, I wish to serve notice that I'm going to be moving the following motion to be debated at some point, convenient point later in the days, because I want to give my colleagues a chance to think about this. And the motion will read as follows: that pursuant to Standing Order 108-2, this committee meet for an additional 2 days for the purpose of the consideration of Bill C-45, an act respecting cannabis, and to amend the Controlled Drugs and Substances Act, the Criminal Code, and other acts, and that the chair be empowered to coordinate the witnesses to a minimum of 32 witnesses, 8 per stakeholder group, the resources and scheduling necessary to complete this task in accordance with the following guidelines. 1. Witnesses are to represent the following stakeholder groups in 4 2-hour panel blocks per day. 1. Existing Canadian licensed producers and dispensaries. 2. Producers of edible cannabis products and other non-smokable forms of cannabis. 3. Ordinary Canadians who made a written submission to this committee regarding C-45. 4. Young Canadians, 15 to 24 years. Number 3, that witnesses for each panel block be allotted as follows: 2 Liberal, 1 Conservative, 1 NDP. 4, that witnesses be directed to prepare oral remarks for 10 minutes in length, and that the witnesses be invited to submit written statements prior to appearing. And 5, that the meetings be held prior to September 30, 2017. Colleagues, to conclude, the purpose of this is not to hold up these hearings. I'm mindful of the government's timeline, and it is September 14th. So I believe that we are meeting next week to hear from ministers. I want to give the clerk and the chair time to, and the parties time to put their witnesses in, but I think extending these hearings for another week and a half to hear from these important groups would be very, very important. I'm going to conclude by saying I've heard nothing but from 50-year-olds and 60-year-olds about how to talk to young people. I think it's time we heard from young people about their thoughts on this bill.
Just a thought on that. By the end of tomorrow, we'll have had, I think, 96 witnesses, and everybody's had a chance to submit witness lists. I'm not trying to downplay your thoughts on this, but I just want to make it clear that we will have had 96 witnesses as of tomorrow night, and we all had a chance to submit our lists at the opening. But I believe that the first chance you'll have to move that is on Tuesday, so we'll look forward to
Actually, Mr. Chair, I mean, I'm not going to get into debate now because I'm just serving notice, but I believe I can move this motion at any time. Mm-hmm. And but I don't want to interfere with the witnesses' testimony or colleagues, so I want to give my colleagues a chance to think about this. And I will say, though, that none of the categories that I mentioned were categories that were identified by the committee to hear from witnesses. And I believe the 96 witnesses, none of them will actually hear from these groups, and they certainly aren't topics that we were invited to submit witnesses on.
Anyway, well, your time is up, and I appreciate the notice. And that concludes Ms. Gladue.
Yes, just further to this motion, I wasn't involved in the actual submission of witnesses, so I apologize. But one thing that really concerns me is that all of the provinces that were invited to come don't want to come. And we haven't heard from any of them, and many of them have not fully developed their plans. And I would think that we would want to find out from them what's missing in the legislation. So I'm incredibly concerned about that and wouldn't mind adding that to the list of things that Mr. Davies is wanting. And the other thing is, although I see that you have workplace safety panel, you don't really have any of the companies that might be in a dangerous industry wanting to implement some things. So that was also on my list of people I might want to hear from, as well as other countries. You know, Amsterdam, I used to visit there, and believe me, there's a lot of pot being smoked there. So I'd be interested to hear, what they've done and perhaps something like that.
We invited almost all of the provinces, but only one agreed to come, which was a surprise to us.
Yeah, we can compel them, I think.
Anyway, all right, well, look, I want to conclude the meeting, and did you have one?
Just very, very quickly, I've done research, qualitative research, where I've interviewed individuals, as well as my PhD student, Riel Kapler, across Canada in terms of their use of medical cannabis and their access experiences. And I know it may not be 100% related. However, we do believe that many people that use non-medical cannabis are actually using it for medical purposes. And in talking to those Canadians, number one, they want to bring cannabis use out of the shadows and be able to talk about it with informed, non-judgmental health professionals. They're open to education about cannabis risks as well as their benefits. They want reasonable access to cannabis, both within their communities as well as through their health professionals. They want choice in cannabis in terms of the strains, the products, the mode of administration, and access points. They want their experiences related to cannabis and their beliefs to be respected, and they all recognize that stigma associated with cannabis use is incredibly damaging to open conversations about their substance use.
Okay, thanks very much, and I really very much want to thank the panelists today. We've had some excellent panelists all the way through this, but you've brought a lot of new information and perspective to us. We appreciate all the different envisions, ideas, and proposals that you brought to the table, and they will all be considered. So I want to thank you all very much again for participating. And committee members, I want to tell you that I've just been notified that our colleague Arnold Chan passed away. So I just wanted you to know that. And he's suffered for quite a while, and he passed away last night. So
Take a minute of silence, maybe when we adjourn.
We'll take a minute when we come back at 10:45. So, okay, again, thanks very much. Okay, we'll reconvene our meeting number 67, and as we ended our last session, we learned that our colleague Arnold Chan had passed away, so we're going to just take a moment, consideration and remembrance of Arnold, put up a long fight, and passed away last night. Okay. Well, Arnold never stopped. He worked right until the last minute, and he never slowed down, and was always present and put up a good fight. Anyway, here we are on meeting number 67, and we're studying Bill C-45. We welcome our guests and our panelists. We're pleased to have you. I think we're somewhere in the 80th number of panelists we've had so far, and they've just been incredible panelists and brought great knowledge and background and experience for us. So I'm going to introduce our panelists here today from Brazo Cellar, Trina Fraser, a partner. Hi, welcome. From the Department of Employment and Social Development, Brenda Baxter, Director General, Workplace Directorate, Labor Program, welcome. Eric Advocat, Senior Director, Occupational Health and Safety, Workplace, welcome. And from Fasken Martineau, Norm Keith, partner. Thank you very much. Now, the way we do this, each organization has a 10-minute opening statement, and then we go to questions after that. But we'll start with Trina Fraser. We would start with Trina Fraser.
That Ms. Baxter was going to begin,
all right.
if that's
fine.
okay.
Okay.
Merci, Monsieur le Président, les membres du comité.
Thank you, Mr. Chair, members of the committee. I'm very happy to appear before you today to discuss workplace safety. I'm accompanied by my colleague, Eric Avocat, Senior Director, Occupational Health and Safety.
Labor matters in Canada, including workplace safety, is shared between the federal, provincial, and territorial governments. For more than 100 years now, the labor program has been protecting the rights and well-being of both workers and employers in federally regulated sectors, which represent approximately 8% of Canadian workers. This includes creating and maintaining safe and healthy workplaces. Dans le cadre de son mandat,
as part of its mandate, the labor program is equally responsible for the administration and enforcement of the Non-Smokers Health Act.
The purpose of the Non-Smokers Health Act and the Non-Smokers Health Regulations is to protect non-smokers from secondhand smoke in federally regulated workplaces, including the federal private sector, federal crown corporations, designated federal agencies, the Royal Canadian Mounted Police, the Federal Public Service, and Parliament, and on certain modes of transportation such as ships, trains, and aircraft. The administration of the Non-Smokers Health Act is the joint responsibility of the Minister of Employment, Workforce Development and Labour, and the Minister of Transport. The former is responsible for the Act's application to federally regulated workplaces, and the latter for its application to common federally regulated transportation carriers. The Minister of Employment, Workforce Development and Labour is solely responsible for designating inspectors to ensure compliance with the Act. Fines for offences under the Non-Smokers Health Act range from $1,000 to $10,000 for employers and $50 to $1,000 for individuals. And since 2007, so the past 10 years, there have been a total of 39 complaints under the Non-Smokers Health Act, and with an average of less than 2 per year in the past 5 years. And this represents 1% of all of the health and safety complaints under just one part of the Canada Labour Code, so a very few number of complaints under this Act. À ce jour, aucune poursuite.
To date, no prosecution has been filed under the Non-Smokers Health Act.
Act and the Non-Smokers Health Regulations were introduced, again in 1989, public views with regard to smoking and secondhand smoke have greatly evolved. In 2007, in light of scientific evidence on the danger of secondhand smoke, the Non-Smokers Health Regulations were amended to eliminate provisions allowing for the designation of smoking rooms and areas in federally regulated workplaces. Since then, all persons, including employees and members of the public, have been prohibited from smoking in any federally regulated workplace and on certain modes of transportation, except in highly restricted smoking areas, such as living accommodations or motor vehicles to which only one person has access during a shift. Plus récemment,
more recently, new amendments to the Non-Smokers Health Act were proposed under Bill S5, an act to amend the Tobacco Act and the Non-Smokers Health Act, and to make consequential amendments to other acts.
5 would amend the Non-Smokers Health Act to add a prohibition against the vaping of tobacco in federally regulated workplaces and on certain modes of transportation. In addition, the Task Force on Cannabis Legalization and Regulation recommended that federal, provincial, and territorial jurisdictions extend the current restrictions in place for smoking tobacco to the smoking of cannabis. As a result, amendments to the Non-Smokers Health Act are correspondingly being proposed through Bill C-45. Bill C-45 proposes to amend the definition of smoke under the Non-Smokers Health Act to include cannabis. Provincial and territorial governments would be responsible for deciding whether to restrict the smoking and vaping of tobacco and cannabis to other public spaces. Should both these bills be approved by Parliament, the smoking and vaping of tobacco or cannabis would be regulated under the Non-Smokers Health Act in all federally regulated workplaces and on certain modes of transportation. Again, trains, planes, and boats where they cross provincial or international boundaries. The changes we are proposing will assist in the protection of employees' health and safety at work under federal jurisdiction purview. Thank you, Mr. Chair.
Yeah, we're going. Okay, now we go to Mr. Keith. 10 minutes.
Thank you, and good morning. I'm going to, in a moment, take you to 5 recommended changes to the legislation that, in my view, having advised and represented employers and employer associations on this issue for many years and having written a book on the subject of alcohol and drugs in the workplace, I think are essential if, in fact, recreational marijuana is to be legalized on July 1st, 2018, as the bill proposes. Essentially, at the present time, there is no actual or proposed legislative framework that will be necessary to prevent this amendment from resulting in injury, accident, and death. A little bit of background, and I filed this in the brief, and the footnotes are available for the facts I'll provide you with. In Canada, the most recent numbers of accidents in 2015 was over 232,000 lost time accidents with 852 fatalities. There are approximately just under 3,000 motor vehicle fatalities every year in Canada. What we know from the Colorado experience is, at least in the first full year after recreational cannabis was legalized, the number of motor vehicle fatalities, including transportation workers, increased by 225%. It over doubled. Unless there is a rigorous legislative framework that is not yet proposed in the legislation added, tragedy will be the result of this amendment allowing recreational marijuana to be legal in Canada. The other statistics that employers are concerned about are as follows. 93% of businesses deal currently with substance abuse in some form on the part of their worker. This is a serious and important issue. Over 38% of workers' compensation claims are related to alcohol or drug abuse. The risk of a worker having an injury, and again, the footnotes provide the references for the authority, is 2.7 times higher if they're involved in alcohol or substance abuse. The presumption of my submission is that legalization of recreational marijuana will not only increase social acceptance and use, but it will also exacerbate what my clients are seeing already, and that is an increased use with the view that legalization is around the corner. The courts, in fact, the Chief Justice, when I was arguing the Irving Pulp and Paper case, suggested to me and other counsel in that random alcohol testing case that the legislature and Parliament is the better place to establish a comprehensive framework than to deal with this case by case litigated in the courts and before arbitrators. So let me provide you with, and again, hopefully the brief has been provided to members of the committee, with the 5 recommendations that we would ask you to consider that are essential in our submission to making sure that workplaces and workers and the public affected by workers are safe. Canada Labour Code obviously deals only with a limited number, about 8 or 9% of workers, but there's a duty there that exists in every other provincial statute, and that is a duty to protect worker health and safety. Workers also have duties, but the first recommendation is to acknowledge the reality that exists today and will be exacerbated by the legalization of marijuana, is that there is no current prohibition against a worker coming to work under the influence of cannabis or another drug. So the first requested recommendation is to prohibit workers from coming to work under the influence of cannabis or other drugs unless they have medical authorization and thereafter with consultation by the employer. So that's a common sense suggestion that we think should be considered. Secondly, safety-sensitive positions are discussed and debated without a legal definition. A safety-sensitive job is obviously a pilot who takes us in the skies and has to be sober. A truck driver driving on an international or an interprovincial trucking route, so therefore it's federally regulated, or perhaps a provincially regulated tower crane operator. So a safety-sensitive position is yet to be defined under the Canada Labour Code and needs to be, because things flow from that. Greater scrutiny, greater regulatory oversight needs to be applied to safety-sensitive positions. So there needs to be, our second recommendation is a definition for this phrase, safety-sensitive position. Thirdly, there needs to be a positive duty we submit for workers, supervisors, managers, who have a lawful prescription for medical marijuana to deal with a medical condition or other drugs, to report that to the employer if they fall within the safety-sensitive position. So there needs to be a connection there for disclosure, transparency, and later I'll make the point, protection of those workers to make sure they're not unfairly discriminated against. Fourthly, and this might be the most controversial of what I'm going to recommend, is the idea of testing for workers randomly for cannabis and other drugs if they occupy a safety-sensitive position. The law, as you may know, has been set not by Parliament's leadership, but by the courts reactively in case-by-case analysis. The most recent decision on alcohol and drug testing is the Irving Pulp and Paper case. I was involved for an intervener on that file, and that's where the Chief Justice made the comment that, Mr. Keith, wouldn't it be better if the legislature took leadership on this issue to set a legislative framework as opposed to reacting case by case? I couldn't disagree with the now former Chief Justice, but they went on to hold that random alcohol testing, where there's a clear legal criminal code threshold for impairment, was not permitted in a dangerous pulp and paper place down in New Brunswick that was 3 blocks from a public school, because there weren't enough cases of people causing accidents when they were drunk. That essentially is the employer's view of the ruling in Irving Pulp and Paper. It's troubling. However, Irving Pulp and Paper says you can test if somebody does have an accident post-incident, or if the employer determines that they are impaired at work. But why do you have to wait? Why can't you, as we do with RIDE programs around holiday season, have a deterrent and detection process of random testing in workplaces? But the suggestion is for only safety-sensitive positions, so there's not an over-inclusive net being cast. Lastly, to complement this and the reporting obligation, we're recommending that the Canada Labour Code be amended to require workers to report if they're in fact taking drugs lawfully, is an accommodation provision. Some might argue that there is implied case law about the duty to accommodate, and that's true, there is. But I think clarity as part of a comprehensive legislative framework to give employers and unions the legal obligation to accommodate workers who declare that they have a dependency or an addiction problem, and they also fit within the safety-sensitive regime, so that if the employee self-declares they have a problem, they're protected, they have job security, but they'll be assisted in hopefully a constructive rehabilitation program. I think the requirement, as in Elk Valley Coal, the Supreme Court decision, dealing with the duty to accommodate should be if you in fact self-disclose before you cause the accident, because after that, then there is accountability that an employer needs to be able to evoke for the worker. Just to wrap up then, hopefully these 5 recommendations will be looked at as part of a more comprehensive workplace safety legislative framework that will be fair to workers, protect workers from themselves, from other workers, and reduce the legal risk that employers are unfairly given when, in fact, they're blamed for not preventing a worker from coming to work sober and safe. Clearly, this legislation is a controversial one to legalize recreational marijuana. I'm not commenting on that, but given that it's a very complex social experiment, assuming the government goes ahead with it, then the workplace safety issues and the recommendations we proposed hopefully can be well received. Thank you.
Thank you very much. And now we go to Ms. Fraser.
Mr. Chairman and committee members, thank you for having me here today. I'm going to approach the panel topic of workplace safety from a different perspective, from the employee perspective, and specifically a specific group of employees being the thousands of workers across the country who currently work within the illicit cannabis industry. It is estimated that over 13,000 individuals in British Columbia alone work in the illicit cannabis industry. This represents an estimated wage amount of over $600 million. These are obviously estimates only, and we don't have reliable statistics, but I think it's safe to say that across the country we're talking about tens of thousands of workers, whether involved in cultivation, processing, or sales of illicit cannabis. The safety of these workers is threatened in a number of ways. In the retail sector, dispensary workers face a threat to their personal safety through the risk of robbery. Dispensaries are a ripe target for thieves due to cash on hand and due to the fact that thieves know that there's a good chance the robbery won't even get reported to the police. There may be environmental risks associated with working in an unregulated grow-op or lab. And of course, the personal liberty of these workers is threatened by the risk of criminal prosecution. So what I'm here to suggest to you today is that the risk to these workers can be mitigated, and while simultaneously advancing the objectives of legalization by providing a meaningful opportunity for these workers to participate within the legal market. And this can be done by codifying within the bill and the regulations to the bill a tolerance for applicants with certain prior illicit market participation. Section 62 sub 7 of Bill C-45 provides that the minister may refuse to issue a production license if the applicant has contravened the Controlled Drugs and Substances Act, the CDSA, in the past 10 years. So that in and of itself excludes anyone who has been convicted of producing, trafficking, or even possessing cannabis in the last decade. The bill also provides that additional grounds for refusal may be prescribed by regulation. We don't yet know what those regulations will look like, but we can look to the current Access to Cannabis for Medical Purposes regulations, the ACMPR, for a sense of this. In Section 26 of the ACMPR, not only is the minister required to refuse to issue a production license where the CDSA has been contravened in the past 10 years, but the minister is also required to refuse to issue a license where law enforcement has provided information which raises reasonable grounds to believe that the applicant has been involved in the diversion of a controlled substance to an illicit market. The use of the words reasonable grounds here is important because it means that a conviction is not required, charges are not even required, a mere reasonable suspicion is sufficient to result in the refusal of your application. In addition, the ACMPR provides that all directors and officers of a licensed producer, as well as certain key employees, must be security cleared. Section 67 of Bill C-45 also refers to security clearances, so it appears that this concept is being brought forward into the Cannabis Act. And again, under Section 92 of the ACMPR, mere reasonable grounds to suspect that the applicant has been involved in the diversion of a controlled substance to the illicit market is a factor to be taken into account by the minister in deciding whether to grant a security clearance. So under the ACMPR, clearly we have a framework that essentially denies prior illicit cannabis market participants from obtaining a license to produce cannabis, medical cannabis, and also precludes them from holding many key positions with a licensed producer. This also creates a chilling effect on licensed producers from hiring those with prior cannabis convictions. And it appears that we are heading in the same direction with Bill C-45. This can be contrasted with the approach that's being taken in the United States. Of the 8 U.S. states which license the production of recreational cannabis, 7 have legislation which contains what I would refer to as amnesty provisions regarding prior cannabis convictions. Massachusetts, Nevada, and Colorado deny licenses to those with a prior felony conviction, but they expressly exclude certain marijuana offenses from that rule. Oregon, Maine, and Washington exclude certain marijuana convictions completely from the consideration of whether a license should be granted. And the draft regulations in California are the most inclusive. They provide that a prior conviction for the possession, sale, manufacture, or cultivation of a controlled substance not involving minors shall not form the sole ground for denial of a license application. And at least 11 states that have legalized medical cannabis also have some form of amnesty provisions in their legislation. So what I submit to you is that this is the direction we need to head in Canada as well. We need to consider and debate the parameters of acceptable prior illicit market participation. Many of these individuals would embrace the opportunity to operate legally. They would comply with regulations. Granted, some would choose to continue to operate outside of government, outside of the law, and so as not to be burdened by government regulation, and so be it. They would be dealt with on the offense and enforcement side of the equation, but there should be an opportunity to comply and participate. At the very least, mere possession offenses should not inhibit legal market participation, but what I'm suggesting is that we should go further than that, because the cannabis entrepreneurs that I'm referring to are producing and they are selling cannabis products, so they would still be excluded. We need a more nuanced approach to the issue of licensing and who should be prohibited from obtaining a license. For example, we can exclude those convicted of offenses that involve young persons. We can exclude those with established connections to organized crime. We can exclude those convicted of offenses that involved guns or violence or controlled substances other than cannabis. We can build reasonable parameters that exclude those who are actually likely to be a threat to public health and safety, while also providing an opportunity for those who would not. I am a business lawyer. I've advised the medical cannabis industry since it was privatized 3.5 years ago with the MMPR. I have seen the shortcomings of this system, but I've also seen the potential of this industry. Current licensed producers are not averse to an inclusive industry. What they want is for everybody to be on a level playing field and to be subject to the same set of rules. So I'm certainly not suggesting this from the perspective of being a cannabis activist, and I'm not suggesting that illicit market participants have somehow earned the right to participate as a reward for their civil disobedience. I'm suggesting it because I believe it's the only way legalization is really going to work. The stated objectives of the bill include the reduction of the illicit market, and it attempts to do so by imposing criminal sanctions on those operating outside of the legal framework. But this in and of itself will not work. We know this because it hasn't worked. Those who are excluded will continue to operate outside of the law. A better approach would be to design a framework for legalization which permits the inclusion of prior illicit market participants, This will enhance the public health and safety objective by subjecting those individuals to government oversight and regulation. It will increase tax revenues as these individuals report and pay tax on their income. It will allow the legal industry to benefit from the breadth of knowledge that is possessed by these individuals, and it will protect these individuals by allowing them to work in a safe, regulated environment free from the risk of criminal sanctions. If we fail to create an inclusive cannabis industry, the black market will thrive. And if it thrives, cannabis will continue to be easily accessible to minors. The public health and safety objective of restricting access to unregulated cannabis products will be compromised, and we will continue to place an unnecessary burden on the criminal justice system. I would also add that a meaningful opportunity to transition into the legal market involves having regulations which are not so onerous that they effectively exclude small operators. The Task Force on Cannabis Legalization and Regulation, in fact, recommended that the government encourage market diversity by creating a space for smaller producers. Under the ACMPR, what I am seeing is that the cost of compliance, in particular relating to security requirements, is a real barrier to small-scale production. And a meaningful opportunity to transition also requires expanding the scope of cannabis products to include edibles and other derivative products. This is what the market wants and demands, and it will be required in order to transition the existing producers of these derivative products into the legal market. Thank you.
Thank you very much. Okay, now we'll go to our first round of questions, which are 7 minutes long. We will be in English and in French, and your translation equipment is right there if you need it. So we're going to start with Mr. McKinnon.
Thank you, Chair. Mr. Keith, so you said there's no legislative framework to prevent injury and accidental death. And I'm sure you're aware of C-46, which study commences next week. Deals extensively with impaired driving offenses, and provides new tools for detecting and testing. Is that not part of the legal framework, legislative framework you're looking for?
In my opinion, sir, no. The companion bill seems to assume that it's only the public that might be harmed or killed by somebody under the influence of cannabis. It ignores every working Canadian that goes to work every day, especially in and around safety-sensitive positions. Since there is going to be no threshold measurement for cannabis impairment yet, and the technology may be evolving, it's difficult to always persuade people that you can do a random test in the workplace that's meaningful. But the TTC's done it. The courts have upheld the random TTC alcohol and drug testing program, but they're in litigation, and their litigation may go for years and may, if it goes all the way to the Supreme Court of Canada, take another decade. Workplace stakeholders need a framework, and if it's a federal bill that legalizes recreational cannabis, it only makes sense that even though federal jurisdiction doesn't extend to overall workplaces, the federal government should also provide leadership for the serious safety risks. I mean, I could bore you with example after example. I've got 3 cases currently that I'm retained on in the courts where somebody died because they were impaired. And in all cases, it's the employer that gets blamed. So there needs to be a more rigorous review, and I would suggest these amendments to the Canada Labour Code specifically for workplace safety. The bill on the traffic side deals with public safety to some extent and a little bit indirectly for transportation workers, workplace safety. But you don't want to be walking near a construction site where there's a tower crane where a worker is not screened or worries about cheating the system by being stoned at work and dropping a concrete bucket on somebody's head. It's a terrible thought. I deal with it more than I'd like to in my practice. And to just say, well, it's under the general duty clause for employers, you have to find a way to do it when the courts are not generally permitting random testing, I think misses the point that there is increased already use and acceptance, especially in the construction industry in Ontario. And it will get more prevalent as you have legality and as you have increased social acceptance. So I don't think current legislation addresses the concerns I've raised.
I take your point regarding the concerns for safety in the workplace. There's nothing in this legislation that legalizes impairment. I mean, everything that was, every instance, every case where it was illegal to operate some piece of equipment or machinery or vehicle impaired, that law is unaffected by this. So I guess I'm curious why you need additional protection or additional powers at this point that are not already present. Can you not detect, like what do you do with people who come impaired to work under prescription drugs or lack of sleep or alcohol?
Not sure they're all fairly comparable to being impaired by cannabis, but an employer has an overarching duty, as I've mentioned in my brief, under the Canada Labour Code and every provincial statute, to have a safe workplace for all workers. That's fine, and that's been there for a long time. But if you don't have the tools to deter and detect, it's like putting up speeding signs on the 401. You can't go faster, and having no enforcement. And you will arrest people after there's an accident, an injury, and a death, and you will charge people. So there's a little bit of enforcement. But if there's no proactive enforcement, as there needs to be on our roads, it's the same thing. You need better proactive tools with the greater likelihood of increased use and social acceptance of cannabis. And that, I think, reasonably and fairly falls within the random testing, the most controversial of the suggestions. The United States does it, Europe does it, the Far East does it. We're out of step with most modern liberal democracies by being overly worried about implications and privacy concerns. Those are concerns that can and should be respected in any testing system that's legislatively approved, and it should not be permitted, the legislative system that allows testing, for employers to run roughshod or to use that for ulterior motives. But I don't see why the 5 suggestions we've made aren't essentially common sense if you have a more drug-tolerant legalization kind of society, which we're moving apparently towards. So those are additional thoughts.
I guess I wouldn't characterize it so much as a drug tolerance, but a recognition that the criminal sanctions don't work to control drugs and control the markets. However, still, I'm confused a little bit. I take your points that certainly the Labor Code needs to address some of this to some degree. But people operating a forklift, people operating, trucks and so forth in a construction yard, they're already subjected to limitations. They would be under they would be affected by C-46, right?
They're in a private property. They wouldn't, with respect. They wouldn't.
Well, operating of a motor vehicle while impaired is illegal no matter what happens.
But it won't be, all I'm saying is at a practical level, it will have no benefit or effect. Because the obligation is still going to be the overriding obligation of the employer to have the safe workplace. If an employer thinks somebody's impaired, are they going to call the police to their workplace to do their job for them? The labor regulator, federal or provincial, will intervene. There'll be a union grievance. The matter will be before the courts for years. If there's not a legislative framework that, from a common sense perspective, says we want workers to be safe and sober, period, and we need some tools to do it, that's really all this suggestion is. I don't think the goal that you're suggesting is any different than mine, but I don't think the companion legislation, Bill C-46, addresses these suggestions we've made about the Canada Labour Code amendments.
All right. Dr. Carey.
Thank you very much, Mr. Chair. And again, great panel. Wish I had more time with you, but I'd like to start off, Mr. Keith. I was really happy that you brought these things forward because it parrots, I'm from Oshawa, and we have a lot of unions, a lot of labor in Oshawa, and it parrots what I'm hearing from labor interests as well. There's a few other things that they brought up with me that you haven't included, and things along the line like blood testing, DNA collection, who would own that management, cost, who pays for compliance. There's new technologies, or there's other technologies, I guess, for alcohol where you can actually put it on a heavy equipment. The person has to blow into it, and then it will operate. If these new technologies come out again, who pays for that? What's the data collected from that? Who owns that? A lot of questions with this piece of legislation, and you pointed out just a few inadequacies, and quite rightly you say it's a complex social experiment, but it's also a poorly thought out implementation of public policy. And I think it's really important, by having witnesses here today, that we can really look at it and say, look, the responsibility of government is the health and safety of Canadians. And in this panel, I think it's the only one we have on looking specifically at workers. So if I could ask you a few things here. We know that smoking cannabis over the weekend, it can be in your system for days, and we've heard it can be a cumulative effect even weeks later. Now, will this be problematic if mandatory testing becomes a standard in the workplace? Because again, impairment. Who's going to define impairment? You mentioned the blood levels. There's a lot of inconsistency there. So will it not be hard to punish or reprimand an employee for having cannabis in their system for something they were doing legally over the weekend or in the evening in the privacy of their own home? How do you think, can you give us some advice on how that should be managed?
I'm not a doctor, and I don't even play one on TV, but I've done a lot of reading in the area. What I'd encourage the committee to look at is the injunction decision of His Honor Judge Morocco and the TTC policy fitness for duty. What it essentially does is it takes a consensus of medical experts on cannabis impairment from around the world, gets a consensus statistical average of what the THC readings are, tetrahydrocannabinol, the active psychoactive ingredient in marijuana and hashish, and then it doubles it. And it says anything below that threshold is considered a negative, everything at or above it is a positive. To protect the privacy concerns of workers and union leaders, they do not disclose that information to the employer. This is the standard for all testing in Canada, limited as it is. Then it gets reviewed by a medical review officer, and there's sometimes a legitimate explanation and or a medical authorization, also in the vernacular called a prescription. And that conversation takes place between the worker and the medical review officer, a doctor. And then it's only after that assessment is done to protect the privacy and the medical personal interests of the worker that it may be reported as a positive to the employer. If the employer gets a positive result, the worker, with a union representative for the unionized, gets to advise or self-declare if they have a dependency or an addiction. If they do, human rights legislation across Canada requires the employer to treat it as a disability, and they're accommodated to the point of undue hardship, which is fancy legal talk for saying they're sent to rehab. If they recover and they're sober, they can come back, and that often is happening today. But the problem is there is no detection or deterrent effect because of the inability to have random testing, which is the law. The Supreme Court of Canada set down in Irving, that is being tested by the TTC. Yep. So all of that litigation...
Who covers the cost of that?
I beg your pardon?
Who covers the cost of all that?
Well, the employer at the TTC, from talking to their chief safety officer, bears the cost, the entire cost of the program. So it's you and I as TTC riders if we're in Toronto.
All right.
It's the public.
All right. That I've heard, concerns about people who operate. You mentioned these safety-sensitive positions, but even positions like forklifts, taxis, school bus drivers. And what my colleague was saying, intoxication like with alcohol, breathalyzers are inexpensive. You get a really quick result with it. But cannabis right now, there's no real framework. And even these swab tests that are yes and no will only tell if it's in the blood. Then you got to get a blood test for intoxication levels. So I was wondering, what is going to have to be done differently in the workplaces, especially those that require operation of heavy machinery. Now, what will they have to do differently to ensure the safety of employees?
A lot of statistics, largely out of the U.S., indicate that as soon as you have a random alcohol or testing program in place, use goes down by more than 50%. Allowing testing will reduce the risk for everybody, period. But then you get to the problem about somebody who's tested. Is the employer going to pay for it? Generally, yes, if they want to. Should they be authorized to test everybody? Our suggestion is no, it's just a safety-sensitive position. In other words, a position where somebody can injure themselves seriously or others or the public, like a TTC bus driver or a pilot. The Sunwings case that's very public is a disturbing one because it took flight attendants to turn in a drunk and incapacitated pilot who was not otherwise subject to testing. None of us want to think of getting on a flight where you don't have confidence in the flight crew. So in terms of the mechanism, I think it's going to be, a choice that employers make where they have dangerous workplaces with safety-sensitive positions. But employers will probably choose to invest in and bear that cost because the cost of injury on workers' compensation costs, the moral imperative, the loss of a good worker, but also the risk of prosecution. Not sure if you're aware of the Metron construction case where 4 workers died, 3 were all impaired heavily with THC on Christmas Eve 2009. The employer was punished by a trial judge. They received a large fine, $200,000. They were further punished because they failed to prevent workers from being stoned on the job. That's what the Court of Appeal said. That's one of the 3 reasons in the Metron case. I've given you the citation. In other words, an employer has a real financial risk if they don't prevent workers from coming to work sober and safe. And so that's part of the motivation of a good employer. They care about their workers, they care about the public, they don't want it to be harmed, but they also care about their bottom line. It's bad business for workers to come to work under the influence of cannabis or other drugs and cause accidents, injuries, or worse.
In Canada today, though, can you force me to give my blood for testing?
No. The Supreme Court of Canada said except in extremely rare circumstances or if the legislation was amended, you can't do that. But I don't think that's the main point of testing. People get a little bent out of shape about testing, especially on the union side of the debate. And the main point is to deter, to discourage, to say, look, we don't want you to come to work under the influence. And by the way, you might be subject to a random test. You don't know when it's coming, so just don't do it. Please don't do it. But like the speeding sign on the 401, the 403, or wherever you're driving in Canada is not enough. You need to know there's a police officer with a radar gun who might catch you randomly and say, slow down, stop, and here's a reminder, please pay the ticket.
So time's up, sorry. Mr. Davies.
Mr. Chair, and thank you to the witnesses for being here. Mr. Keith, isn't the reason that the courts strike down random testing regimes, even in safety-sensitive positions, because they find that they violate Canadians' constitutional rights?
No. The decision in Irving Pulp and Paper essentially said the employer had 2 choices if they wanted a random alcohol. This is only a random alcohol testing case. One, you either consult with and get agreement from the union. The union said no. And I'll come back to that point, which is an unfortunate lack of union leadership, in my opinion, on the issue. They said if you don't get union agreement, then you have to be able to prove that your testing will be rationally connected to the risk associated with the particular workplace. So the facts in Irving were, I think there were 3 accidents caused by people drinking in the course of 5 or 6 years. That wasn't enough. In the Suncor case in Alberta, soon to be released by the Alberta Court of Appeal, there were 3 fatalities and 8 accidents in a 10-year period. The arbitration board said that's not enough. So what the courts are saying is that the union's privacy interest, say vague, somewhat reliant upon Section 8 of the Charter, but because it's not state action, employer versus worker, it's not a constitutional issue, in my opinion. They're saying you have to have more evidence, more accidents, more property damage, and possibly more death before you get to implement unilaterally that kind of implementation. There's a great dissent by a Court of Appeal justice in Alberta that said, this is foolishness. This is madness. Why are we going to have a body count, an injury count of workers before we can protect workers?
And though that's a dissent, the majority didn't agree with that.
And the majority, you're right.
I think you've said that the problem is that the employer could not produce enough evidence to establish a rational connection between testing and the purposes. And that's based on extensive evidence, full presentation, all the way to the Supreme Court of Canada.
Yes.
And you anticipated my next question because, of course, the Charter only applies to governmental actors, and these were private sector employers. But let's move to privacy. I mean, that is the as parliamentarians, we're seeking a balance here, but it's also our role to nurture and cherish Canadians' well-established privacy rights. So, as you pointed out, that was an issue as well in the case that before an employer has the ability to randomly take a bodily fluid from a person, there's got to be, in fact, the burden is on the employer to establish that there's a sufficient ground for that. And frankly, the employers in this country have not been able to establish that on an ongoing basis, at least according to the Supreme Court of Canada. I think my colleague asked you about the problems of distinguishing between present impairment and past use, which I understand is a particular issue with cannabis. I mean, alcohol is a bit different because you can get a blood alcohol reading that is a reliable measure of present impairment. But is it not the case, Mr. Keith, that with cannabis, that it measures the I can't remember the term. Well, the substance is broken down by THC in the blood, so you can't really get an effective measurement of present impairment versus prior use. So someone could smoke a joint on the weekend, come to work on Monday morning, be tested, and what would that tell you?
I'm not a medical expert. The oral fluid testing technology is advanced beyond what you've just suggested as a methodology. Certainly THC, depending on how much you've consumed, can stay in the blood for 21 days. That's clear. The common rule of thumb is that you can sleep off a cannabis hangover. Generally, I'm told by doctors that's true, but not always. Rarely, though, is cannabis consumed without alcohol or other drugs. Mr. Stewart, who had his accident in the Elk Valley coal case, had to smoke a few marijuana joints before he came to work, he said, because he had to take the edge off the cocaine. They often go together. So it's a complicated issue. But what the TTC policy, and I'm not an advocate or here as counsel for the TTC, but what their program does, as I said, it does 2 samples for privacy and reliability, just like drug testing and cycling.
Present impairment, past impairment.
Right, and I'm going to address that. Sorry, I'm getting around to it. Not as quickly as I should.
I have limited time, so I want to get questions.
Exactly.
Fraser,
so it can measure present impairment, the oral fluid testing.
That's okay.
That's my understanding.
I see. Ms. Fraser, you commented, I think articulated well, the danger and negative consequences of keeping cannabis products illegal. And you, I think if I have your evidence correct, you suggested that that would apply to edibles, concentrates, and other non-smokable products. Given that Colorado, Washington, and Alaska have all established effective regimes for regulating those products, do you see any reason why this legislation before Parliament shouldn't be amended to include edibles and concentrates with the appropriate regulations concerning packaging, labeling, concentration, et cetera, as Colorado has done?
It should be. And my understanding is that is the intention, and it's more of a timing issue than anything else as to why that's not included right now. But my concern is that throwing millions of dollars at enforcement is not going to solve the problem of the black market and dispensaries that exist right now. We need to look at why do they exist. They exist for a number of reasons, because they provide enhanced access to cannabis products to people who want them or need them, and they provide the type and array of products that people want. So by limiting the availability of cannabis products legally to just being dried cannabis and cannabis oil, we are still leaving a wide array of products that there is clearly a demand for that the government is not going to be providing through legal channels. And so they will continue to seek them and access them through illegal channels. So legalization must include a wider array of products. Yes, the concerns about consumption by children or accidental overdosing can all be addressed through prudent packaging and labeling and product type regulations, and we need to get to work on that right away.
Okay, thanks very much. Now we go to Mr. Ayoub.
Merci, Monsieur le Président.
Thank you very much, Mr. Chair.
If you need the hearing. Monsieur Keith.
Mr. Keith, your recommendations, several of them are controversial. As you said, the bill seems to be kind of some of a controversial experience, but your recommendations are also controversial, in my opinion. In terms of good sense, are these recommendations have only been put forth since the discussion has come about legalizing cannabis, or have they been in place in the past for other substances?
Question. I'm not aware if they, especially all five together, have been presented before to a federal parliamentary committee or provincial legislative committee. But I think if controversy complements controversy, perhaps to calm the fears of many employers, and they are quite worried about being able to manage the risk associated with the legalization of recreational cannabis, I think now is a good time to embrace these amendments that won't, of course, only deal with cannabis, but also deal with other drugs. Canada, as you know, has some of the highest, if not the highest, use of cannabis in the world. That might be a good thesis to look into why, but that's not what we're here to do with. I think in looking at the present condition, as well as the anticipated greater social acceptance and use and its overlap or overflow to the workplace, it's important to have a legislative framework. It won't solve all the problems, it won't prevent all the accidents, it won't stop all the litigation, but it'll do a lot to assist all three of those problems.
Merci pour la réponse.
When I talk about it being controversial, I mean that when it's generalized, when the Act and the amendments are generalized, and I look at your first recommendation, for example, the Labor Code, this can be applied to all workers. I have a hard time understanding how can we ban everyone. We're talking about cannabis, but what does being impaired at work mean? What do all the other legal drugs that are accessible in pharmacies, people take them without prescription sometimes, without declaring it? What do we do right now to make all workers safe? These situations are already happening. In my opinion, there's various degrees of dangerous or less dangerous situations. Killing a fly with a hammer, that's my analogy. Having a really widespread act seems to be doing this. We don't want to have the very harmful effects. Obviously, we want everyone to be safe, but what's your opinion on this kind of extreme?
It's simply putting in a policy statement that workers ought not to come to work under the influence of cannabis or other drugs, either A, without a medical authorization or prescription. That answered one of your questions, and B, with employer approval. Certainly, in non-safety sensitive positions, there is a lower worry about it affecting safety. It might affect productivity, I'm sure it does, but that's a different problem that the employers will have to deal with. But I think the point behind recommendation number 1 is it's more of a symbolic statement to say to employers and to workers that it's not a good idea to come to work when you're not sober. But if you're under the influence of a prescription drug, that's fine. You should report discreetly to the HR department. They'll have to keep it confidential. And if you have some sort of medical reaction, we're at least aware. Many employers have a policy that reflects what I'm suggesting, but it's certainly not the law. So I don't think the health and welfare concern that this represents of workers and their safety is a hammer. It's more like a gentle net to catch the fly and set it free.
Ça dépend de la perspective.
Depends how you look at things. It depends what your perspective is. So let's talk about legalization. Right now, people in good faith reveal that they're using cannabis. And I say they do this in good faith because there's still also some controversy about making the information public, especially to an employer, particularly when you do an interview to get a new job. People are obviously hesitant to reveal that they use cannabis. But we do have statistics that show there is some level of use. But by legalizing it, do you think that people will be more open about declaring their cannabis use? Because then it would be like saying, yes, I take aspirin, I take some medications, I'm doing something that's legal, and there'll be no more shadow of illegality around it. Wouldn't that just not reassure people rather than adopting a more constricted law that would employers could have discussions with their employees and be able to fight the negative effects of all types of medications by having this openness?
I'll restrict my answer more to the mandate of workplace safety, if I may. I think the focus on a safety-sensitive position and more information and more potential testing is, again, to focus on the welfare of and safety of the worker. An employer generally is neutral on the politics or the legality of any substance, including cannabis. What they need and want to know is that workers will come to work, they'll be sober, they'll be able to work safely, they won't hurt themselves or anyone else or the public. That's the key focus of these suggested amendments to the Canada Labour Code. The other aspect of your question, I think, is a little broader than my mandate, but I think there's not a great deal of stigma out there, whether you accept this or not, of having a medical authorization for marijuana. It's been available since 2000. It's funded by workers' compensation boards when people need treatment for a workplace-related injury. And, in fact, it's talked about freely and openly. The legality-illegality issue is not the primary focus of worries of concerns. It's the effect it's going to have on safety in the workplace and the fact that it's only the employer that gets blamed when there's an accident if somebody's impaired.
Time's up. And now that completes our first round. We'll go to the 5-minute round, starting with Ms. Gladue.
Thank you, Chair, and thank you to all of our witnesses. Mr. Keith, I think you have pointed out a real gap in the legislation that will result in workers and employers not being adequately protected when marijuana is legalized. And I say that because I think I have some experience in this area. I was the Director of Engineering and Construction at Suncor. And so we had a drug policy, which was a zero-tolerance policy that we wanted to implement. I live in a reasonably small community. We have a lot of tradespeople, and we're well aware of which tradespeople are chronically using marijuana, okay? But we were unable to do anything about them being on the job site and do any assessment. There was no random testing allowed. There was no mandatory testing allowed. And I would contrast that with some of the best practices that we see elsewhere. I also worked in the States with Dow Chemical, Shell, ExxonMobil, a number of organizations. And they actually not only do random testing, which does give the result that you have indicated in terms of the reduction, but a lot of times there's a mandatory health test where they do drug testing for cannabis before somebody is allowed to join a project construction job. So I think there are examples out there, and I would like to see some legislation drafted in here. I guess if we decide that we're going to do testing then, I wonder about the cost that this will put as a burden on organizations, because then they'll have to either, at Suncor, if somebody was using like a prescription drug, they had a duty to report to the health nurse. So we actually had a nurse on duty who could do a blood test. But if you didn't have that, then how are we going to get those resources in place? And I think the other concern I have is with the data you mentioned on WSIB, the 38%, of incidents are related to that. It's a very high number of claims that are refused. And as cannabis comes in and there is such a controversy about whether you're really impaired or not and what the technology can do, I worry that that will result in further WSIB claims. Could you talk a bit about the resourcing impact to the businesses?
I think any amendment to the Canada Labor Code that we're suggesting that authorizes employers with workers in safety-sensitive positions only to do random testing, again, is primarily for the purpose of deterrent, but also for detection. But there's a cost associated with that, as you point out. I think employers may not all be happy to spend that kind of money. They may want to share that cost. That's permitted if they're unionized by negotiating a term in the collective agreement. But it's unlikely, in my opinion, they'd ever get that agreement. I think employers who are probably reluctant would be smaller employers with less resources. But I think most employers, especially with dangerous jobs in safety-sensitive positions, realize that preventing accidents is a huge, not only legal burden that they avoid, but also a huge cost burden. And so I think the old saying that an ounce of prevention is worth a pound of cure, I think most employers would likely, can't speak for all of them or any of them in particular, but would likely embrace that additional cost if it was legally authorized to do it. What is troubling for employers, and this is many employers and employers associations have said this to me, we think we have a pretty good case for random testing, especially after the TTC case, but we don't want to be in litigation for the next 8 to 10 years, and that's the risk. So that's why a legislative framework, even if it's seen as a balanced and restrictive framework with protections for privacy built in, absolutely. And I point the committee back to the TTC decision. It actually very clearly sets out the TTC policy, and it's been judicially approved, although that's being appealed. So who knows where it'll all end up legally. But the point is, I mean, how many more accidents do you want to have in a dangerous workplace? Or how many do we think as a society we want to tolerate in balancing the prevention versus the privacy concerns? The other point simply, and I didn't make it earlier, but it responds to your question of cost, even if the employer bears the full cost, union leadership has really ignored one fundamental problem, and that is they have in every legislation, federally and provincially, a duty of fair representation of all their union members. Not just the member who's using drugs. Guess who gets hurt and killed? Union members by union members. That lack of leadership or accountability of union leaders to say we're accountable for everybody and we should encourage reduction of the idea of use of impairing drugs or alcohol in the work. And if deterrence through testing is helpful, let's work with employers for a better method to do that. But I think if there was a framework and the legislation that we suggested, I think that would be a good start that would allow employers to do that.
Thank you very much.
Okay, now we go to Ms. Sidhu.
Thank you, Chair. My questions to Ms. Baxter. It's just the employees should notify employers when they have prescription for a drug. How do you propose this forward with infringing workers' right? Don't you think it's infringing the rights, like if somebody has a prescription of marijuana to notify the employer?
Absolutely. I think the The Canadian occupational health and safety regulations are built on the balance of the employer responsibilities and the employees' rights. So with regard to, I don't know who made the recommendation about reporting prescriptions to an employer. Essentially, the requirement to start with, sort of impairment can be impaired from any various different substances and circumstances. Fatigue can create impairment. And in the workplace, hazards, employers and employees work together to identify the hazards in the workplace. And the regulations are actually built so that we can have the flexibility to understand the differences in the types of workplaces, the different types of work, the different types of workplaces, and the measures put in place in any workplace are built around employers and employees working together. With respect to any sort of questions with regard to testing, et cetera, in the workplace, as has been mentioned, there's jurisprudence that speaks to this, and measures that must be in place in order to undertake any sort of testing. There is always a balance between the rights, preserving an individual's human rights and privacy, and ensuring safety in the workplace.
Oh, thank you. And my question to Ms. Fraser, what program and service should be put in a place to support employees for those who use cannabis for medical purpose, who may be dealing with their dependence or any problematic use?
So I believe Mr. Keith already touched upon this. Obviously, an employer has a duty to accommodate to the point of undue hardship. And in the absence of legislative amendments, employers will be needing to do that through policies within their workplace. I think one of the interesting issues that's going to evolve is this concept of undue hardship. I think it's a little bit difficult for employers to maybe pin down exactly where that point lies right now. I think every employer would prefer to have a smoke-free workplace, but there is some jurisprudence to indicate that if you're smoking cannabis for medical purposes, that needs to be accommodated. But we are seeing an evolution and an expansion of the array of medical cannabis products that are available to employees. We now have cannabis oil available. It's actually available in a sublingual spray. We have dried cannabis in a powder form that can be capsulized, and I think we're going to continue to see an expansion of the array of products. So, that's just one example of how employers are going to have to keep their eye on the industry and see how it is evolving and how that may affect their policies that they put in place to address those issues with employees.
Thank you. And Mr. Keat, the Occupational Safety Group published an article related to the Federal Task Force study on cannabis, specifically dealing with the question of workplace safety. They noted that federal and provincial human rights resist workplace drug testing. Why are you thinking the federal government to intervene in a provincial government matter when workplace safety laws and workplace zero tolerance policy reach the same goal?
I think if the federal government, as it has jurisdiction over criminal law under the Constitution Act of 1867, also has constitutional jurisdiction over federally regulated workplaces, my recommendations go to those federal workplaces. But I think there's also, because of what the Chief Justice said to me in the Irving case, because of the lack of leadership and a legislative framework, even though it touches only 8 or 9% of the employees in Canada, it is critical for the same government that opens the door to actually put a gate around the precipice that people, once they go through the door, might fall through, if I can use that metaphor. It also will provide needed leadership to provinces, especially smaller provinces that don't have the resources of the federal government, to look carefully at the health and safety implications. There is no legal right recognized by any court for a worker to come to work impaired, hide that fact, cause injury to themselves or someone else, or kill a member of the public. To suggest that the federal government shouldn't be involved in putting a legislative framework around the broader use of cannabis, I think, is reckless.
But when you mentioned the Sunwing pilot's case, so I think it was dealt with the transport law or with that. So still we need to intervene federal law, because when you mentioned the Sunwing pilot case, it dealt with the law already.
No, there is no testing, unfortunately, and that's the whole point. It was co-workers who had to restrain, as I understand the facts of that case, the pilot. There was no employer permission, there was no legislative mandate for the employer to actually deter and detect substance abuse, which is troubling.
Thank you. Okay, now we go to Ms. Gladue.
Thank you, Chair. Back to you for one last question, Mr. Keith. Did you have an opportunity to give your input to the government as part of the consultation prior to the drafting of this legislation?
Personally, and through any organizations I represent, no.
Oh, well, okay, clearly that's why it's been overlooked. My question next is for Ms. Fraser. Now, you were talking about if we are allowing people to get licenses to distribute or to be involved in the production of marijuana, that we shouldn't discount people who have past criminal offenses, if I understood correctly. So one of the objectives of this legislation is to try to get rid of the illegal market. So I'm not sure why we would get people who had no respect for the law previously to get involved if we're trying to get rid of the illegal market. Could you expand?
Well, I guess I'm taking a practical approach to this. These people are not just going to disappear. They're clearly prepared to put their personal liberty at stake now for, I mean, some of it is opportunistic, admittedly. Some people just passionately believe in the benefits of this plant, and they will continue to do so if they're not provided with an opportunity to comply with regulation and participate in the legal market. So, I just think it's naive to think that throwing more money at enforcement is going to make that illicit industry go away. I really don't think it might reduce it, but I don't think anything's going to make it go away completely. What I'm saying is I think there's a large segment of the current illicit market that would embrace regulation and legalization and is eager for that opportunity and would be compliant if given the chance.
Well, if we look at the best practices of Washington, for example, who has done the best job from the testimony that we've heard of getting the black market out of the picture, what they did was they took their medical regulated regime and brought the recreational regime into those same suppliers that were already following the rules and doing everything. And so don't you think that would be a better approach for us to take?
Well, that is essentially what we're doing. I mean, my understanding is that the supply for the recreational market will come from the existing licensed producers who are licensed under the medical cannabis regime. I guess, what I'm saying is we need to look at those applications continue to be processed and they continue to be filed, and that's not going to stop. And we need to look at that decision-making process on who those licenses are being granted to. Clearly, 58 licenses is not enough. So, that process is going to continue. And right now, the way the ACMPR is drafted and the way the bill is drafted, that decision-making process essentially excludes that entire segment of people. I just think that's short-sighted, and it's going to lead to, continued frustration that this illicit market continues to exist.
And do you know whether or not Washington allowed people with prior convictions to participate or not?
They do have, I'd have to dig it out to see exactly how it's worded, but there is a certain tolerance for prior marijuana-related offenses, yes.
All right, can you send me, or to the clerk, I'd be very interested in what they did there. My question then now is for Ms. Baxter, and it has to do with S5. So, as we look at S5 and the vaping, and we start thinking about what we should put in as language around cannabis, are there any concerns about potency guidelines or anything like that you think that we should be including?
I think, so questions like that I think would be best answered by Health Canada, who are looking at that particular issue.
Okay, very good. Let's see, one other question then for Mr. Keith. So it's always difficult when you start talking about one person's rights versus another person's rights. So the right of people to have their privacy versus my right to be protected at work. How do we resolve these kind of dilemmas where, either you're going to cause people to have to submit to random testing, which, I've done, it's not that onerous, but for some people, that would be an invasion of their privacy, versus my right to be safe at work?
One way, which is the current way we're doing it, is case by case in the courts, and that's expensive, that's time consuming, and with all due respect to the committee, it's an abdication of legislative leadership. I think a minimal legislative framework has to be put into place. There's no question that people have a right to privacy, but how far does it go? Can I have my privacy to the point where it puts somebody else's life or livelihood or their property in danger? Generally, we say no. And that's essentially what Judge Morocco said in the TTC injunction case. The balance of convenience and the public interest for safety of workers, and in particular the public, favors testing, which is a deterrent and detection method of being able to deal with the problem. I don't want drug testing to be all you hear from me. It's never a full solution. It's part of a suite of responsibilities and tools to deal with what hopefully everyone agrees with, is that you don't want workers, especially in safety-sensitive, dangerous positions, to be impaired and to hurt themselves or others. I've seen it happen. It will continue to happen, sadly. There needs to be a greater emphasis on prevention. That's one method that would help.
Thank you very much.
Thank you very much. Now, Mr. Oliver.
Great. Thank you very much. And thank you to all of you for your testimony. So, Ms. Baxter, one of my biggest beefs here in Ottawa, I used to work in hospitals. There was no smoking on hospital property. I had no secondhand, and where I lived in Oakville, there was very little secondhand smoke in bars and patios and all those things. So I was quite taken aback at my personal exposure to secondhand smoke when I started to work in Ottawa. So one of my biggest beefs is the cluster of smokers just outside the doors of buildings. Is there no setback here to put to put smokers back like 9-10 meters from doorways? And am I about to see an influx of marijuana smokers mixed in with those tobacco smokers?
So, I agree that the intention of the Non-Smokers Health Act is protect non-smokers from secondhand smoke, and the focus has been within the confines of a building or in various modes of.
Is there a setback from doorways, like from the main public doorways?
Not in the Non-Smokers Health Act. There are other pieces of regulation, municipal and provincial regulation, that would dictate what's required in public spaces. I'd
strongly encourage like a 9 to 10 meter setback so that we aren't, as non-smokers, of either tobacco or marijuana products, we're not being exposed to it. My other comment is, so I understand Ontario's rules or regulations will come out that will ban the consumption of recreational marijuana in public spaces. So, but provincial rules, I don't believe, are applicable to federally owned properties. So that would suggest to me that if I was walking down Wellington Street on city property, I would not be able to smoke cannabis. But if I stepped onto the Confed property, which is federally owned, I got a light up. Is there not going to be a problem with clustering of people? And I worry about the image in Ottawa of people coming to the city and seeing cannabis consumption openly happening on the lawns of our statutory buildings.
So, as I mentioned, the Non-Smokers Health Act does sort of look at in sort of enclosed spaces. So what you're proposing is outside of that. I guess that is something that I think the committee could look at. The question
As an
would be,
employee, I'm walking through that space, right?
well, and I guess the question is, what is the appropriate piece of legislation to deal with that? The Minister of Labour and the Non-Smokers Health Act is looking at occupational spaces. So where is the workplace and what is generally public spaces? So the question would be, what is the appropriate piece of legislation to address that?
As the CEO of a hospital, we made the conclusion that all hospital property was workspace and banned smoking from it, and it was a much healthier environment because of that decision. So if you could take that back to the committee, I'd appreciate it. I think it's something we should think about. My second question was to Mr. Keith. So just in terms of what currently is in place, so I was looking at, and it's all law, but Crap. I'm on the wrong thing here. Yes, so under the Canadian Human Rights Commission policy on alcohol and drug testing, it does say that as long as employees are notified that alcohol testing is a condition of employment, random alcohol testing of employees in safety-sensitive positions may be permissible. So would that not be true as well for marijuana, that as long as there's a notice in advance, that there is capacity for an employer to do what you are recommending in these 5 recommendations?
2 comments. One, thank you for the question. I'm not sure the Federal Human Rights Commission actually is correct when you square it with the Supreme Court decision in Irving. But assuming, for the purpose of the question, it is, then you're partway there. But I think the legislative framework still needs to be completed. Legislation is not only just to hold people accountable, but is to give guidelines about what society says is acceptable. And I think that's why I'm really kind of promoting this idea of not just one rule or one amendment, but a framework that communicates clearly what, in fact, our expectations are. By the way, a good test, if it's under Canada Labour Code, would be whether if somebody trips and falls, they can file a workers' compensation claim against the federal government. So everywhere you have a claim, or everywhere the federal government can enforce safety laws for other purposes, they clearly have jurisdiction over secondhand smoke.
Okay, thank you. Those are my questions. Thank you.
Last question.
Thank you. Ms. Fraser, I want to explore a little bit of this issue of timing, this concept that we don't have time to actually bring edibles under the concept of this, or the purview of this bill. My understanding is all we would need to do is Schedule 4 sets out the classes of cannabis that an authorized person may sell. That's where you see the dried cannabis, cannabis oil, fresh cannabis, cannabis plants, cannabis plant seeds. My understanding is we just need to add edibles and concentrates to that schedule, and then provide the minister with the authority to pass appropriate regulations to govern all aspects of it, which is the general scheme of this bill. So from a structural point of view, I don't believe there's anything particularly difficult about amending the legislation. Do you have any comment on that aspect? And I'm going to ask you a follow-up question.
I agree. The amendments to the bill itself would be minimal to provide for that. I think, again, I'm not privy to where things stand with the drafting of the regulations, but what I had understood from various government representatives that have spoken to this issue is that they were just running short on time to prepare the regulations that would be required to address the packaging and labeling issues for those types of products. So.
Well, let's look at that, because I have here the task force final report, the McClellan report, which was issued almost a year ago, November 30th, 2016, that the government struck in order to inform the legislation. And of course, in this task force, they squarely canvassed the issues around edibles, concentrates, and recommended, for all the reasons I mentioned earlier, that it be included in the legislation. Again, recognizing that Washington, Alaska, and Colorado have already done it. In fact, Colorado, the testimony we heard was that Colorado initially legalized edibles, had some problems with it. They ran into some issues, came back at it a second time and corrected all. Don't we already have a set of regulatory provisions concerning all of the aspects of edibles ready-made in Colorado that we could just simply adopt?
I would think so. We can learn from their experiences and their mistakes and take advantage of that learning curve that they've already been on. I agree with you.
Thank you. Mr. Keith, just back to you. I guess from a stepping back point of view, once this bill becomes law, it will be a completely legal activity for Canadians to ingest cannabis. How do you see your proposal for random testing in the workplace to square with that? Like, do you think, are you saying there can be a regimen constructed where Canadians who are engaging in illegal activity on the weekend will not have their job or employment or livelihood affected negatively, even in safety-sensitive positions, by a testing regimen. Do you see that that could be constructed so even a crane operator doesn't lose his job because they smoked a joint on a Saturday night?
Of course, and there's two answers to that. There's building that into the legislative framework, but there's also the counterbalancing human rights aspect from a person who's disabled or an addict. What you may not know, and this answers the question a different way, is that as soon as somebody tests positive for alcohol or drugs after they've caused an accident, the advice that unions generally give in this country is to claim you have a problem. You rush out and find an addiction counselor who agrees that you have a problem, and that will give you an automatic preservation of your job, maybe honestly, maybe not, because you have a disability and you have protection or human rights legislation. So that's protections already there, whether it's cannabis, cocaine, or alcohol. So
I'm talking about, leaving aside what unions may or may not say or what, addicts. I'm talking about just a regular garden variety Canadian.
Yes.
Who smokes a joint on the weekend, which
Correct.
This legislation will make perfectly legal.
Yes.
I'm asking if you're suggesting to this committee that we somehow construct some rule or regulation where a person who engages in that legal activity on their own time somehow has their employment jeopardized, even in a safety-sensitive position.
That, of course, is not any of my 5 suggestions. What I'm suggesting, if they're in a safety-sensitive position, the random cannabis and other drug testing take place, then once there's a positive test, there's an inquiry into whether or not there's a medical authorization or a medical condition where you need to have that. In the meantime, you're taken out of the safety-sensitive position so you don't hurt yourself or others, and it's dealt with appropriately. If they are under the influence where they are impaired, even though they were ingesting a legal substance, do you want to get on the plane if the pilot is impaired?
No,
that's the
absolutely not.
question for you and every Canadian.
Nobody's
that needs to
defending-
be answered that I've tried to address in the
Nobody's
framework.
addressing present impairment, but see, that's my point. Right now, that current state of law is the defense is the medical necessity, but this is going to change the law. It's going to be perfectly legal to smoke cannabis on the weekend. So again, is it any of an employer's business what a person does on their personal time, as long as they're showing up for work not impaired? And the problem with random testing, as I see it, is that person is going to test positive, and then what?
No, you're mistaken. The TTC policy, as I mentioned before, addresses that issue. There's a medical consensus on what impairment is. They've doubled that consensus, and they said anything below that's a negative test. So there would be a negative test for somebody who smoked up on a Saturday night party, went to work on Friday. They would test positive, but below a threshold by which they'd be identified positive. In other words, they test negative. So the test is for impairment, and that's what we want to, I think, do to keep people safe.
Time's up, and that completes our panel on
Point of
workplace
order,
safety.
Mr. Chair. I was wondering, we just almost have half an hour left. I was wondering if the members would like to do another round of questioning.
Well, we need a unanimous consent for that. We have the rules, and do we have unanimous consent for another round of 4 questions? Unanimous consent? Yes, we do.
All right. Good. Thank you.
All right. So, who's our first questioner on this side? Mr. McKinnon, you look like you have a question.
Well, I'm a little unprepared. I'm going to go back to Mr. Keith, because we've had such good conversations. I'd like to, I guess, I'm still not, I take your points about the need to examine the labor code for these aspects, but I'm still not persuaded that, all of the instances that I mentioned regarding operating of motor vehicles, I mean, you say an employer doesn't want to call the police in the case of a suspected impairment, but as you say, lives are at stake, health is at stake. If someone is operating a motor vehicle in an impaired state, they're breaking the law. They're potentially creating their conduct is criminal fundamentally, right? So why would the employer not want to report that? That's a hypothetical suggestion, but let me respond partly with an example. So I have a formwork contracting client, the largest formwork contracting client in the province of Ontario. They estimate anywhere from 45 to 55% of their workers are using cannabis illegally right now. They have no means to test. They've had a few people thrown off the job who are visibly smoking on smoke breaks. That's what's happening right now. On a smoke break in a construction site, because it's not prohibited, because it's open air, people are toking up and they're comparing smoking cannabis to smoking a cigarette, when in fact the impairment effect is different. It's almost as if they were, breaking out a case of beer at a smoke break. That's a better metaphor comparison. So employers don't want to get embroiled in criminal investigations related to the workplace. They don't want workers to get hurt. They just want the workers to come to work sober and to be able to do the job safely and to get the productive work done. So I think the spirit behind the suggestion for a legislative framework that, I keep quoting the Chief Justice or the former Chief Justice, because I think the courts are frustrated that there's no leadership in legislation on this complex issue, and the balance that's been discussed here between privacy rights and the rights of safety of workers in the public. But I think the practical reality, there isn't enough police to police everybody who's going to smoke and put somebody else at risk, or to do cocaine or drink alcohol. Some of the substances are legal, some of them aren't. The focus here is not so much on the legality, but that legal cannabis will increase social acceptance and use. And so the risks are become higher for workers and co-workers in safety-sensitive positions. And so the spirit behind the legislative framework I'm suggesting is to make and enhance protective measures in the workplace for the safety of workers and the safety of the public, while at the same time respecting privacy rights of workers. So employers just don't want to get involved in the problem of having criminal investigation during their workplace, and they will resist it. And I've been advising employers for a long time, and that just seems to be a common theme, regardless of industry or jurisdiction. We've had medical marijuana for, I think, a decade now. Have you, is this not an existing problem, or is it new? You see that the problem exists with the medical marijuana regime as well?
There are two different, that's a very good question, very good comparison. So there are two different kinds of advice I give to employers that ask questions about people with a medical authorization, also known as medical marijuana. One is, if it's employer paid through a benefit plan, then the employer is aware, and the employer has a legal obligation under health and safety law to not allow them to be in a safety-sensitive position unless they get a medical opinion that the worker is fit for duty. So what we do, we either write the letter, or the employer writes the letter to the doctor authorizing medical marijuana cannabis. Here's the job. Here's the risks associated with it. Can we get your medical opinion? Is the person going to be even possibly impaired? Most time the doctors say yes and don't put them in a safety or her in a safety-sensitive position. So that's sort of easy. The harder part is somebody who might have it, might not want to disclose it because they're afraid of losing their job, but they might be in a safety-sensitive position, and then the only way you usually find out is after the accident, after somebody's injured or killed on the job. And then their answer is to, no, it's not my fault, I've got a medical authorization. Yes, but you as a worker have a duty not to present yourself unsafe. That's why the recommendation, number one, of actually a formal prohibition against workers coming to work under the influence of cannabis or other drugs, unless there's a medical authorization and it's disclosed, makes sense, because it puts some shared responsibility on the worker to say you and your doctor need to determine if you could be impaired and therefore affect safety of others at work.
All right. Dr. Carey.
Thank you very much, Mr. Chair. And I just want to follow up a little bit more, Mr. Keith. First of all, I was shocked that the government didn't reach out appropriately to stakeholders that represent the health and safety of workers. I just wonder if they didn't reach out to you, who else did they not reach out to? Because this is extremely important. I do think that there is hope, though. We heard a Liberal member who was concerned about his health and safety as far as secondhand cannabis smoke and setbacks. So I hope that the government takes these issues into account when they go forward and try to roll this out, because we shouldn't rush these things. We should make sure that the health and safety of Canadians is a priority. But I want to put you to the test here, because you have brought up some controversial things in your recommendations, and I think that's good. They need to be addressed. And I want to dig in a little bit more on this mandatory testing and the blood testing. And do you think that mandatory random testing is going to become the norm in the workplace? We know that for police, they feel that when they're pulling somebody over for intoxication, there may be a swab, and then they may have to take the individual to a hospital or a lab to get blood testing done to make sure that these things stand up in court. What I'd like to know from you is what does the government need to do if these changes do become the norm? What do they need to do to get ready? What changes do they have to make to legislation?
There is more attention, and the companion legislation in Bill C-45, C-46 is moving towards dealing with a framework for public safety, in particular motor vehicle safety. And as technology advances and law enforcement concerns are understood and reflected in legislation, then that'll be dealt with. And I think many and most Canadians seem to be more worried about the public safety on our roadways than workplace safety. My experience, if I have any expertise, it's more in the occupational workplace safety, is concerning, because it seems like we're valuing the traveling public on the road more than we are the worker in the workplace. And so I think there should be complementary legislative testing, proactive measures that are taken. I think the proviso and the theme of the legislative framework I'm recommending is hopefully striking a balance and respecting workers' privacy and their need for assistance if they're proven to be impaired. But there can be as much or more harm done in a dangerous workplace or to, a traveling member of the public where you've got public safety but also occupational safety at play than you can with roadway safety. So the statistics are you have about, for every person killed on the roadway, about one person killed in the workplace. And it seems the workplace risk and fatalities are being given less attention, and that's why I've emphasized the points I have.
And my colleague wants to ask a follow-up question as well.
I don't know how much time I have, but anyway, I'm just curious, Ms. Fraser. I did enjoy your presentation, all of your presentations, but in particular yours. You talk about the tens of thousands of people that are currently working in the illicit cannabis industry, and that there should be amnesty clauses put in the bill to allow people who have small convictions to be able to apply for licenses and gain licenses. And I think about individuals who perhaps may not have any criminal record, but have affiliation to gangs like the Hells Angels or such, and they're known to police, yet they do not have any criminal convictions. I have problems with those individuals being allowed to get licenses and to perhaps produce one day. Your suggestion is, though, that these individuals should have that opportunity to apply and have a fair hearing?
No, not at all.
Okay.
The converse. And what I was saying was that that would be one of the examples of an exclusion to that right to participate that I would suggest. And in fact, we already do have, there's a number of different grounds for refusing a license under the ACMPR, right? And affiliations with organized crime is one of those grounds. That makes sense. That stands alone, separate and apart from any involvement in the illicit drug trade. So for sure that should stand and that should carry forward. That's, I was speaking more to the participation in the illicit market market in and of itself, in the absence of those other, factors.
Good.
Yeah.
Thank you. Mr. Davies.
Thank you. Mr. Keith, if you know, do you know what percentage of workplace fatalities annually are due to impairment?
No, and that's a really good point you raised, because the Association of Workers' Compensation Boards across Canada that collects the most reliable data, that covers most but not all workplace accidents and fatalities, measures on a number of collection criteria, but they don't collect the data on alcohol or drug-related fatalities. In Ontario, the chief coroner has a policy, it's not legislation or regulation, but a policy that every time there's a worker who dies at work, they're tested for drugs or alcohol. That's how, in fatality cases that I get involved with, we often know what the substance is, because otherwise an employer or the public
in that
never
jurisdiction,
knows.
do we know then if they're testing after fatality, they must know what the presence
Yes, absolutely.
is? So what's the percentage?
So the coroner
there?
has that information, and it's estimated between 38 and 40%.
Okay.
It's sad.
Mm-hmm. Well, that would
and
be
tragic.
That would be a correlation. They would find the presence of substance, but that's not necessarily a finding that was the cause of the death, I would take it.
Correct.
Okay.
Its causation is always a complex analysis.
The other question I had would be, I'd like to get your views on how we would define safety-sensitive positions. I'm thinking that engineers design bridges. A mistake made by an engineer in a critical calculation could cause a bridge to collapse. Architects, same thing. We had this fire in Britain that it looks like it was a decision made by someone not to put fireproof cladding inside the building, and the fire caused 80 deaths. Doctors make life and death decisions. Surgeons have people under the knife. Police carry guns. So I'm curious, it strikes me that all those are safety-sensitive positions. Would you include those groups in your proposal to randomly test? Diplomatically, I'm keeping lawyers out.
Definitely keep the lawyers out.
Yeah.
Safety-sensitive positions are defined in employer policies in industries across Canada and around the world. The problem is different interest groups and different industries are going to have a different approach to defining safety-sensitive position. What the courts and arbitrators keep doing is crying out for legislation and legislative and parliamentary leadership on defining a framework for that term. It may not be a definitive or exhaustive term. It may or may not include engineers who are designing, safety-sensitive, public safety-related cladding in buildings. But I think without any legal definition or attempt to define it as part of a framework, and that being, of course, the basis upon which you then can test people, because we're not suggesting everybody gets tested, is a rational process. Otherwise, what you're doing is kind of saying it's all up for grabs and it'll be litigated to death. I mean, my interests really are against the interests of lawyers, because you're going to reduce the amount of litigation, which is not a bad thing in society as well, I think I'd suggest.
Ms. Baxter, did you want to say something?
Well, I did want to say that through the jurisprudence, they actually have somewhat defined what a safety-sensitive position is, and it's those that with incapacity due to impairment could result in direct and significant risk of injury to the employee, others, or the environment. And you have to consider in workplaces, you have large workplaces, small workplaces, medium-sized workplaces, unionized, non-unionized. And I think what's at the core of this in determining what is a safety-sensitive position is really the tenet of the occupational health and safety regimes in Canada, which is that dialogue between the employer and the employees to be able to determine what the hazards are in the workplace. In doing so, you would be defining what some of those safety-sensitive positions are and what measures need to be taken to reduce and mitigate those risks in the workplace. So I think having a definition that runs across all workplaces doesn't work. You need to have some ability, some flexibility to respond to the variety of different types of work and workplaces and sizes of workplaces.
Thanks very much. Okay. Mr. Oliver.
Yeah, thank you very much. Sorry. I just wanted to correct the record a little bit here with respect to some comments made by my colleague, Dr. Carey. So the task force on legalization of marijuana traveled across Canada. I think they were 5 or 6 months on the job. They had 20,000 submissions from all walks of life, all professions, all areas. So under the section on what we heard, they dealt specifically with people working in safety-sensitive positions, such as healthcare workers, law enforcement personnel, employees in transportation, construction, or resource extraction industries. They heard about the challenges associated with providing reasonable accommodation for employees who use cannabis for medical purposes. Employer groups were in to see them, calling for more guidance from federal, provincial, and territorial governments about appropriate workplace drug use and drug testing. So I think there was extensive consultation by the government through the task force in the area of testimony that that Mr. Keith is bringing to us and others have today. And we are dealing with implementation at this point. So I guess that's my question to you, Mr. Keith. So with concerns being heard by the task force, the concerns you bring forward, but as I already asked you about, there's already case law and there seems to be permissions in place for employers for safety-sensitive positions to advise in advance that you will be tested and to implement those. You said, yeah, we're partially there. Can you maybe just, in terms of implementation, so I heard you suggested there should be a more comprehensive addressing of the issue in the labor code. Anything more you'd add to that, those 5 recommendations?
Well, in the McLennan report on page 29, it reads, the employer groups called for more guidance from federal, provincial, and territorial governments about appropriate workplace drug use and testing policies. So I think the request has been out there for a while. It's not just so employers can find out who's using drugs or drinking on the job. It's to make sure that workers are safe at work. With the absence of any federal or provincial definition of safety-sensitive position, it's left to workplace parties to work it out and ultimately to litigate this. There are literally hundreds of cases every year fighting about is this position safety-sensitive or not. So a statutory definition wouldn't answer everything, but it would give guidance, and that's what's needed.
So your advice to this committee then, as part of our clause-by-clause review of C45 and any amendments or attachments we decide to put with it, would be advice to address those 5 principles that you brought forward?
Yes, that would be the bottom line of my recommendation. Thank you.
Thank you very much.
Well, thank you very much. That brings to a close our panel on workplace safety of this meeting of the Justice Committee. It feels like a Justice Committee meeting. And but this afternoon we'll return back to our Health Committee and we'll have a panel on Indigenous communities. But I want to thank our panelists very, very much. We've all learned a lot, I think, from you, and we appreciate you taking the time to share your knowledge and experience with us. So I suspend the meeting till 1:45. Reconvene our 67th meeting of the Standing Committee on Health with our third panel today, and our third panel is on Indigenous communities, and I'm looking forward to this. I'm sure it's going to be an interesting presentation, and well, I'm sure we'll learn a lot. So our guests today are presenting for the Métis National Council, Claire Morin-Delcol, Minister of Health. Also, we have Wenda Watain, Senior Policy Advisor, and Eduardo Videz, Senior Health Policy Advisor. And on behalf of the Chiefs of Ontario, we have Isidore Day, Ontario Regional Chief. So we'll ask the Métis National Council to make a 10-minute opening statement, and then we'll have Mr. Chief Day make an opening statement, and then we'll have questions after that. So, Ms. Delcol, if you would like to open with a 10-minute statement.
Thank you. Mr. Chair and committee members, thank you for the opportunity to participate in your hearing today. I'm here in the capacity of Minister of Health of the Métis National Council. I'm also the President of Métis Nation British Columbia, and I'm pleased to be here to provide Métis Nation perspective on Bill C-45. To provide some background, the Métis are a distinct Aboriginal people as defined in Section 35 of the Constitution. The Métis Nation emerged with its own collective identity, language, culture, way of life, and self-government in the historic Northwest prior to Canada's westward expansion following Confederation. The Métis Nation continues to exist as a distinct Aboriginal people and seeks to advance its right to self-determination, including self-government within Canada. The Métis National Council is governed by 5 members. These governing members are Métis Nation British Columbia, Métis Nation of Alberta, Métis Nation Saskatchewan, Manitoba Métis Federation, and the Métis Nation of Ontario. MNC governing members through their registries and democratically elected governance structures at the local, regional, and provincial levels are mandated and authorized to represent the citizens who comprise the Métis Nation. About 1/3 of all Indigenous people in Canada identify as Métis. According to the 2011 census, more than 450,000 people reported they were Métis, with almost 85% located in the western provinces and Ontario. More than 70% of Métis live in urban centres, the largest concentrations being in Winnipeg, Edmonton, Vancouver, Calgary, Saskatoon, and Toronto. I'd like to talk a bit about the overall health status of Métis people. In the Métis context, we take a social determinants to health approach. Everything is interrelated. What happens in one area impacts on another. Historical and current events such as residential and day schools, the 60s scoop, racism, loss of family unit security, loss of community wellness and unity, and loss of culture and language have had lasting impact on Métis health and wellness. Métis are vulnerable to chronic diseases such as mental health disorders. These disorders include depression, anxiety, substance use, and chronic pain, including emotional pain. For example, we know from the Métis Health Status and Healthcare Utilization Study done in Manitoba in 2010 that Métis had statistically higher rates of depression, anxiety, and substance use than the general population. The Federal Task Force on Cannabis Legalization and Regulation spoke to the risks of vulnerable populations. The Métis are a vulnerable population in terms of overall health status. Therefore, it is important that we are involved as equal partners in the work ahead. I'd like to take this opportunity to commend the Prime Minister and the Government of Canada for entering into the Canada Métis Nation Accord in April of this year. This commitment sets out a nation-to-nation, government-to-government relationship between Canada and the Métis Nation. Under this accord, we have co-committed to advancing a range of priorities, including Métis health and wellness. Now I'll speak more directly to the proposed legislation. The Métis National Council supports the stated purpose of Bill C-45 and including its intent to protect the health of young persons by restricting their access to cannabis, protect young persons and others from inducements to use cannabis, reduce the burden on the criminal justice system, and enhance public awareness of the health risks associated with cannabis use. Unfortunately, we have not had the opportunity to engage with or consult our citizens and communities on the proposed bill or its regulatory framework. There are indeed a number of matters of importance to the Métis Nation, including potential impacts legalizing marijuana will have on health and wellness, justice and corrections, and economic development. The Métis National Council proposes 4 key recommendations that ensure there are opportunities for more adequate engagement with the Métis Nation in implementation matters. Recommendation number 1, that the Government of Canada ensure meaningful engagement of the Métis Nation in the development and implementation of a regulatory framework for cannabis. The task force advised the Government of Canada that successful implementation of a regulatory framework will take time and will require that governments meet a number of challenges with respect to capacity and infrastructure, oversight, coordination, and communications. It indicated that federal, provincial, municipal, and Indigenous governments will need to work together on information and data sharing and coordination of efforts to set up and monitor new systems. Organizations that have appeared before the committee recognize the importance of consultations with Indigenous communities on legislation, preventative measures and interventions to meet local conditions and cultural requirements. We support these recommendations. Recommendation number 2, that the Government of Canada provide the Métis Nation with resources to minimize the harms of cannabis use in the Métis population. The Métis National Council agrees with the task force on the cannabis legalization and regulations advice that a public health approach be taken to promote health and reduce harm. This approach considers the risks associated with cannabis use, including the risks of developmental harms to youth. It is imperative that resources be provided to Métis governments to mitigate harms associated with cannabis use. The Métis Nation is prepared to work with all levels of government to undertake health promotion activities and to develop approaches to minimize harms in the Métis population. Funding supports should be provided by the federal government to Métis governments to undertake this work. Recommendation number 3, that funding be provided by the Government of Canada to support prevention, education, treatment supports, and especially for Métis youth. Of particular concern to the Métis Nation is the health and wellness of Métis youth. We understand legalizing cannabis will have impacts on the Métis, particularly on Métis youth. The Métis population is young. According to Statistics Canada, 41% of the Métis population is under 25 compared to 30% of non-Indigenous population. Many of our Métis youth are already dealing with issues surrounding drug use and addiction issues. We know from a Métis study by McCreary Centre Society in BC 2013, around half, 48% of Métis youth had tried marijuana. Among those who had tried it, 23% had used marijuana on 6 or more days in the previous month, 30% of males versus 18% of females. We want to ensure that Métis, including Métis children and youth, have access to information to enable them to make informed decisions. We also want to ensure that Métis children and youth have access to Métis-specific prevention, education, treatment supports. On that front, we agree with the task force that governments should commit to using revenue from cannabis regulation as a source of funding for prevention. Funding should be provided to Métis governments to address these needs. To minimize harms, we would like to see the minimum legal age set at 19 years. The age of 19 is consistent with legal age of drinking in most provinces. Recommendation number 4, that the Government of Canada work with the Métis Nation in enforcing public safety and protection. The Métis Nation supports the task force recommendations that the federal government take a leadership role to ensure capacity is developed among all levels of government, including Métis governments, prior to the start of the regulatory regime, that it develop and coordinate national research and surveillance activities, including Métis population-specific research and surveillance, that it establish a surveillance and monitoring system inclusive of Métis. that it engaged with Indigenous governments, including Métis governments, to explore opportunities for their participation in the cannabis market, and that it engaged with Indigenous communities, including Métis communities, to develop targeted and culturally appropriate communications. In particular, resources should be provided to implement an evidence-informed public education campaign targeting the Métis population. Métis are the experts in relation to their own health and health needs and can play a meaningful role in public education. The Métis Nation seeks to work as an equal partner in the development and implementation of regulatory matters and optimizing health for Métis people in Canada. The Métis Nation is committed to working with all levels of government to ensure the task of legalizing and regulating cannabis is done carefully and safely. Métis governments have the ability to effectively reach Métis people and communities in ways no other government can do. We look forward to contributing to the work ahead. Thank you again for the opportunity to participate in this panel, and we welcome any questions you may have. Thank you, and merci.
And thank you for your presentation. Now we go to Chief Day, Ontario Regional Chief, for a 10-minute introduction.
Bonjour and good afternoon. Before I begin, I just want to extend my condolences to the family and friends of and colleagues of Arnold Chan, a member of Parliament who passed away this morning. I'm sure that he will be greatly missed by his Ontario Liberal Caucus colleagues and members of Parliament who valued his thoughtful contributions to the democratic process in Parliament. And just on a personal note, throughout the last 15 years, I've known Arnold Chan when he worked with Dalton McGuinty and in the private sector as well. And again, an upstanding individual who will be sadly missed. So again, our condolences. I also want to acknowledge the unceded territory of the Algonquin Nation. I am presenting here today as the Ontario Regional Chief. I am also the National Chair of the Assembly of First Nations Chiefs Committee on Health at the Assembly of First Nations. As we all know, Bill C-45, the Cannabis Act, intends to provide legal access to cannabis and to control and regulate its production, distribution, and sale. The objectives of the Act are to prevent young persons from accessing cannabis, to protect public health and safety by establishing strict product safety and product quality requirements, and to deter criminal activity by imposing serious criminal penalties for those operating outside of the legal framework. The Act is also intended to reduce the burden on the criminal justice system in relation to cannabis. As the committee has already heard earlier this week, police officials have stated that they will not be prepared to deal with the bill C-45 when it becomes law on July 1st, 2018. And that's consistent among many jurisdictions and communities. It is accurate to say that First Nations are also not prepared to deal with the ramifications of Bill C-45. In fact, this is a critical issue that is going to have huge impacts on First Nations and all Canadians. But we are not yet in a position to fully understand and fully address those impacts. And going forward, this part of my presentation, I will probably put a lot of questions to the committee as well, because, again, there are some unanswered questions, as you know. The first one of those questions will be, does Canada even know the full impacts of cannabis yet? This is a situation where we're damned if we do and we're damned if we don't, and that speaks to the issue of engagement readiness. The reality is the complexities of much of the processes in terms of, just as an example, the environmental legislation, to even get communities engagement ready to ensure that we could have a substantive say in terms of any legislative changes is a daunting task. It's complex in nature. The Assembly of First Nations does not yet have a position on cannabis. It has been proposed that the National First Nations Summit on Cannabis be held in the very near future. In Ontario, it is accurate to say that First Nations are much more engaged with the province's plan to establish a cannabis control board by July 1st, 2018. Last Friday, when the Ontario government announced its cannabis plans, the Chiefs of Ontario were briefed in advance by Attorney General and the Minister of Finance. In the coming months, we will establish a bilateral table to work collectively on the Ontario Cannabis Control Act. and we were meeting with INAC Minister October 2nd, just prior to the First Minister's meeting, and you can rest assured that this will certainly be one of those major issues on the table for discussion. Initial meetings with Ontario are proving to be respectful and focused on the real issues and challenges faced by First Nations in preparation of retail and distribution of cannabis. There will be many issues and opportunities which will need to be addressed. Firstly, how will First Nation communities regulate the sale and consumption of cannabis at the local level? Some of our communities may want to explore the potential of jointly owned cannabis operations, which will or may be federally approved. And what I mean by that is there are going to be some jurisdictional issues and questions. As you know, unlike our brothers and sisters within the Métis community, we have a very specific land tenure under the Indian Act. Some communities may want to ban the sale and consumption, much like dry communities, which stem specifically in provisions from the already embattled Indian Act. Land governance, again, unlike our Métis brothers and sisters, are going to be the crux of the challenges that we face, and all you have to do is look at the tobacco issues that we're faced with in many of our jurisdictions. And I'll only speak for Ontario, but we have spent years dealing with those issues at the community level. Any provincial legislation needs to have the flexibility to support First Nation communities in pursuing development in ways that align with their own specific cultural and community values. So, for example, the banning of recreational cannabis around community events and ceremonies. We take very seriously our protocols and ceremonies, and to a large extent, cannabis has not been part of those ceremonies and community protocols. So how do we deal with that? How is our jurisdiction respected if the community set out their own laws and ordinances around that? I remain optimistic that First Nations will directly benefit from any revenue generated from these ventures. While historically, Ontario First Nations have been neglected in resource revenue sharing with the province of Ontario, this new industry provides an opportunity to turn a new leaf and to examine innovative revenue sharing opportunities. We just need to avoid the potholes in the path going forward. However, the biggest concern that First Nations in Ontario and across the country have with Bill C-45 is the health and safety of our peoples. According to the National Native Alcohol and Drug Abuse Program, cannabis is the second most abused substance after alcohol, followed by cocaine and opioids. In 2003, it's estimated in Ontario alone that an additional $33 million per year is needed to treat First Nations with drug and alcohol addictions. This is as a result of decades of underfunding. What will happen when cannabis is legalized and more of our people will be able to access this drug? We know there will be an increase in the need for addiction treatment. We know that there will be a need for an increase in law enforcement as well. When the states of Colorado and Washington legalized cannabis sales in 2013, American Indian tribes were negatively impacted. This should be examined. Cannabis products were sold illegally on reservations as far as New Mexico, Arizona, and North and South Dakota. The primary target were Native American teenagers. To quote the July 25, 2014 Denver Post article, it quotes, "Tribal leaders are fighting a heroic but losing stand as state legalized marijuana, cannabis-infused foods, liquids, e-cigarette cartridges, and other products make their way to young people from Colorado and Washington state licensed dispensaries." How are we going to ensure that this does not happen here in Canada? For example, First Nation policing is already chronically underfunded and understaffed. Over the past several decades, the Chiefs of Ontario have passed at least 43 resolutions calling for more funding for First Nations community policing. To quote from our May 2017 Strategy for a Safer Ontario position paper, the quote reads, "The federal First Nation policing program fails to meet the needs of First Nation police services in Ontario, and its archaic assumptions place the safety of First Nations officers and their community citizens at risk." The Ontario Police Services Act provides a legislative basis for police services in the province of Ontario. However, immediate legislative changes, First Nation police services are not afforded the same protections other police services receive in the province because there is no equivalent legislation for them specifically. Securing funding that is stable and sustainable is an ongoing need that is a necessity to improve the delivery of First Nation police services. Funding is needed to build capacity to ensure the safety of First Nation officers in responding to calls, to create specialized services, and to ensure that there is adequate housing and infrastructure in support for First Nation police services. The need for training beyond frontline policing training is an integral part of community policing. This training should include cultural awareness training for Native and non-Native officers alike so that they understand the cultural norms of First Nation communities. It should also include understanding social services, including dealing with addictions and other societal problems common in First Nation communities. And on that list of quotes, I just want to emphasize the fact that you just had folks from the police chiefs organizations federally, and they were stating that they're not going to be prepared. So you can only imagine what is going to need to be examined for First Nation communities. We definitely are going to render ourselves hopeless here if something isn't looked at and responded to. From the economic development standpoint, to date, resource revenue sharing agreements have largely been left to the provincial governments in relation to geological and environmental resources such as mining, forestry, and hydroelectric power. The bill has completely neglected any specific opportunity for First Nations to participate meaningfully in or have any resources to appropriately respond to the implications of this emerging market. Under Section 60 of Bill C-45, it states that the Attorney General of Canada may enter into an agreement with the government of a province or with any provincial, municipal, or local authority respecting the sharing of fines and fees that are collected in respect to the prosecution offenses for the compensation for the administration and enforcement of this Act. If the Government of Canada is serious about its dedication to a government-to-government relationship, First Nations need to be included in this section to provide adequate responses to the implications of this bill within and surrounding First Nation communities. This could include supporting First Nation emergency responders such as police, ambulance, fire response, which will be impacted by manufacturing and sales within this emerging industry. A revenue sharing agreement with First Nations would ensure quality emergency response to promote community safety, which is an important factor in self-government. While there may be some First Nations that are unwilling to participate in the industry, which is their prerogative to do so, there will be some First Nations that will want to participate as meaningful partners or even sole owners of businesses related. Within Section 6(1)A, the Minister may establish classes of applications for licenses and permits. First Nations should be a separate class and have a designated number of license and permits attached to the class. The Act permits the Minister to revoke licenses based on business incorporation being formed or organized outside of Canada. As the Attorney General continues to work on federal legislation that impacts First Nations' own ability to self-govern, more First Nations will begin to assert their sovereignty and their jurisdictions. This could include self-regulation on cannabis, but also on business licenses and incorporation. At that point, let me just make a very quick observation and suggestion. In the province of Ontario, with respect to taxation, we know for sure that within the provincial and territorial regimes, when it comes to retail and distribution, that is going to be a ticket item. That's going to be part of the bottom line. And we feel that it's very important to examine what has happened in Ontario. We will certainly want to explore the issue of taxation, and we know that the only way to do that within the context of the harmonized sales tax in Canada is through a Sitka agreement. And that was a heavy negotiation in Ontario, and I think that this legislation and the policymakers should be looking at that very closely because taxation will become an issue.
How much further do you have to go there? We're beyond our time, and we want to get to questions.
Yeah, I've got probably about 2 more minutes.
Fire away.
It is always important to be mindful of the changes to come in how colonial legislation includes the impact on First Nations' ability to generate revenues to appropriately govern their nations. In conclusion, sir, there are a lot of unanswered questions about how the legal sale of cannabis will affect First Nations. This is why the AFN is calling for a national cannabis summit. How will our communities benefit in terms of economic opportunities and revenue sharing? How will our people be affected in terms of health and safety? And how much funding will the federal government set aside for First Nations in terms of education, especially our youth, on the impacts of cannabis? How will many millions of dollars, how will we use the many millions to treat the ongoing issue of cannabis addiction? At our AFN-AGA this past July in Regina, Public Safety Minister Ralph Goodale told the chiefs that there simply is no funding in the current budget to properly fund First Nation police services. Canada must take funding of First Nation policing services as top priority before Bill C-45 becomes law next year. Our communities must have the proper health, policing, and public safety resources in place. And let me repeat, there appears to be more questions than answers. This leaves First Nations, and I might say the feds and provinces and territories, in a compromised state, leading into an accelerated timeline on legislation. To that end, and my concluding question to the committee, who is going to pay for the impact of hastily forced legislation? Thank you, and I'm open for questions. Thank you.
Thank you. Okay, now we're going to go to our first round of questions. There'll be 7-minute questions and answers, and we'll start with Mr. Oliver.
Sorry, you're on the wrong list there, sir.
I'm sorry.
Mr. Elson.
Mr. Dr. Elson, sorry about that.
No worries. Thank you, Mr. Chair. Thank you all for coming. Now, one of the things we've been aware of, this was brought up by a number of people at a town hall I held on the subject of cannabis a couple of weeks ago. And this parallels an experience in the United States as well, that a lot of our current drug laws, the criminalization of drugs, including cannabis, has particularly affected groups that are overrepresented already in the justice system and are already subject to poverty and other issues. And in Canada, that includes our First Nations population. Now, do you find that, and I put this to everyone here, that our current criminalization strategy is unfairly or overtly targeting Indigenous groups? Would you say they're overrepresented of those that are being disadvantaged by this? Mr. Day, I'll start with you.
Okay, so thank you for the question. Speaking to the issue of overrepresentation, whether it be in the child welfare system, the criminal justice system, and so on and so forth, we know for sure that we sometimes see society address the surface issues. And we know for sure when it comes to addiction is only a surface issue. My friend and colleague next to me talked to the social determinants on health. And, in my remarks, I spoke to the issue of needing to have effective funding in policing. Because from an overall systems perspective, we know for sure there are deeper issues, and the cannabis issues and the criminalization over the last several decades has only spoken, to the fact there are deeper issues. So my point being that there will need to be an examination of what are at the core of issues of addiction in the community, because we can send good money after bad here on this issue. But if we're not addressing the core issues in our First Nation communities, we'll always be, putting money where it's not going to be best used.
Mm-hmm. Thank you. Now, one of the things we've heard in our testimony, and I found in my own experience as a physician as well, is that that there are many people who, there's a correlation between mental illness and drug addiction, and we do know that there are many people who suffer from mental illness that then go on to experiment with drugs, self-medicate with drugs, consequently become addicted to drugs, which causes its own problem, which also will actually make treatment of the underlying mental illness worse. And it becomes quite a challenge and a bit of a vicious cycle with people from all populations, not just Indigenous population. But in regards to the Indigenous population, the Government of Canada has made some substantial funding commitments over the next few years, again, in mental health for non-Indigenous as well as Indigenous people. And right now we're, as part of a commitment, is almost $120 million for mental health for Indigenous people over the next 5 years. Do you believe that will help address one of these roots of the problems that is helping, that are getting people in First Nations groups or in Indigenous groups into problems with drugs? I'll allow everyone on the panel to answer that.
Yeah, thank you for that. And I'm glad you switched to Indigenous and not just First Nations.
Yes, that was my mistake.
Thank you very much. That mental health is a big issue, and the funding, and we're looking forward to working with the federal government on funding for Métis, which we've never really had before. Drug use and mental issues and health issues in our Métis communities, and suicide amongst our youth in all our Métis communities is a huge problem for us. It's something that that's why the funding is so important for us to have the resources to have so we have better care for our Métis people in these communities and in our urban centers, because these are huge problems for us, and the cannabis issue is just a part of that. Because, like you said, mental health and drug addiction is a big problem for Métis people and all Indigenous people.
Yes, sir.
Thank you. This is a good question. So can you just give me the simple one line of your question so I can answer it directly?
The commitment we're making to vastly improve mental health funding, do you think that is going to help address this and help prevent some of these people from the Indigenous communities from becoming exposed and addicted to drugs in the first place?
Great. That's a really good question, and I do want to make the delineation here between Indigenous and First Nation, because I think it's an important one, as my friend and colleague to the next to me stated. And I must state that when it comes to First Nation health, under Health Canada we have the First Nation Inuit Health Branch, and there's a program that deals specifically with First Nations, and the larger extent of suicide issues, social problems that have been in the media are largely focused on First Nation communities. And I must say that there's an underlying thread and commonality of what some of the main issue is. It's jurisdiction and governance of health. Let me point to that specifically. It will be very important for this committee to recognize the issues and implications of cannabis on First Nation governments. As First Nation health authorities and the governance becomes more developed, you will find that when it comes to communities and territories that have a handle on the governance, that have control and authority within their community and their catchment and for their citizens, they are able to provide better health outcomes. I just attended a community, a former community called Hobima, Samson Cree First Nation, and they have 4 communities that have a health system that have an integrated model where they have a handle on their governance and they have a direct relationship with Canada. So my point being that it's not just the money coming in and the service being provided, but it will be ultimately the governance and authority of those First Nation communities to take an active role and responsibility in addressing the addiction problems in the community.
Your time's up. We'll go to Ms. Gladue.
Thank you, Chair, and thank you to our witnesses. Actually, you may know that Gladue is a Métis name, and my daughters are both non-status Métis, so it's an honor to have you here today and to hear your testimony. My first question is going to be to you, Chief Day. You mentioned the tobacco situation in Ontario, which I'm quite familiar with because in my riding, it's quite a business. And so obviously tax is going to be a point of discussion because that would be a price advantage. How do you see that we should go forward with resolving that?
I'm not going to speak to the tobacco issue in that context, because that's not what I referred to in the context of tax. What I referred to was the instrument called the Sitka, which is the agreement between Canada and Ontario on the harmonized sales tax and the point of sale tax exemption for First Nations in Ontario. So I'll say that. However, you did refer to the tobacco issue, and I did as well. So let me draw the draw the comparison, and the comparison is going to be around. We are going to be having to address this tax issue down the road when it comes to cannabis. We know that's what the jurisdiction in the province is going to be leaning on. That's how they're going to generate revenues and maintain that new infrastructure and law in Ontario. I'm here to state that I can only speak for Ontario, but we definitely will be wanting to address that issue. I can't make any assumptions. I can't make any initial conclusions as to what that would look like, but I'm just advising the committee you will have to come to grips with dealing with that issue. And I only draw the example that in Ontario, we were able to do that through the Sitka agreement, and that when a government-to-government dialogue and negotiation happens, I think good things could take place and unfold. And I think we're going to have to go into this, with goodwill, good minds, and a willingness to recognize the sovereignty and rights of First Nations on tax exemption.
Absolutely. I also really agreed with your comments about how this legislation is being rushed in a rather irresponsible way. There's 289 days left, and the police have said they're not prepared. The provinces, many of them, haven't come out with their plan, and so you've indicated that there's a readiness lacking with the First Nations and Indigenous groups as well. So I'm very concerned, because when I think about the Colorado experience, and what happened there, I'm worried that we may see some of the same things. One of the troubling things in Colorado was that in 16% of youth suicides, ages 10 to 19, cannabis use was present. And so I wondered, how long do you think it will take to get the things in place for you to properly implement the legislation?
We feel that it's being rushed. This is something that is going to take time, not provincially, and even at borders, like what's going to happen when somebody wants to cross the border into the U.S. I mean, there's a lot of issues for us to deal with, and we really feel it is being rushed, and we need the time to consult with our communities that we haven't had that opportunity to do. Lack of funding being one of them. So we need the opportunity to be able to have that dialogue with our Métis people. Thank you.
Okay, very good. And we did hear testimony that at the border, because it's illegal federally in the U.S., that if you're asked if you smoked pot and you said yes, you would be refused entry to the country. So
that's right.
That's what we know today. Question about, I don't know if any of you have any experience with the law, but we had a conversation with testimony earlier where we were talking about provinces or territories that wanted to not implement the cannabis legislation. They wanted to ban it. And there was discussion that said that wouldn't be allowed because from a judicial point of view, it would interfere with the federal intent or something. And I don't know if there's an exemption for Indigenous sovereign nations or not. So do you know anything about that issue? So
I know that the concern is the acceleration of the legislation. And the word that we're getting back is that in the event that a province or territory is not ready, that there will be federal online dispensaries made available, and those will be regulated in their own right. This is going to become a problem for First Nations, and I can't speak for the provinces and territories, but with respect to First Nations, we definitely do need to ensure that any parts of the Act that may affect us, that may be modified because of our land jurisdiction, our sovereignty and our authority of First Nation jurisdictions, that's going to need to be a separate discussion and I don't think that the days and weeks ahead are going to be adequate enough to deal with that. So there will be, some major concessions, and I fear there possibly will be legal challenges in the future if the federal government doesn't deal with this appropriately.
Very good. The addiction issues that we're seeing are on the rise across the country, and we've talked about how they exist as well with you. What resources are currently available in terms of treatment, and how much more do you think you would need to deal with issues that are expected to arise similar to what we saw with other jurisdictions that have implemented?
Okay. We don't have Métis-specific funding. Everything is provincial health funding, and the money that comes toward to the provinces. And in BC, we have 204 First Nations. So Métis are way at the bottom of that list, and so it's something that we always encourage the federal government to step forward and have the Métis included. And so we don't have any Métis-specific funding in British Columbia, and in other provinces, very little.
It's a huge gap as well. Thank you. I think that's my time.
Mr. Davies, 7 minutes.
Thank you for being here, all of you. Chief Day, was the Assembly of First Nations consulted by the federal government on the drafting of this legislation?
To our knowledge, no, not to any great extent. There's been, I guess, minimal notifications, but there clearly has not been a meaningful engagement, and let me qualify that. One of the ways that the federal government tried to come in and speak on this issue was from the health perspective. I'm being the Chiefs Committee Chair on Health. I have been privy to a couple times that the federal government came in, but they came in to this discussion with a lot of other mandates attached to the dialogue, and that simply is not a focused or fair way to begin meaningful engagement.
Let me read a quote from you from the task force report, the McClellan report that was issued last fall in 2016. It said, Canada's governments and many other organizations will need to work quickly to prepare for the implementation of the new system, increasing or developing capacity in many areas relating to production, distribution and retail, quality control and enforcement, and research and surveillance. This increase in capacity will require new resources, human and financial, enhancements to existing institutions, and the creation of new ones. Having all elements in place will be necessary for the proper functioning of the regime, and they recommended that the federal government take a leadership role to ensure that capacity is developed among all levels of government prior to the start of the regulatory regime. In terms of the First Nations or Indigenous governments in Canada, has the federal government been working with you on a nation-to-nation basis to develop those capacities?
No, they haven't. And again, it's going to be really critical. Again, I would suggest that thinking about, and I would ask the committee to visualize where we're at as the Assembly of First Nations. We have been given many assurances by the Prime Minister and other line ministries on a number of fronts. There's currently the First Minister's meeting that will take place on October 3rd. We have the law and policy review, and we have a fiscal table. Those are three critical tables that the AFN is just now getting underway in any meaningful way, and it's very challenging if you try to take the issue of, say, the environment legislation that is being reviewed right now in this country, and you look at the cannabis, the process of reviewing and engaging and making determination of where capacity is needed. That work has to be done well in advance, and the legislative process and the capacity and the mutually agreed upon process as to how that's going to gel and work together to meet a collective outcome. That's going to be the challenge, and that simply is not happening with this government.
Let me pick a specific focus that we've heard a lot of evidence about, which is the need for education, particularly aimed at young people. Has the federal government, have they been working with the Assembly or any Indigenous First Nations groups on developing specific targeted educational material in collaboration with Indigenous and First Nations input to roll out in advance of July 1 of next year? Or have they given you any money to do so?
No.
Okay. If you can, pardon me if you've covered this, but I'm not sure I understand exactly. How prevalent, Chief Day, is cannabis use among First Nations generally and youth?
Well, I'll say this, that right now there are two reasons why people use cannabis. One is for recreation purposes. The other one is to medicate, so health and social. And we know that the numbers are glaring. They're obviously more within First Nation communities. Why? Because of the social issues, impacts the legacy issues in our communities. The addictions are obviously higher. Suicides are higher. So the addictions and the use of cannabis from that perspective are going to be higher. But here's another area that we're finding, that more people are wanting to get off of opioids, and they're wanting to find ways of better pain management for cancer. And we're finding that people are just saying, listen, I'm going to use cannabis for pain management because it works. This is a reality, and the issue at hand here is that the studies haven't been done yet to substantiate that these are in fact effective. And we've got a problem because right now we're looking at if there are individuals that have prescriptions for medical cannabis, they're currently not covered. They're not covered under NIHB, whereas the veterans in this country are covered under that program. So there's some very contradictory plays at hand, and we feel that this needs to be addressed.
Thank you. Do I have any time left, Mr. Chair?
You do.
Okay, thanks. Sorry, I want to, when I keep using Indigenous First Nations, correct me if I'm using the term incorrect, Chief Day, but you mean when you submit reimbursement requests for medicinally prescribed cannabis to the government, they're not paying?
That's correct.
But they are for veterans?
Yes.
Now, we've heard already, and we all know that Indigenous people are disproportionately represented in Canadian justice and prison systems. How has cannabis criminalization factored into that specifically?
Well, you know, you can just assume that some of these summary convictions and, you know, ongoing addiction problems of our young people and being charged for breaches and carrying marijuana, this has created many issues in our communities because of the fact that the policing programs are not adequately funded, so the training in community-based policing is not going to be there. You've got a heavy cost on the justice system in our communities. You've got remote situations where if somebody's caught with marijuana and they're charged with an offense, that charge is left hanging there because court only happens so often. Listen, the impacts of cannabis in our communities is much greater, and I think that given that, just that small example, it should suggest strongly to the committee that needs to be looked at in great depth in terms of impacts of cannabis on First Nations.
Thank you.
Mr. McKinnon.
Thank you, Chair. I think I'll start by perhaps answering in a small way some of your concerns about funding. I note that Bill C-46, in terms of helping to implement Bill C-46, the provinces and territories can access up to $81 million for training and purchasing of oral fluid drug screening devices and training for field personnel for field sobriety testing and drug recognition expertise and so forth. Provinces and territories will be responsible for distributing this funding to municipal and Indigenous police forces within their jurisdictions. Beyond that, I think the funding concerns, the taxation, the sharing schemes, I think are certainly beyond my scope. I think I think those are things you're probably best advised to address with the new Minister of Indigenous and Crown Relations, as well as the Minister for Indigenous Services. In terms of concerns that we are being rushed, I've heard this from a number of sources, of course, but from my experience in project management, it is important to have target dates. And if you don't have target dates, things just slide out into infinity. So it is important to have these dates to work towards. And I have found that it helps people to put the resources in place to try and meet these dates. So I think they will be challenging, but I think that we have to do our best to do that. In terms of being ready, what aspects are most concerning to you? What aspects of this legislation do you think are going to be most difficult for you to meet?
I think just the sheer timelines. We're mere weeks away from this legislation, and the federal government is started off on a bad foot already. Our communities simply are not ready. There is a lot of education that has to happen at the community level, the engagement of local leadership. There are going to be, for example, treaty regions that have a vested authority and interest within their regions when it comes to negotiating permits and licenses. These are all things that the legislation is there to support and help expedite. I think that the actual literacy with respect to the legislation, that's going to be the first real challenge. Obviously, the point you made about us having to address this issue with the Minister of INAC, that's also going to be a problematic piece, because for us, if the committee is thinking like that already, that we're going to be relegated under the line ministry of INAC and not deal directly with line ministries within the context of this emerging legislation on a government-to-government level, then we're going to have problems. So I think in terms of going forward, the bilateral work that is going to be needed within the regions, with the Assembly of First Nations and on the ground with First Nations Pacific, the whole relationship piece as to how this law recognizes the legal rights and authority of First Nation jurisdictions, it will be a piece that I think you're going to have to come to grips with. And in order for us to do that, we need to get that dialogue happening on a government-to-government basis.
My suggestion to talk with the Minister of Indigenous and Crown Relations is fundamentally because this committee is charged with the responsibility of studying this law, right?
Yes.
And some of these other things you're talking about, I think, are well beyond the scope of this law, right? I would certainly welcome specific suggestions you have on how we could improve this law for your needs.
I will give you one suggestion. Put it right in front of the law and policy review that is currently before the AFN and the Prime Minister's office. I think it's one that is going to affect our communities, and it should be on the roster of laws and policies that should be reviewed. Better to do it if it's an inception stage rather than one that's left to barn already.
Would the Métis Council like to address these questions?
Thank you. Thank you for the question. And I think part of the brief that the Métis National Council put forward does reflect upon those recommendations that the task force made in terms of governments working together. There needs to be better coordination. There hasn't been bilateral engagement between the Métis Nation and the Government of Canada to date, at least not in a meaningful way. I do want to point out that it's very clear that the provincial governments have a fair bit of jurisdiction when it comes to the regulations. And if I may respond to one of the questions that was raised earlier in regards to access to mental health supports, I'd like to just point out as an example, with the fairly recently, all provincial governments, as you know, finalized federal-provincial agreements on health. There were considerable funding in there for mental health as well as home and community care. I believe it was about $11 billion over 10 years invested into these areas. An ongoing concern from the Métis Nation is when federal resources are transferred to provincial and territorial governments. That does not always mean that there will actually be any level of collaboration or investment into Métis communities, and we expect that that would probably be the case in mental health. So as far as I'm aware, there isn't any funding being provided by the federal government directly to the Métis Nation for mental health. And so that's the case with many, many instances. So I just want to make that point that the level of coordination between all three levels of government is extremely important. And I think it's a broad recommendation, but it's, I think, one of the most important foundational ones from our perspective. And that's why we reiterated the same recommendations that made sense to us that the task force had advised.
Thank you.
All right. Now that completes our 7-minute round. We'll go to our second round for 5 minutes, starting with Dr. Carey.
Thank you very much, Mr. Chair, and I want to thank the panel for being here today. But again, it emphasizes my frustration because we have such a short period of time with you, and I actually have a lot of questions, but I only have time for a few. So when I'm thinking about 289 days, now we've had the advantage of having Colorado and Washington in front of us, and they've actually said to be successful, before you come to the date when you implement, you should have proper education. In other words, in your case, very important culturally appropriate education, prevention measures, data collection. So you should be working on baseline now and then figure out how to collect this moving forward. Treatment, how to get kids into treatment, especially our kids, and the research. And what I found very disturbing from your testimony, it appears that the federal government hasn't reached out through other levels of government to actually get any of this in place, and we have 289 days. So for me, I think when you see some of the Liberal members criticize other levels of government, law enforcement, for not being ready yet, they've had 2 years to get this in place, and I'm concerned. I'm very much concerned. But again, I got a lot of questions, and I would like probably to talk to you about some of the more difficult, controversial things. So Chief Day, you brought up something that no other panelist has brought up, and it's about the autonomy and unique circumstances that some of your communities have. And you brought up this idea, dry communities. And I was wondering if you could explain a little bit about the rationale for this, but also, because I probably won't have time to ask you again, maybe you can fit this part in, but I think it's really important because this legislation obviously doesn't allow for the necessary autonomy you need. What one thing, if you can get one thing into this legislation, what would you like to see? So it's kind of two things. First, if you could talk to me about the controversial, dry communities. Nobody's brought that up. I want to put you on the spot for that. But also, what would you like to see? Because we want to make, if they're going to do it this way, we want to make it the best legislation we can to protect the health and safety of our kids. And what we learned from Colorado and Washington, and Chief Day was right on it, they target, organized crime targets youth. And we want to make sure that this is the best legislation we can get. So I'll shut up there and let you go, Chief Day.
So with respect to the issue of autonomy, I think the federal government and Minister Jane Philpott moving over to INAC now is a good move. Her and I have worked considerably well together in the last couple of years. It's why we've seen some investments, some off-budget cycle investments. We've seen really good work come from her shop, and I'm so glad that I have an opportunity to work with her. When it comes to First Nation health transformation, look what's happened here in the last year or so with regard to the Health Accord in Canada. The federal government had to deal and negotiate specifically with the regions across the country. Manitoba was the last holdout. And finally, there was an agreement. For First Nations, we have been pushing on health transformation because we have issues of autonomy. We have health governance issues. We've got capacity issues. We've got systemic issues. If to answer your question, what I would want to see in the legislation going forward is that the First Nation health transformation agenda be considerably recognized, and that there would be components within the legislation that build on that principle that there is a First Nation health crisis that has been here for decades, and it's going to take years for the federal government and First Nations to fix that. So health transformation for First Nations is going to be a much deeper exercise, and I think the legislation needs to recognize that.
Could you comment on the dry community?
The dry community piece is actually there, and in many cases, it's there for good reason. If you don't have the proper healthcare system, if you don't have proper social programs, if you don't have infrastructure, to add alcohol into a community is like adding fuel to a fire. And in many cases, as you know, not because of any of the moral aspect, and I want to be clear about that, this is not a moral issue. This is a human right to health issue. And First Nations do not have access to the human right to health in a substantive way in our communities. So therefore, alcohol and drugs make things worse. You know, communities say, because we have the ability, we want a dry community because we don't want our community to hurt any further.
Can the federal government force you to, because these mail order, they said if you're not ready, there'll be a mail order. What would you think of that situation?
That's going to be that's a jurisdictional gray area, and this is why we need to look at the First Nation health transformation piece very closely, and that's why we need a bilateral table. That's why the federal government, this committee should strongly recommend that any preparatory work or capacity front-end loading in terms of getting us ready should be done, and we turn to the committee for support on that.
Can we hear a comment from Métis?
I think from the Métis Nation perspective, one of the things that would be a huge benefit is explicit recognition of the Métis Nation and perhaps other levels of Indigenous First Nations and Inuit governments as well. I think explicit recognition and inclusion in the legislation would be an important step. That will define how we work with the Government of Canada and perhaps provide greater safeguard that there will be resources provided, that we will work in collaboration. I think it just provides a much more assurance and spells out a way that we can work together, as opposed to being an afterthought or, you know, just not adequate consultation and engagement. So I think that would be a real, you know, a strength.
That's it. Thanks very much. And now we go to Mr. Ayoub.
Thank you, Mr. Chair. I'm going to ask the question in French, so if you need I'm going to wait for you to be ready to hear me before starting. Donc, merci de...
Thank you for traveling to us today. It's very important for us to hear your perspectives. Like all other stakeholders, you've raised very interesting points. To start, I would like you to give me your impressions, your overall thoughts about the relations that you've had with the federal government in terms of health over the last 2 years and communication since the change in government. How would you characterize this relationship? Is it one of growth and openness, or is it closed and still progressing? How would you qualify it? How would you characterize it?
Our relationship and our impression with the current government, and I'm going to speak specifically to the health file, because this is a multifaceted issue. Cannabis is legal. It's social.
I want the big picture.
The big picture?
I want the big picture and see what's the relationship between the two.
Our relationship is at a crossroads right now. We know that the federal government has made substantial commitments. There has been a setting of the table, if you will, but we've not yet experienced the full meal deal yet from the federal government. And it's really important to recognize that time is of the essence, that we cannot be strung along and be provided commitments on certain things and not be afforded the resources, not be afforded the opportunity to help shape the process from the front end, not halfway down the road. Our challenges are quite deep, and we have capacity in our communities to know what our issues are. Oftentimes, the federal government going forward, say on law and policy review, will basically shape and shift the process, and we are not at the front end. So we understand, sir, that we're not part of the federal family, but we are the neighbors next door that have been here since time immemorial, and we should be participatory in all parts of the process at the front end. So, for example, in setting out this legislation, we need to have the resources available. We need to have the ability to help shape how the draft legislation will be done. So, co-development of legislation. I think the federal government is beginning
I've got only 5 minutes to have the answer, and I want to
I think the federal government is getting there, but there's more work to be done.
Thank you. Maybe for the meeting.
Thank you. I'll refer back to, again, the accord that we signed with the federal government. We're working really well with this government, with growth and openness, especially after the Daniels decision, and the commitment set forward to work nation-to-nation, government-to-government relationship between Canada and the Métis Nation under this new accord. We have co-committed in advancing a range of priorities for the Métis, which we've never had before. So it's been working really well for us and moving a lot of these initiatives forward, especially in health.
Je comprends de vos.
I understand from your answers that there's a lot of work that remains to be done, particularly Mr. Day, and even if things are going well with the Métis, there's still work to be done. I also understood that we agree that the situation can't change overnight. There's a lot of work to be done, and time is a factor. We can't change what was done in the past. We can only move forward and make changes for the future and set the path that we wish to follow. And with respect to health and cannabis, this is a cornerstone piece of legislation that will change things. And the communications side and information sharing side and assistance and accompaniment is important. But I would like to hear from you. What efforts have you made on your end to communicate with your people? Town halls, for example. I've held some. There's funding, financial assistance. It didn't cost me a lot to consult people as an MP. I can have town halls, and it's quite simple. We're able to hear from our constituents and hear their concerns and address them. I would like to know what you have done on your end over the past 2 years, knowing that this cannabis legalization framework was coming down the pipeline.
So very quickly, so we have been doing work, and I must say that that's on one side a fair question, and on the other side it's a red herring. Because you do need resources to actually go deeper into issues and impacts of cannabis. If you lived in one of our northern communities for 2 weeks, I think you'd have a very different opinion around the ability to consult.
I don't have any judgment.
Okay.
I just want the facts.
So that's my first point. The second point is we have the Thunderbird Partnership Foundation, and I'll leave the document for the committee. It has already began to lay out some of the initial discussion points and questions. So there are questions here 8 considerations for Indigenous communities. I won't read them into the record, but they're here. So there is the ability for us to begin that work, but it's a much, much deeper discussion that does require resources and collaboration with the federal government. Thank you.
Thank you very much. Time is up. Now we're going to go to Mr. Weber.
Chair, and thank you for being here. I'm pleased that you were included part of this this Health Committee study. I'm a little bit disappointed that you feel you weren't included in the task force and in their deliberations. One thing I do want to say, though, is that I had the honor and the pleasure of working with both your communities, First Nation communities and Métis communities, as the Aboriginal Relations Minister of Alberta for a number of years. And I can tell you, I know that I know the challenges that face both your communities, and I just wish and hope that the future will be brighter for the Indigenous communities, including the Inuit communities as well, which are not represented here today, and likely were not represented at the task force hearings either. I don't know. Any event, one thing that has not been brought up here yet today is the inclusion in the bill of the opportunity for Canadians to cultivate at home up to 4 plants. And I'm just wondering what your thoughts are on that and how it affects your communities. I'll start with Chief Day.
Oh, I'm going to keep this very straightforward. Again, there's a land tenure, land jurisdiction issue with respect to the Indian Act. That's going to be a very specific study. That's going to be a very specific exploratory dialogue with First Nations, because, as you know, First Nations are now developing their own constitutions, for example. There will be a very, very different set of issues from a legal standpoint that you'll have to deal with than within the mainstream. Our communities will want to be putting that information forward. So again, to the previous speaker, committee member, the question of getting out there and having discussion, there are much deeper issues that need to be looked at, and this question you raise is one of those.
Absolutely. And the Métis Nation community?
That's a difficult one for me to answer. We haven't had many consultations on the 4-plant issue. As you know, our communities are so diverse in throughout our nation, and so we do have community engagement, and I travel within the province and across our nation, and we do communicate with our communities. However, it's the funding for education in communication, the funding that we don't have. Yes, we talk to them, one-on-one type of thing, but to get to all the communities, it can be also difficult. And for them to travel to from northern Alberta to Edmonton type of thing. So there's these issues that face us, but we haven't gone into, so I can't really answer that question on the 4 plants. Thank you.
Both of you, your concerns with not being ready by July 1st, the deadline, and I'm just wondering, what you've mentioned a number of issues of what has to be done before you will be ready. Of course, funding is a big part of that, but if, of course, the government does provide those funds, they're good at spending money, providing funds. If they do, is the date of July 1st, is it reachable for you to be prepared, or have you got a specific date that you think you will be prepared for this new legislation?
I think, and I'm going to speak from the perspective of the sequence of our assemblies. Our First Nations, we have almost like tiered assemblies. And for example, we have 2 major assemblies, and then we have special chiefs assemblies and annual assemblies. The next major assembly for the AFN is going to be in December. We will be scurrying. We will be pressured to address the issue of cannabis legislation. And the next one is not going to be until after the legislation has been introduced. So, yes, we need the resources. Secondly, The issue here is going to be we have not been considered with respect to the decision-making process, even in our own assemblies as First Nations. So that's going to be a major sticking point, and I think one that is going to suggest to the committee that they recommend to the federal government that you're going to have to reconsider this, because First Nations simply will not be ready from the context of our constituencies being our chiefs making decisions in those assemblies where we formally feed back to the federal government.
The Métis community?
Well, it is an ambitious time frame, but we feel that a lot could be done, particularly when we think about the role of the Métis Nation in terms of health promotion kind of activities. Those are things that we can move on right away. We have the Métis governments have their infrastructures in place. They've got networks and infrastructure in terms of working with citizens and communities. So those are things that we could start on right away. But I will also reflect on that we would see this as being a longer-term partnership, particularly when it comes to, reviews every 5 years, reviews of the legislation, and this is an opportunity to again reinforce our recommendation for investments in research and surveillance. So, of course, surveillance being something that you'd want to see sustained over a longer period of time.
Okay,
if that helps.
Thank you very much. Now we go to Ms. Sidhu.
Thank you, Chair. Thank you for all being here and your valued presentation. I just want to say for the record that ITK was invited to join us today. And my question is for Ms. Cole. I was reading your submission that came across data that said that incidences of self-harm among Métis girls rose from 27% to 36% from 2008 to 2013. That is obviously troubling numbers. Can you tell us on the need for instilling a strong culture identity within Indigenous youth to combat mental health and substance abuse issues? When the suicide rate is very high, don't you think there's a need to do something?
There's definitely a need to do something regarding the suicide and we've got the alcohol drug problems within all our communities, and like I mentioned earlier, in the urban areas. And as you can see, some of this data is 10 years old. And but we know that the suicide rates are extremely high within our communities. Now, this is going to have an effect, definitely, on these communities. And the rates are going up all the time compared to, non-Aboriginal populations. I hope I answered that question. Thank you. It was high, I couldn't hear.
As we carefully studying this bill, we'll be moving into more detailed. Is there anything within the federal government's authority that you feel could be added to benefit Indigenous community when the youth are already consuming cannabis? The numbers are very, very high, and it was on our campaign promise, like we are very carefully when we are bringing this legislation. So when youth is consuming a lot, the numbers are there. So that's what, when this legislation is coming, what is your thought about it? It's not affecting on that youth, and when we are legalizing strictly.
That's why, it is very important to the education part to start the prevention as young as possible within the communities with our youth. And that's where I talked earlier about communication, the education, and, for me that's important, that to start as young as possible on the education front to try and get these numbers down. And right now it all stems back, like we talked about, mental health. And there's so many underlying issues. And so for us it would be education.
In order to do that number down, so we are rushing.
Yes.
So that's why we're taking that step. Can you elaborate on that? So do you think that step is not right?
The rushing, sorry, for...
Like I'm hearing federal government is rushing, so do you think it's not the right time to take the step?
Well, I'm not saying it's not the right time. It's how we approach it to get this legislation in place and what our needs are, and as Métis across our homeland, and make it like getting the communication again. I mean, there's a timeline, and I'm sure we can work within that timeline. It's going to be very tight for us, and you know, we've been working with communication within our communities, if I'm answering the question correctly, on this issue. But it's going to be tough for us to work on this any further.
Yes, you see the delineation here again is the Métis community is absorbed by the mainstream. So there is no land tenure, there are no treaties, there are no Indian Act issues to address. Much of our problem is the Indian Act. So there is going to need to be for us, and my response will be, no, it's too fast. We're not ready. We simply will not be ready. I think it's really important for the federal government and this committee to make the strong suggestion that we need to understand what the impacts are. That's the theme of my presentation. Impacts to public health. We need to look at prevention. We also need to look at law enforcement and overall the socioeconomic impacts in the strategy going forward. That front-end work simply hasn't been done in the context of First Nations in Canada in response to dealing with the issues, the systemic problems with the Indian Act and the Indian residential school legacy.
Okay, time's up. Mr. Davies.
Chief Day, we know that the federal government has decided to download the questions of distribution onto the provinces. I'm just wondering who will determine distribution methods on federal on banned lands or reserves?
First Nations are saying it will be First Nations.
Mm-hmm.
That's the issue right now. So, for example, being the Ontario Regional Chief, I don't have the types of delegated authorities that the province does. Mm-hmm. I'm merely a spokesperson on issues where I have a mandate to speak from, and that is being every First Nation has their own authority, their own jurisdiction, and ultimately those issues and those major concerns around First Nation jurisdiction, they have not been put on the table yet. There's a lot of work to do to understand from the standpoint of our work in the province. The provincial government is trying to make an effort now to meet the timelines, and they simply don't, in Ontario, they don't like to have to deal with the time pressure either, but they know they need to do something. So
I'm sorry, I'm going to try to understand this. Is that clearly understood by the federal government, the provincial governments, that it will be First Nations determining distribution on banned lands and reserves?
Yes, that's correct. It's not been discussed yet to any great degree, and there will be a push and pull for quite some time until it gets sorted out. There is no mutual understanding yet. That hasn't been an issue that has come to terms yet.
Mm-hmm. So I mean, we're 10 months away from legalization, and the whole question of, you know, whether it's going to be in retail stores or dispensaries or through some form of banned corporation or economic body, none of that has been. The work on that has not really started.
No, it hasn't. And if you look at the continuum of implementing such a law, you not only have the policies, regulations, quality assurance, those types of standards. You also have the ability or inability to enforce laws. Right.
I anticipated where I was going next, which is enforcement. So, right. Who will be responsible for enforcing Bill C-45 on banned land, on reserve lands and banned land?
I think it's highly irresponsible of the federal government to not be able to answer that question at this committee right now. And I think that's one of the outstanding questions that we have that is going to really determine whether or not we state that we're ready or not. And I will have to tell you that most communities are very nervous right now that they in fact will not be able to enforce their own laws or even the federal provincial laws with respect to medical and recreational cannabis.
Now, we've had a number of people testify about the harm that criminalization meets out, particularly to youth, particularly to marginalized groups, particularly to people of color, and of course to the Indigenous communities as well. And there's been a call to have the government, particularly the Minister of Justice, instruct federal prosecutors to stop charging or prosecuting people for simple acts of possession now. Is that a call that you would favor and support?
I would support that, yes, but the caveat being that there needs to be a plan to deal with the impact of that. We certainly know that the cultural shift in Canada is changing now. We smell marijuana when we walk down the road in our urban centers now, and you know, what is that doing to the family? What is it doing to the communities? We know that once this rolls out formally, that there will be major changes in our communities, and the federal government needs to consider that going forward.
Final question: are there any First Nations producers that you're aware of? Is anybody in the First Nations world, are they looking to this as perhaps an economic development potential for First Nations?
Yes, there are, and I need to be clear on that. And this is where I don't have the authority to give you any information as to where they are, but they do exist. And our First Nation communities are entrepreneurial. They know what their sovereignty rights are, and they certainly are preparing for the economic opportunities. And I am being told that First Nation businesses and communities are going to want to assert their rightful place within this emerging industry.
Thank you, Chief.
Completes our official time, and I want to thank our. Do you beg your pardon? Yes, go ahead.
Do we have time for another round? I don't think we finished till 3:45.
Well, you could move the request to now seek.
I'd like to move to seek unanimous consent
Do we have
to add another round.
Unanimous consent for another round of 5-minute questions? Okay, we do. Ms. Sidhu, would you have a question? Yeah, I'm sorry, I didn't mean to catch you off guard, but I thought you did.
Okay. Chief Day, it is known fact that throughout the criminal justice system, Indigenous Canadians are overrepresented. How do you think the use of the YCGA, Youth Criminal Justice Act, might help benefit Indigenous youth? This legislation also includes a ticketing option for minor offenses by adults. Do you see a similar benefit to Indigenous community?
I think so. I think it will prompt the federal government to, again, look at the community justice systems, and it's not going to be, how would you say it? Finding those solutions won't be a one-size-fits-all. It will be very important for the federal and provincial governments to recognize that community justice programs per region will need appropriate attention, will need appropriate investment. You see, one region, say the province of Alberta, may have a different working relationship with the First Nations in that region. Those programs may be different in nature. In Ontario, we're looking continually at ways of improving our relationship with the Ontario government. But again, I'll say it is always going to boil down to the types of investments that are made in community policing. Community safety will always be our target, but enhancing and augmenting those capacities at the community level will require that we have a hand in any changes in legislation that promote moving beyond reacting to addiction and then kids in courts and in the penal system, and those that are actually moving beyond and getting the proper mental health services and the proper prevention programs. So yes, I think there should be adjustments made, and I think that should be a high consideration for this committee to consider.
Thank you. That's it.
Now we go to Ms. Gladue.
Thank you, Chair. My question is for the Métis Nation. I was interested when you were talking about the age statistics that 41% of Métis are under 25. We've had a lot of discussion here about what the age of legalization should be. We had testimony from the Canadian Medical Association and quite a number of doctors that said that for everybody under the age of 25, if they were using cannabis, they had an increased risk of schizophrenia, psychotic disorders, depression, a number of mental health issues. And so I'm interested in your view on where we should set that age for legal smoking and possession.
When we were looking at that, we talked about that same issue, and it's different from like BC to, again, Ontario. That's why we came up with the legal age of 19 for, consent. That's the drinking age. They're drinking alcohol and things like that. So that's why we went with the age of 19. If we go to 25, that's not, realistically, they're going to be smoking cannabis anyway. So for 19, we thought that was a good age. And, earlier there was even a question about possession. We have to look at it's necessary to separate the drug use from the criminal, fields, and then the illegal market. So these are a lot of issues that we have to look at.
Mm-hmm.
So.
Yeah, with respect to the possession for children ages 12 to 17, the bill recommends that they could have up to 5 grams. And there was conversation about whether they should receive any criminal charge if the possession amount was above that, or whether it should be a ticketed offense, or whether there should be perhaps mandatory education and medical follow-up. Do you have any opinions? I would ask all of you if you have any views to share.
I think that there has to be that education and medical follow-up. Again, for us, that education part is really important, and that communication, and to do a criminal charge at that young age is going to be with them for a long time. So and I know a lot of communities, they like to deal with this within their communities also, So for us, that education and health would be to moving forward on that issue.
I think just quickly, the regulatory impacts of this legislation are going to be huge on our communities. We're dealing with a long list of policy and legislative issues on a day-to-day basis. This one is going to be huge because it's not just the health, it's not just the economic, it's the social, and I would say that the social impact burden on cannabis use and age levels and the provisions within the law, those are going to need to be discussed in our communities very quickly. And given the fact that there's 289 days left, it's simply I can't even fathom that we'll be ready to accept legislation from the federal government by that time.
Right. The hemp producers were here, and they asked to be exempted from this legislation. They asked us to add them to the schedule. Is there any concern from your communities if we would do that?
I have no comment on that. I have not put any thought to that.
Okay. And my final question then has to do with packaging. So with respect to cultural considerations on packaging, obviously the purpose of the packaging part of this is to try to make sure it's not an attractive package that's going to appeal to youth and all that kind of things. Are there any cultural considerations that we should include in the packaging regs?
It's something we haven't even gone down the packaging route yet. I mean, look at cigarettes. There's no packaging, and it's all behind doors. So it's something we haven't even looked at the packaging side of that at this time.
For First Nations, again, I think the overall effort in the tobacco control strategy and what the federal government has done around packaging is based on prevention. we definitely don't want people getting sick as a result of cannabis. And if we use packaging as a way to prevent illness and the impact as of such, then I think we do support that. But there's also the other side of it, the proprietary interests and rights of First Nations. First Nations are always going to defer and try to find, in our discussions with the federal and provincial governments, the rights and the proprietary interests of our people in business. Things are different in our First Nation communities. You look at the cigarette industry. We have seen some accelerated advancements in that industry in Ontario, and that benefit the communities. And they certainly look at branding and they look at packaging, and it's something that is a proprietary interest and something that's going to need to be protected as well.
Okay.
Mr. Davies, very thoughtful.
To all of you, I think we're not aware yet what the tax proceeds will be from cannabis, but I think that we're speculating that there will be some significant funds that will be flowing from the revenue stream. I'm just wondering where you would like to see, well, first of all, what the revenue split should be and where you would like to see that revenue directed.
So, thank you for the question. Obviously, there is always going to need to be public-private sector interests. Our nations need to find ways to be part of participatory in ways to help sustain communities. So one of the obvious ones will be in the area of health, possibly in education, but to ensure that there's an economic footprint and opportunity in our communities. That's going to be really key. But let me speak to the issue of exemption and taxes. I'll impress upon the committee again that there needs to be immediate discussion, not just provincially but federally as well, with regard to tax exemption, as well as what instruments will need to be explored to ensure harmonization could occur. Again, and I'll just use the example of the HST and PST exemption in Ontario. First Nations are exempt from paying provincial sales tax. That will be on the table. It will be a consistent expectation from our First Nation communities. How do we move beyond that? Again, those are my comments.
Ms. Delcourt?
Métis people, as Métis people, we do pay taxes. And so I'd like to see some of that tax money come back to the Métis Nation and to our people, like I keep saying, education, prevention, health resources, treatment centers. We're going to need all these things. And so I'd like to see some of the tax money that we do pay come back to the Métis people.
Thank you, Mr. Chair.
Well, that concludes our session. And I want to say on behalf of the committee, you've made an amazing presentation, because we've had over 80 presentations. You've still brought new facts and new issues to the table, and we appreciate it very much. And I think you've done a great job of presenting your issues. So I want to thank you all for your time and the effort you put into this and the thought you put into it, too, as well. So that completes our this session, and we're going to suspend now until 3:45. Thank you. Evening, our meeting number 67 of the Standing Committee on Health. We're studying Bill C-45 on cannabis, and our panel this afternoon is going to discuss labeling and packaging. Now, our witnesses today are, we have Dr. David Hammond, Professor, University of Waterloo School of Public Health and Health Systems, by video conference. Thank you for coming along with us. From the Atlantic Convenience Stores Limited, we have Mr. Mike Hammoud, President. And from the Non-Smokers' Rights Association, we have Melody Tilson, Director of Policy, and Pippa Beck, Senior Policy Analyst. Now, we'll open with each organization will have a 10-minute opening statement, and then we'll open it up for questions from the members. So we will start with Dr. Hammond.
Thank you and good afternoon. I'm a scientist, and for almost 20 years I've been conducting research on the impact of health warnings, product labeling, and the effect of branding and marketing in the areas of tobacco, food, and most recently cannabis. And I want to be clear, I don't accept any industry funding, and I don't represent any organization for or against cannabis legalization. I've also served as an advisor to the World Health Organization and regulatory agencies around the world, as well as an expert witness in tobacco litigation, including on behalf of the Government of Canada. Now, I'd like to focus on the public health implications of three areas. One is restrictions on branding and packaging, the second is health warnings, and the third is product labeling. Of all the areas covered in the Act, marketing and promotion can have the most direct impact on who uses cannabis, what types of products are used, and for what reason. The marketing restrictions proposed in the Act are largely modeled on those for tobacco products in Canada. And like tobacco legislation, the Cannabis Act seeks a balance between allowing product information to reach adult consumers while prohibiting marketing that promotes use, especially among young people. The question, of course, is how to balance and how to accomplish that balance. And I'd like to touch upon several lessons from our experience with tobacco marketing over many decades. The first lesson is that branding has the greatest impact on young people, those whom the Act seeks to protect. The second is that limited marketing restrictions have limited effectiveness. When most traditional forms of tobacco advertising were prohibited, the marketing expenditures didn't stop. They simply shifted to other channels, including packaging and the retail environment. And for this reason, Canada and other countries are implementing what we call standardized or plain packaging of tobacco products, which removes logos and brand imageries from packs, but allows product information to be displayed. Plain packaging is an effective public health measure. Not only does it reduce the promotional appeal to young people, it also enhances the impact of health warnings. Now, if the government were to pursue its objectives without implementing plain packaging, the government would find itself with the responsibility to police thousands of individual packages to ensure that brand imagery does not increase appeal among youth or promote a positive lifestyle. That's an incredibly resource-intensive and difficult task, which has proved ineffective for tobacco products, as it almost certainly would for cannabis products. The third lesson from tobacco is that once marketing and promotion is allowed, it's very difficult to scale back through regulation or new legislation. Consider that it's taken 50 years and multiple legal challenges for Canada to achieve the current restrictions on tobacco marketing. It is much harder to restrict marketing after it's been permitted than it is to loosen restrictions. And once it's been allowed, the effects of promotion and marketing can persist long after removal. In short, it's very hard to put the genie back in the bottle. The fourth lesson is that the removal of branding does not promote illegal or contraband sales. Testimony to this committee earlier this week suggested that restricting cannabis branding would make it more difficult for consumers to distinguish between illegal and legal products. That simply is not accurate. Cannabis products acquired through legal retail outlets will be clearly distinguished by health warnings and other labeling requirements. It's simply not credible to associate reduced branding with an advantage for illegal products. The same argument has been made by tobacco companies to oppose plain packaging laws, and these arguments have been refuted in multiple legal rulings. Overall, if the government wishes to prevent lifestyle advertising and promotion to young people, the Act should include plain packaging. Health warnings are another essential component of labeling policy. The question is, what should cannabis warnings look like? Well, what does Canada want to say about the risks? Is driving high really all that risky? Does it really harm a baby when their mom uses cannabis when pregnant? Most Canadians are uncertain about the potential risks of these products, and they want this information. Health warnings are the most cost-effective, self-sustaining way of communicating with Canadians about cannabis. Should cannabis warnings look like the ones on cigarette packs? Well, if they don't, they should at least incorporate the same basics of effective warnings. That is, they should be large, they should use color, and include pictures. Large pictorial warnings are the most effective way to reach children and youth and the most vulnerable members of our society with low literacy. Now, warnings aren't just about scaring consumers away from a product. They're about informing consumers, but they also provide an opportunity to provide support for those that need it and for addiction. In Canada, every cigarette pack includes a telephone helpline number and a website for helping Canadians quit smoking. We have evaluated this, and it works well. I would urge the government to display the same services on cannabis packages to demonstrate their commitment to reducing addiction. Lastly, I'd like to briefly discuss labeling on product contents and dose. I think there's strong consensus that THC levels should be displayed on packages. But we can't simply rely on providing numbers to consumers. How many people in the room today intuitively understand what 50 milligrams of THC means? Is that a little? Is that a lot? And what does it mean in terms of different products or routes of administration? Consider that Canada is about to start using what we call traffic light labels or high-low symbols on food packages. And we're going to be doing that because it's easier for consumers to understand and use. The same principles should apply to cannabis labeling. If it's important enough to use symbols for canned soup and sugary drinks, it's important enough for cannabis products. I would argue that THC and dose labeling should also be reflected in the actual packaging. When edibles are eventually sold on our market, each dose should be individually packaged. Think about individual pieces of gum that are packaged within the larger packaging, or those little Halloween chocolate bars that we now hand out that are sold in, again, a larger packaging. To conclude, overall, the public health impact of cannabis will largely be determined not simply by whether it's becoming legal, but how it's regulated in a legal market. Comprehensive restrictions on marketing and promotion should be given precedence in the Act and should include plain packaging. Large, clear health warnings that use images will provide governments with an efficient and highly cost-effective means of communicating with consumers. And they should also be used to support Canadians that need help with addiction. Regulation should also heed the lessons from Washington, Colorado, and other states that have legalized cannabis to ensure that effective labeling standards for edibles and different forms of cannabis. Collectively, these measures will demonstrate the government's commitment to ensuring that cannabis legalization benefits public health. Thank you very much.
Thank you very much. Now we'll move to the Atlantic Convenience Stores Association. Mike Hamoud, President. Welcome.
Thank you. Good afternoon, everyone. I'm Mike Hamoud, President of the Atlantic Convenience Stores Association, or the ACSA for short. On behalf of the ACSA, I'd like to thank the Standing Committee on Health for inviting us here today to speak on the labeling and packaging of retail cannabis as it pertains to Bill C-45. Within the context of my presentation today, it is our understanding that the objectives of the Act are to prevent minors from accessing cannabis, to protect public health and public safety by establishing strict product safety and product quality requirements, and to deter criminal activity by imposing serious criminal penalties for those operating outside the legal framework. It is also our understanding that the Act is intended to reduce the burden on the criminal justice system in relation to cannabis. More specifically, the focus today is on the labeling and packaging of regulated cannabis products at retail. To that end, I believe that our experience with tobacco retailing has significant relevance to the issues that you're dealing with. First, I will begin with some information about the ACSA, our members, and our collaborators. Secondly, I would like to delve into the specific issues of the labeling and packaging of regulated cannabis sales and our experiences with tobacco packaging and labeling. The ACSA was established in 2009 as a not-for-profit trade organization to promote responsible convenience retailing and to represent the economic interests of our convenience store members. Today, our membership includes more than 2/3 of the convenience store locations operating in Atlantic Canada. In collaboration with the Canadian Convenience Stores Association, the Western Convenience Stores Association, the Ontario Convenience Stores Association, the Quebec Convenience Stores Association, and the National Convenience Stores Distributors Association, we have considerable experience with and insight into convenience retailing. Convenience retailers are heavily regulated, be it lottery, food services, beverage, alcohol where available, and in particular, tobacco. In tobacco retailing, we have experienced monumental change over the years, and we have worked with regulators in our industry to achieve what we believe to be two primary goals. The first is to minimize tobacco consumption among minors. The second is to minimize the rampant distribution of illegal tobacco. Ladies and gentlemen of the committee, I am of firm belief that we can bring relative and pertinent insights to your deliberations. So let's move on to the labeling and packaging of federally or provincially regulated cannabis at retail. At present, legislation Bill S5 has been put forward that would introduce plain packaging for tobacco products in Canada. This legislation would eliminate, as mentioned earlier, would eliminate the branding of products. By this, we mean the trademarks, individual logos, graphics, and colors that differentiate one product from another. With a standardized generic package, the only brand identification would be the product name in a small and simple standardized font. Everything inside would look the same. The catalyst for this is Australian plain packaging legislation that came into effect in late 2012. However, this example and others demonstrate that plain packaging doesn't work. In the case of Australia, the reality is that an examination of all publicly available, relevant, and reliable data after 5 years points to the same conclusion. There has been no statistically significant decline in Australian smoking prevalence. In the Australian plain packaging environment, there has also been a dynamic shift in market share between legal and illegal tobacco products, with consumption of illegal products increasing. Is there a correlation between plain packaging and illegal consumption? Our Australian colleagues are of the opinion, and we concur, that plain packaging is the catalyst for a race to the bottom in terms of lowest price point, being the primary purchase motivator. And when the price becomes the primary purchase motivator, that opens the door to illegal purchases that can be made at a fraction of the price of legally sold product. In Canada, we estimate that illegal products account for some 20% of the overall consumption of cigarettes, with the illegal market share being upwards of 33% and higher in Ontario. In the end, labeling and packaging are immaterial to many tobacco purchases relative to access to cheap smokes. How would this be any different for retail sales of cannabis? We know that many illegal cigarettes are sold unbranded in loose and poly bags, also known as baggies, but it should be noted that plain packaging opens the door to increased distribution and sales of counterfeit or look-alike packaged cigarettes simply because it will be so much easier for illegal producers to replicate the packaging. Will your average smoker know the difference? It's unlikely. More recently, plain tobacco packaging became mandatory in France as of January 1st of this year, in what was described by proponents as a decisive weapon against smoking. To the surprise and shock of many, first quarter sales of cigarettes in France increased 7% compared to the same period in 2016. The French Health Ministry's General Directorate of Health dismissed the sales increase, saying that plain packaging would not influence current smokers, that plain packaging was principally targeting younger people, and that the impact would only become apparent in the medium to long-term future. What we have then is a plain packaging advocate saying that plain packaging will have no impact on established smokers, and that the target population for plain packaging is youth. Well, let's look at the situation at a Canadian context then. As far back as 2003, there have been strict rules in place in Canada related to tobacco marketing that prevent the advertising or promotion of tobacco, testimonials, accessories, and anything else tobacco-related that could be appealing to young people. Today, there is also mandatory use of locked cabinets or screens at point of sale to hide tobacco products from display. At the same time, A large majority of retailers are vigilant in screening out underage buyers through the widespread practice of asking for proof of age identification. Our industry takes great pride in its ability to be a responsible and diligent partner to government in the controlled sale of age-restricted products like tobacco. Programs such as our We Expect ID training are a commitment to assist retailers and their staff in upholding the highest standards of professionalism and ethical conduct and to supporting public health and safety. Underage youth in Canada today have negligible exposure to cigarette packaging and labeling. In our opinion, the unintended impacts of plain packaging, such as a lowest price mentality among consumers or the risk of increased contraband sales, far outweigh any perceived benefits. It is notable that youth cannabis smoking rates in Canada are twice as high as youth smoking rates. According to Health Canada, the national youth tobacco smoking rate in 2015 was 10%, while the national youth cannabis smoking rate was 21%. Generic packaging would not be an effective tool in achieving what is a common goal for all of us, which is negligible rates of both tobacco and cannabis consumption among youth. We believe if governments are serious about reducing smoking, be it tobacco or cannabis, then there is much more work that can be done in the areas of education and smoking cessation. Convenience retailers believe that the types of initiatives in place for tobacco retail sales in Canada can be replicated effectively for the retail sale of cannabis without resorting to the questionable value and impact of plain labeling and packaging. And as is the case with tobacco, industry, anti-cannabis groups, healthcare organizations, and governments should work together to minimize the number of youth and adults consuming cannabis. So in conclusion, we recommend to the committee that branding on cannabis retail packaging be allowed for two important reasons. One, to reduce the ability of criminals to produce and distribute contraband product, and two, to minimize the impact of lowest price point by educating and allowing legal consumers to make informed decisions on their product choices. Thank you.
Thank you very much. Now we'll go to the Non-Smokers' Rights Association. Ms. Tilson, are you opening the statement?
Yes, I am.
10 minutes? Okay, thanks very much.
Thank you, Mr. Chair. Good afternoon, honorable members. Thank you for the opportunity to speak to you today. As you heard, my name is Melody Tilson. I'm the Director of Policy with the Non-Smokers' Rights Association, and with me is our Senior Policy Analyst, Pippa Beck. Together, we have more than 40 years of experience in tobacco control. Our organization, the Non-Smokers' Rights Association, has been at the forefront of tobacco reforms in Canada since its inception in 1974, leading campaigns for the Federal Tobacco Products Control Act and its successor, the Tobacco Act, for plain packaging as far back as 1994. So the impetus for plain packaging around the world, including Canada, did not come from Australia's move in 2012, just to correct that piece of misinformation, and for world precedent-setting graphic health warnings on packages, to name just a few. It is this wealth of experience in effective regulation of an addictive and harmful product, one that is primarily smoked, that we bring to bear on your consideration of issues related to the appropriate regulation of cannabis, and in particular, the packaging and labeling of these products. First, let me say that we are pleased that the government recognized the importance of taking a public health approach to the regulation of cannabis. Such an approach prioritizes measures to maintain and improve health by minimizing the harms associated with use. However, where there is a profit motive in the selling of drugs, public health is at risk. Make no mistake. The tobacco industry has shown us what an uncontrolled industry is willing to do in pursuit of profit. Big tobacco is the disease vector whose activities and behaviors are responsible for the entirely preventable epidemic that we continue to battle today. Cannabis legalization needs to be protected from commercial interests, or Canada could face Big Tobacco 2.0, Big Cannabis. Indeed, there are indications from jurisdictions that have already legalized cannabis that this risk is very real. The federal government has the opportunity to learn from tobacco's grievous history and to get the legal framework for the cannabis industry right, or at least more right, from the outset. So what should a public health approach to cannabis regulation entail? We fully support the government's goals of preventing youth from accessing cannabis and protecting public health and safety by establishing strict product requirements. Note that expanding the cannabis industry and its market should not be a goal. Given the focus of this panel, I will devote most of my remarks to packaging issues, but before doing so, I'd like to highlight a few other areas where cannabis regulation would benefit from lessons learned in tobacco control. Keeping cannabis out of the hands of youth will require devoting adequate resources to enforcing the ban on underage sales and imposing penalties for non-compliance that are high enough to serve as deterrents. Safeguarding public health requires measures to protect the public from breathing secondhand cannabis smoke. This means including the smoking of cannabis in all federal and provincial smoke-free laws, as recommended by the Canadian Cancer Society and others to this committee. And finally, providing adequate public education is essential, not only about the risks of use, but also about the risks of breathing secondhand smoke and about relative risk. There is little public understanding of the fact that smoke is smoke, and that most of the risk comes from inhaling smoke, whether tobacco or cannabis, or of the fact that vaping poses much less risk to health than smoking. One of the reasons for Canada's success in reducing smoking rates is our multi-pronged, decades-long effort to denormalize tobacco products and tobacco use so that smoking is no longer a social norm. Tight restrictions on advertising and promotion have been integral to changing this social norm. The Task Force on Cannabis Legalization and Regulation rightly concluded in the discussion paper that, and I quote, marketing, advertising, and promotion of marijuana would only serve to normalize it in society and encourage and increase usage. In its final report, the task force recommended comprehensive restrictions on advertising and promotion and plain packaging for cannabis products. Our organization supports a comprehensive ban on cannabis promotion, with the exception of information advertising in stores off limits to minors. And because packaging is a key form of promotion, NSRA strongly supports requiring cannabis products to be sold only in plain packaging. The recommendation for plain packaging is based on a large body of robust research, including consumer product research, internal tobacco company documents, more than 100 studies from at least 10 countries, including 25 empirical studies conducted in Australia since plain and standardized packaging was implemented there 5 years ago, and the experience in jurisdictions that have already legalized cannabis. I'd like to show you just a few examples of cannabis packages available in jurisdictions where it is legal but where packaging is not strictly controlled. As you can see, a wide range of consumers are targeted, from youth, obviously in these examples, to perhaps young adults, to sophisticated adult consumers. It is no wonder that it has been said that a product is just a product. The packaging is the brand. When most other forms of promotion are prohibited, the package, not surprisingly, becomes the most important marketing vehicle. As early as the 1970s, tobacco companies foresaw the day when their ability to promote their products would rest solely on the pack. According to a 1979 document by British American Tobacco, and I and I quote, "Under conditions of total ban, pack designs have enormous importance. Therefore, the most effective symbols, designs, color schemes, graphics, and other brand identifiers should be carefully researched. An objective should be to enable packs by themselves to convey the total product message." There is substantial evidence from consumer product research that effective packaging increases sales. For example, when milk in school cafeterias was sold in plastic bottles instead of the traditional gable-topped cardboard cartons that we're all familiar with, sales increased by as much as 24%. Students said the milk tasted better and all of a sudden became cool and fun to drink. Shape and color are two design elements that exert a strong influence on brand image and the impact of packaging. Package coloring is one way tobacco companies target specific brands to specific subpopulations. This pack of Vogue Super Slims, featuring pastel colors on the outside as well as matching liners, is a prime example of a brand targeting young women. The brand name, Vogue Super Slims, clearly preys on the body image concerns of young women. Also noteworthy is the pack's diminutive size. Various studies demonstrate that consumers perceive that cigarettes in these tiny packs are less harmful than cigarettes in a standard pack. The pack size also enables tobacco companies to circumvent the intent of Canada's large graphic health warnings. As you can see, with a pack of this small size, compared to a standard slide and shell pack, the image has virtually no impact and the text is illegible. As their ability to exploit packaging elements to promote sales has been curtailed, tobacco companies have become more creative with brand and variant names, using names to connote aspirational lifestyles, reduced risk, or misleading product attributes. For example, the brands LD Club Night and Peter Stuyvesant New York Blend both conjure images of a hip urban lifestyle. We are concerned that without restrictions here in Canada, the same will happen with cannabis brands. A quick internet search revealed evocative names such as Suicide Girls, Pura Vida Health, and Everyone Does It. The large and growing body of research that plain and standardized tobacco packaging shows that plain packaging reduces the ability of the pack to create and communicate brand images, increases the effectiveness of health warnings, reduces package-based deception, and ultimately reduces tobacco use. Indeed, prevalence of smoking in Australia, despite what my colleague has said, is at an historic low, with an independent assessment concluding that the packaging reforms were responsible for 1/4 of the total decline in smoking rates during the first 3 years after plain packaging was implemented. Given the government's stated intention of taking a public health approach to regulating cannabis in order to reduce harms, a comprehensive ban on promotion is warranted, including strict controls over brand names and a requirement that cannabis products be sold in plain packaging with no promotional elements, health claims, or any kind of false or misleading statement. Only essential information should be permitted on cannabis packaging. To conclude, we support a public health framework for the legalization and regulation of cannabis sales in Canada. We believe that the measures we have proposed will go a long way to further safeguard the interests of public health. As Professor Hammond said, it is much easier to loosen restrictions on advertising, promotion, and packaging down the road if warranted, rather than try to rein in a burgeoning market and a powerful industry. Thank you. We look forward to your questions.
Thank you. Now we'll start with a round of questions, 7-minute questions, quite appropriately with Mr. Oliver.
Thank you. I don't know why that is, but thank you. Thank you very much. Mr. Hammond, just a quick question. Do convenience store associations or convenience stores receive direct funding from the tobacco industry?
Sorry, repeat the question?
Sorry, do convenience stores or your association, are you funded in any way directly by the tobacco industry?
Are we funded? We are funded through a membership, just like Coca-Cola would pay us a membership. Just
so
like
do you
Pepsi
receive direct funding from the tobacco industry?
Yes, but you're making it seem like they're the only ones that give us funding.
No, I just wanted to ask that.
Okay.
And right now, I think about 40% of convenience store sales are tobacco.
If you're excluding gas and you're excluding food service?
Yeah.
Yes.
Okay. So us using plain packaging to stop smoking would have a fairly significant impact on your convenience store businesses.
Stopping plain packaging?
If we were trying to reduce the use of cigarettes and smoking by using plain packaging, that would have
it would have no impact.
It would be a negative financial impact on
it. It would have no financial impact on our business.
You can lose 40% of your sales inside and not have an impact on your business?
I don't understand how you think that we would lose 40% of our business. You think that everybody would stop smoking tomorrow because we went to plain packaging?
I'll leave it at that. Okay. I wanted to come back to plain packaging, which is really where the heart of my questioning is. So there's quite a section in the Act, and our job at the end of the day will be to review the Act and respond to advice given to us by witnesses like yourself. So have you read Division 2, where it deals with promotion, branding, and point of sale Have you read that yet? So most of the sections deal with prohibiting communications advertising that in a manner that would be appealing to young persons by means of testimonial or endorsements, however displayed or communicated, by means of depiction of a person, character, or animal, whether real or fiction, and by presenting it or any of its brand elements in a manner that conveys a positive or negative emotion about or a way of life such as one that includes glamour, recreation, excitement, vitality, risk, or daring. So does that do the job for you, or because it still allows branding on some products, but it really deals with that, prohibits anything that's attractive or promotes this to young people? Is that good enough? Either one of you, sorry, either Dr. Hammond or Ms. Tilson or Ms. Beck.
I can speak to that if you'd like. Well, I can tell you that there were similar restrictions on tobacco marketing prior to Canada entertaining plain packaging. And the problem which I referenced in my comments were that it puts the onus on the government. And, none of us probably knows how many different products are going to be out in the market, but I imagine it's thousands. And what it becomes very difficult is the government is then responsible for policing whether a particular brand imagery or a particular logo actually is appealing to youth. And so it becomes requires a retroactive action on behalf of the government, and it's extremely difficult to do. And, all you need to do, if you haven't, Googled a lot of the packages.
I only have 7 minutes, so do you think we should go to more
yes.
prohibited language still, like no color, no brand?
That's what plain packaging does, and it will provide the protection that I think that wording seeks to achieve.
Okay, thank you.
Can I just add to that very briefly? So the current restrictions are woefully inadequate for tobacco, and as Dr. Hammond said, this is what...
We're going to be reviewing the Act, right? So
yes.
I don't need to know about the market for tobacco. It's the Act itself. Are you...
Well, the wording is the same as in the Tobacco Act currently. Okay. This is why it doesn't work, because Health Canada has shown itself loath to police. So we have a requirement in Canada of 75% graphic warnings, and this is the kind of package that the tobacco companies have come out with.
So Bill S5 then, which is dealing, I think, with tobacco products and plain packaging, it would prohibit use of coloring agent to design a trademark on tobacco product or display a mark. So you'd be looking more for that kind of plain, taking the color out, taking the branding out would be what you'd like to see added to what's already here? Is that fair?
Comprehensive wording to ensure that there are no logos, no branding elements, just a brand name.
No color, just, okay.
Brand name and required information.
Okay. Now, under required information, so I certainly heard the health warnings and completely support that. I mean, this is not we've heard during this week lots of testimony about the risks of marijuana, particularly for young people, but for everybody. But at the same time, I was just looking at the Colorado Pot Guide. So when people want to use pot, adults and people that are making a conscious decision to consume it once it's legal, there's a number, like they help you identify strains for energy, for sleep, for pain management, for anxiety, and the dosages of THC, CBD, CBN, CBG. I don't know what those things are, but I think they're important to the impact of what you're looking for, I guess, in a marijuana strain. Would you support that kind of information being available so a consumer would know what level of THC, CBD, CBN, CBG would be available in a product? Either Dr. Hammond or Ms. Tilson or Ms. Beck.
I mean, I think it's perfectly appropriate to label things like THC and some of the cannabinoids that can fall under constituent labeling. Look, there's a whole lot of information about use in different strains, and you don't need manufacturers or the government to provide that. Consumers will provide that on their own. There's periodicals and all sorts of things. But absolutely, I think it's reasonable to include things like THC amount. As I said, you need to do that in an effective way.
I'm just thinking if there's no brand identifier, then how do you know what you're getting in those different quantities? Sorry, Ms. Tilson and Ms. Beck, did you want to add to that?
So Yes, we think in addition to the brand name, the package should include the cannabis strain, the THC and CBD content, the amount of the product in the package, basic manufacturer's information, of course, the health warning, and other government-mandated information.
So really, it's what we're doing is taking the color out of the brand name is really the thing that we need to add to this legislation.
It goes far beyond color. So we're talking about fancy fonts, we're talking about package shape and size, opening style, all of these attributes that convey brand images. It's not just about color. So there's a very comprehensive list of restrictions in the government's consultation document on plain packaging, and I refer you to that. S5 does not have detailed language in it. That will come in the regulations.
That'll be in the regulations. Thank you. Thank you.
Mr. Weber.
Thank you, Mr. Chair. Ms. Tilson, the props that you showed, where are they coming from?
These are all packages available in Canada.
In Canada?
Yes.
And these are illicit, obviously illicit cannabis, or they're coming from those are cigarettes.
Sorry, these are all cigarettes that are available on the legal market.
Yeah.
I brought them as examples of how the industry is able to skirt what they claim to be very tight packaging restrictions, and as an argument in favor of plain and standardized packaging, because without that very rigid requirement, the industry continues to innovate and appeal to young people and mislead consumers about the risks of the product. And there's no reason to believe the cannabis industry wouldn't do the same.
Okay, I just see the one there. It looks like it looks like a cannabis leaf right on the front there. Is that tobacco?
No, these are images that we pulled off the internet. Sorry, are you talking about?
Yes, that one right there.
Yeah, these are images we pulled off the internet. These are products that are available in the United States in jurisdictions where they don't have strict packaging and labeling requirements.
Yes.
Yes.
Yeah.
But is that tobacco or cannabis?
This is cannabis. This is
okay,
tobacco.
that's
Sorry for
where
the
I was
confusion.
confused with that. Yes,
It's still legal in Canada.
yeah, exactly. Dr. Hammond, you said that the removal of branding does not promote illicit products. I guess my thoughts are, and Mike Hamoud, I'm getting confused here with Hamoud and Hammond, so I'm referring to Mike Hamoud. You feel that branding should be allowed because it is more difficult for the illicit community to counterfeit, to copy? Is that the main reason why you think branding should be allowed? I know that you say generic packaging is not an effective tool, and that branding should be allowed. It's because of what
well, if you make
reason?
something very easy to make, and I know we're comparing ourselves to jurisdictions across the world, but Canada is very unique because we have some of the highest contraband rates in the world when it comes to tobacco. And the experience that we have in the tobacco sales, like I've personally been in the selling tobacco for over 30 years in my convenience stores. My brothers and I and my parents have been in the business for about 40 years. I have experience with selling tobacco. I have experience with the changes that have happened in our industry over the last 40 years. Today, we have far less smokers than we did 10 years ago, smoking. And we've done that with working with governments and doing things. The display bans that came into effect that we had to do, again, very tedious for retailers, but didn't really make a difference on the sale of the tobacco. And I think it's very difficult for people to say anything different unless they work in the business. All that it did is cause a lot of harm and pain for retailers that had to try to find the stuff. So it becomes extra work. So when it comes to plain packaging, our interpretation is that government here wants to move people over from an illicit product to a legal product. So you want to be able to distinguish between what is legal and what is illegal.
Yes.
So if you want to make it look illegal, you might as well keep it illegal. What's the difference? You should be able to move a product and have quality assurances. There should be things in place to say, this is a legal product. This is why it's here. But we already have over 50 factories in this country right now producing tobacco.
Sure. Yeah.
Okay? And they're selling it illegally. You don't think for a moment that as soon as you come up with a standardized pack, think about that for a moment. You're going to come up with a standardized pack that could be made very easily by anyone.
Sure.
So What would stop them from duplicating that product? And if you follow the same route of what you're following on Bill S5, you're saying that everything inside the pack isn't going to have any labeling either. So how do you distinguish between inside the pack, what's legal, what's illegal, if the package is plain?
Okay.
It doesn't make any sense.
Ms. Beck.
Thank you. As we've said, packaging for cannabis, as we're advocating for tobacco, will be in plain and standardized packaging. But we're not saying it's going to be in a baggie like you find on the illegal market. It would have the features that we've talked about. It'll also importantly have the tax stamp, which has covert and overt sophisticated measures in place. Right. And this wouldn't be any different for cannabis. So consumers will be able to tell based on the fact that it has that tax stamp. And I also just wanted to point out that there have been studies done in Australia following plain and standardized packaging. Our colleague said that it was confusing and it really slowed things down for retailers, but there have been studies done on this, and they're smart people, and they were able to accommodate the changes very quickly. The experience in Australia has been very positive, and there's lots of good evidence to support those statements.
And just one last comment about the contraband market in Australia. All credible evidence is that there has been no increase in contraband. The only sources that say the contraband market there has increased are those funded by the tobacco industry, specifically reports by KPMG that come with a disclaimer that they are not to be used for any other purpose other than what the funder decreed, because the terms of reference were so narrow that they cannot be used to draw any broad inferences.
Great. You mentioned brand name. Are you when you say brand name, are you suggesting that the licensed producer's name be on that package? Or what do you mean by brand name? Is it the producer of the product, or is it the name that they've called this particular leaf? I don't know what you mean.
So, well, there's manufacturer, so Imperial Tobacco in the case of, a tobacco product, and the brand name here is Players. Right. So there would be the manufacturer's name of the cannabis.
Licensed producer.
Yes, a licensed producer, and then the brand name, but controlled, because we don't want to see a brand of marijuana called Everybody Does It.
Exactly. Yeah. Okay.
Say something. Dr. Hammond, do you want to make a comment?
If I could, the first thing I'd say about plain packaging is you can allow whatever product information you want. What you're doing is you're restricting the types of packaging elements that can cause problems. But look, I think it's very clear that this committee gets appropriate information on plain packaging. I've served as an expert witness in 5 different court cases on behalf of the Australian government and the UK government. Plain packaging has had a positive impact. The Australian government's own official evaluation has estimated that 100,000 fewer Australians smoke as a result of it. And with all respect to Mr. Hammoud, the arguments that he's making have been forwarded by tobacco companies in court cases, and they have been rejected. Tobacco companies have challenged plain packaging in 5 separate legal rulings, and they have lost. And each of those rulings has affirmed the positive public health impact of plain packaging. Secondly, there is no evidence that plain packaging has increased contraband sales. None. And that includes from the partner of KPMG who the tobacco companies hired to try and find evidence. They took the extraordinary step, KPMG did, of writing to the UK Minister of Health to state that the industry was misusing its numbers. So this committee will, of course, make the recommendations it sees fit, but it should be doing so on the proper evidence. And I'm afraid, with all due respect to Mr. Hammoud, those are false claims.
Okay, moving on to Mr. Davies.
Mr. Chair, thank you to the witnesses. Dr. Hammond, what does the research establish about the known health effects of cannabis? What do we know?
Well, you will probably be hearing from medical doctors and others that are better positioned to answer that question. What I can tell you is the scientific consensus, which is it causes less population level harm than tobacco and alcohol. and that should not be confused with the fact that it's harmless. So tobacco causes a range of harms to unborn children. Of course, there's impaired driving. There's a strong association with mental health among those that are susceptible to mental health and exacerbating some of those problems. And an estimate in terms of the consequences in Canada says that about half of the deaths come from impaired driving and about half come from respiratory issues related to smoking. And that's unique to the mode of administration. So, I mean, that's a quick snapshot. I don't pretend to be a medical doctor, but I think that's a fair summary of the most recent evidence.
The task force concurs with that. I think they said quite clearly that cannabis is not known to have as serious health consequences as tobacco or alcohol. Now, again, don't get me wrong. I'm not saying it's harmless, and I'm not saying that we shouldn't put appropriate warnings. I think that if we're going to take a science-based, evidence-based approach to what the proper warning should be on this product, it starts with an understanding of exactly what we do know about it. Is cannabis known to be a carcinogen?
My knowledge is that there are no carcinogens in the product itself. Like smoking, most of the carcinogens come from combustion, when you light something on fire and inhale it. And that's also true of tobacco products.
Is cannabis known to be as physically addictive as nicotine?
I think the general consensus would be not, which is, again, but the consensus would be that it does have addictive properties and abuse liability.
What I understand is that cannabis, the addictive qualities of cannabis are more akin to alcohol, where people can become dependent. They can get substance use disorder. They can become dependent on alcohol. They can become dependent on cannabis, both being mind-altering substances, as opposed to tobacco, which is known to be extremely physically addictive very quickly and very, very difficult to stop. Would that be a fair understanding of the relative addictive qualities of them?
I think that's fair to say. You know, there are a few things that compare with nicotine in terms of an addictive substance, and of course it depends on how you use it. Lots of people use nicotine gum, and it has a very low abuse liability. When you smoke something, the mode of administration means it gets into your bloodstream, into your brain quicker. So I think in general, I concur with what you're saying.
I mean, the only people I know using nicotine gum are people trying to quit. I don't know too many people who start picking up nicotine gum and chew it, right? Yeah.
That's absolutely correct.
I'm just going to come to you, Ms. Beck, on this. Can I ask you a question? Because I was just going to turn to you. C-45, ironically, will legalize dried flower, which is mainly ingested by smoking, and will leave illegal, for the moment anyway, edibles and other non-smokable products. Do you have a comment on that from a health point of view?
Well, it is my understanding that in Schedule 4, I think there are 4 or 5 items that will become immediately legal, including oil, which can be vaped. But you're right, the edibles will come later. Mm-hmm. And there's relative risks, as Dr. Hammond mentioned, in terms of how things are taken. And those will need to be communicated clearly to Canadians, because I think we have a big problem in that not a lot of people appreciate that smoke is smoke. There's perceptions that because cannabis is natural or it's organic, it's somehow less harmful and from breathing in the smoke, and that's not the case. I also just wanted to speak to your earlier comment about comparing the two. Tobacco has a very powerful industry behind it, and as Melody said at the top, it's the disease vector in this issue. And cannabis we're just starting, and if we let them out of the gate the way that the tobacco industry is operated, patterns of use can change with the branding and the promoting and the advertising and all of that. So we need to be really careful. Pardon me, one other point is the co-use between tobacco, and cannabis. What are the statistics here? It's 1/3 of cannabis users in Ontario actually mix tobacco with their cannabis, but they don't identify themselves as smokers. And as you rightfully pointed out, nicotine is very addictive, and so we're very concerned about this co-use, mixing together, because tobacco burns better than cannabis, so it's quite common to do that.
I just want to, I'm not sure about the answer on this, but I'm not sure it's correct that the oil will be allowed to be vaped under this bill, because I think there's other sections of the bill that prohibit the solvents that are often used. So I'm not going to say that affirmatively, but I don't want to leave that comment
Okay.
sort of out there. But well, something we should look into.
Yeah, definitely.
So the other thing I was going to say about the challenges of proper labeling is it could be that cannabis should be labeled like tobacco. It should be that it should be labeled but like alcohol. It could be that it requires its own sort of special, unique kind of approaches. But I keep thinking of walking into a liquor store where there are tight regulations on the products. You know, they're certainly not marketed towards children, but there are colors allowed. There are descriptions on the back of wine bottles that sort of describe the general properties of the wine. Is that an inappropriate approach to take towards cannabis, given that it's not carcinogenic, probably, given that it's not as addictive as nicotine, given its properties that are quite similar to alcohol? Do you see problems with that? Anybody who'd like to answer?
I mean, I think we need to be a little careful about using the tobacco and alcohol markets, because if we just started regulating those markets based on public health, they would not look like they do now. Tobacco products would not be sold. And so where we're at with those markets is partly due to historical quirks and things like that. I mean, I approach this in looking at the government's objectives. And if the government's objectives are to minimize and discourage use of these products among youth, I find it very hard to identify any public health benefit to allowing this sort of branding. And when I was talking about the health risks, I omitted an important point, and that is that whatever the risk is, the risk of problematic use, of disease and long-term health effects is worse when you start younger. Addiction and everything else. And so, you know, I don't want to get into carcinogen or not, because there are harmful effects from cannabis. I think it is important to compare them with other products, but where we're at in the tobacco and alcohol market is not necessarily how it would be aligned with public health if we were to start.
Dr. I'm just going to ask you quickly, if I can. Okay, that's only one of the purposes of the bill. One of the other purposes is to deter illicit activities and provide for the licit production of cannabis. So we're not operating in a vacuum here. If we're going to move people from the illicit market to the licit market, we have to recognize that branding and products will be available by the illicit market. And is that not a consideration in terms of making sure that we have appropriate labeling and packaging to draw people into the licit world?
I think the most important factors to drawing people into the licit market are availability and price and the different types of products on offer. Anyone who uses cannabis already should not be induced to use more through branding. Branding has more impact on youth and initiation than it does on established smokers. So I couldn't agree more about the desire to reduce illicit tobacco, but that's why I said, look, we have 20 years, 30 years of experience in tobacco and restricting branding. There is no association. So I think it's some of those other measures that you will have heard from experts about that are most important. Branding serves to induce use among young people primarily. I don't think it's going to stop a consumer who already uses marijuana and wants to buy it through a legal retail outlet.
Okay, thanks very much. And now we go to...
Ms. Beck and Ms. Tilson, you were talking about some of this. This is something I followed for a while, the plain packaging. I mean, again, I know this is about cannabis, but we have a precedent already, which is why I'm talking about tobacco and plain packaging, because we want to know how this will affect, what effect this might have on the upcoming legislation. I was glad to hear you and yourself, Dr. Hammond, as well, corroborating the effect of the plain packaging laws in Australia. I've heard much of the same information. I've also read much of the misinformation about it and how heavily promoted that this misinformation is. Now, are you familiar with groups, I believe it's the Canadian Alliance Against Contraband Tobacco? Yes. National Coalition Against it, yes. Are you, have you heard the allegations that much of their activity is lobbying, in fact, for the tobacco industry? Would you agree that their activities have been that?
Absolutely. In fact, we brought with us today a presentation from Imperial Tobacco to its parent company, British American Tobacco, talking about the contraband market in Canada and the campaign that they've waged for many years. Ostensibly to get contraband under control, but as the presentation reveals, it was really, it's been an ongoing public relations exercise to convince lawmakers and the public that contraband is out of control. And why I bring this up in answer to your question is because the presentation makes clear that their partners, Imperial Tobacco's partners in this campaign to deceive lawmakers, are the convenience stores associations, the Canadian and their Western Atlantic and Ontario counterparts, as well as the National Coalition Against Contraband Tobacco. The tobacco companies in Canada and around the world repeatedly raise the bugaboo of contraband in response to any discussion of a tobacco control intervention. They claimed that when we were talking about display bans, in fact, the then head of the Canadian Convenience Stores Association in around 2010, 2011, was going around the world, Australia, New Zealand, the UK, saying that the display bans had caused the contraband problem in Canada, which of course they had nothing to do with. We have display bans across the country. We have a contraband problem in Ontario and Quebec where there's illegal manufacturing on reserves that is not being adequately enforced or addressed by enforcement.
Okay, thank you. Dr. Hammond, you look like you were nodding in agreement on this, or did you have anything else to add, or just agreement?
Well, look, I mean, I testify in court cases. I'm no stranger to the tobacco companies and their activities, but I must admit, this past week I have been alarmed by the extent to which the tobacco companies have been infiltrating this discussion. And I'll just leave it at that.
Albert, thank you.
I want to make it very clear.
I actually have a question for you, sir.
Okay, good.
And then you make your comment after I ask this question.
I'm not here because of them, so just so we're clear.
No, I want to make sure. No, but I have yes, but I have a question for you, and then you can make this comment, sir.
It's crazy.
Okay, this is a story from the Globe and Mail, dated April 2017. It says, and I'm quoting, the CCSA has financial ties to tobacco companies and has faced recent criticism for working with at least one major tobacco company to promote industry interests. It then goes on to say, last fall, Imperial Tobacco documents made public by non-smoking advocacy groups indicate the company worked with CCSA on cross-country campaigns to promote the industry's interests, including lower tobacco taxes and focusing attention on the problem of contraband tobacco. CCSA members include Imperial Tobacco, JTA McDonald Corporation, Rothmans, and Benson Hedges. So my question for you, for the record, does the CCSA lobby for the interests of the tobacco industry? Yes or no?
I would say that we lobby for the interests of convenience store retailers.
Okay, so you deny that you lobby for tobacco companies?
We lobby for every one of our members, and I don't appreciate that we're being tailored to one product and one product only. So let's just be clear on something.
No, I'm not saying that you don't do any others. I'm saying on regards to this industry. Do you lobby for this industry among your activities?
But we don't lobby for them. We lobby for ourselves because you have to understand our business. I don't think people have any understanding of what a convenience store is in this country or what we do or any of that. So
no, I'm not talking about what convenience stores do.
You are, because you're saying that the only reason that I'm here today having a conversation about plain packaging is because I want to do it for the benefit of big tobacco. You need to understand something. They have nothing to gain from marijuana or from cannabis or any of that. They're not even in that business anywhere in the world. They have nothing to gain from this. We have nothing to gain from marijuana because we're under the perception that it's probably going to be sold by government agencies across the country.
No, I understand
all that I want to say is give you,
okay.
Just let me finish. All I want to say is I want to give you input on the experience that we have. Me personally have worked in a convenience store for over 30 years, selling tobacco, the experiences that I've had, the big power walls that they used to call with all the colors behind us and all of that and people walking in. Listen, I'll tell you, I have never had an individual that was a non-smoker walk into any of my stores and see a pretty orange package and say, "Oh my God, I think I'm going to start smoking"?
I'm going to have to cut you off.
So,
I'm going to have to cut you off because I'm running out of time. I have just one more point to make, and the reason I bring this in is exactly what Dr. Hammond said, and why this has to be brought up is how much the tobacco companies have infiltrated through themselves and through their lobby groups this discussion on Bill C-45.
I think it's entirely up to this government to make that decision and where they're going to go. I just think, based on the experience that we have of selling another combustible product, which we have worked with many government agencies over the years on how we can do a better job at that, at keeping it out of the hands of youth. You walk into a convenience store today, do you see any tobacco? No. You can't see it. It's not visible to anybody that walks into a store. When you walk into a liquor store, do you see liquor? Yes, it's very visible, okay? So I think we've taken huge strides over the years to keep it out of the way of youth and to keep it out of the hands of youth. I will just say, though, that is because that was legislated, and I have no further questions. Thank you.
Okay, that completes our first round of questions, and now we go to our 5-minute round with Ms. Gladue.
Thank you, Chair, and thank you to our witnesses. I want to talk a bit more about branding. I know we've talked about it already. We actually, originally there was a desire to distinguish the licit production from the illicit, but the more I listen to the testimony, the more I think about it, and the more I think about all the hoops we've jumped through trying to keep our money from being counterfeited, I can sort of see that that's not going to work. This branding thing may not work. So it looks to me then that we might have to take more of an approach like what Washington did, where they had very strict control when they combined their medical and their recreational marijuana. They had their suppliers and distributors and who was allowed to sell it, and it was all tracked so they could make sure there wasn't more product coming in and kids weren't allowed into the stores, and so it was a non-issue. Do you agree that that is probably the best approach? Start with you, Doctor. Oh, sorry, it's Mr. Hammond.
Yes, and it's what you've said has happened in other jurisdictions for cannabis. It's the sort of system that we've gotten better at with tobacco internationally, and that is the way to reduce illicit tobacco. And, you know, for the record, it is not difficult to counterfeit any packaging you might wish. I do studies where we go down the street and for $50 we can have someone design a package. So I think you're starting to hit the nail on the head in terms of those are the measures that you use to reduce illicit tobacco.
Yes, and it's my understanding the legislation does provide for a tracking and tracing mechanism. The illicit trade protocol for tobacco is also requiring, and it's currently being established, a global tracking and tracing mechanism, as Dr. Hammond referred to. Pippa Beck referred earlier to the tax stamp that's on tobacco packages now. This has overt markings, so ones you can see, and covert that aren't visible but that are much harder to counterfeit. It's that type of thing, as well as aggressive enforcement. We haven't had aggressive enforcement with cannabis in the last number of years as we started discussing legalization or decriminalization, and we certainly haven't had adequate enforcement when it comes to contraband tobacco, largely because of the
tobacco. Mr. Hamoud, what do you think?
I agree as well too. Anything that you can do to help stop it from going to the illicit, I think, is what everybody agrees with. That's the point.
All right, warnings. So, you know, we've seen and heard testimony about how bad the effects are for youth that consume this, especially under the age of 25, pregnant women. There's been a number of things. It looks to me that you could almost write a novel of warnings if you tried to put that on the packaging. So do you have any advice about what would be the best way to communicate warnings? And we'll start again in the same order with Mr. Hammond.
Sure, and this is something I've worked with our government and governments around the world to assist with. Right now, for other products, we have rotating warnings. So it's up to a government to determine what are the key messages and risks they'd like to communicate. You can have a number of different warnings that rotate through the packages, and you can change them over time. So we've done it now in Canada a couple of times. We're about to do it again. And it's very effective. And the lessons are not rocket science. I've wasted more of my career demonstrating these things, but they have to be big enough that people see them. They should use images. I have a bunch of children, and when I leave cigarette packages around, they look at them and they can't read, but they know what it communicates. And I would suggest that we do not take our lead from U.S. states. You just have to look at the tobacco warnings that have been in there from 1984, and their marijuana warnings look like a legal disclaimer. That is not the way to design a warning. We have very good experience with it. So it's up to the government, but let's use effective principles for communicating with people, whatever those messages might be.
Okay. And what about names? I heard the testimony about how we don't want to have, like, everybody uses it or everybody does it or whatever. Is a solution to that to not even allow the naming, but to go with numbering of products? Interested in what you have to say, Ms. Tilson.
I certainly wouldn't object to that. I think consumers would object. And given that the government is trying to balance the rights of adults to choose the product versus keeping youth away from it, a compromise, I think, would be to allow a limited range of brand names.
One other interesting thing, we have producers of medical marijuana. And they do supply here in Canada, but many of them are shipping globally. And so they want to brand their products, and they want to ship them globally, and they want to advertise them, you know, with e-commerce. How do we incorporate that into the whole equation? Mr. Hammond.
Well, I mean, I'm sorry for mentioning the word tobacco again, but, you know, there's nothing stopping. I mean, when you sell a product in another country, you follow that country's laws. And I think that there's some wording in the Act where you're not allowed to advertise through foreign media for Canadian products that would be coming in. So I think that's a reasonable principle. And I just want to be super clear about plain packaging. You can allow product information. It doesn't mean you have to strip everything. What it means is that you're just taking away that tool of colors and images and logos and things like that. So I think it's quite it's not inconsistent with saying that manufacturers can provide product information to consumers. The government can choose what goes in that product information. And I think that the companies, whether it's medicinal or recreational, need to respect the laws of the country where it's being sold, whether it's manufactured here and exported to other countries or imported from other countries.
Time. Thanks.
Mr. McKinnon.
Thank you, Chair. My question, I'll start with Professor Hammond. Standard packaging, what does this mean in terms of product offerings? So if you have, I mean, you can't just have ad hoc packaging every time you have a new product. Someone has to design the product or design the package for the product. Who would do that? And in the case of, let's say you have a new kind of product that fits within the schedule of what you can sell, how would you arrange to get packaging that was appropriate to that product?
Well, that's a good point. So I use the term standardized because that's essentially what you're doing. And so we talked about standardizing the look in terms of, you know, similar background colors and no logos. Certain countries regulate the shape and size. We do have a diversity of tobacco products that come in different shapes and sizes. And so clearly you would need to have different criteria or standards for whether it's a dried herb or flower or an edible or something else. And so, you know, that would be at the government's prerogative in terms of to what extent they would like to standardize the shape and size. It's quite possible to standardize by removing logos and imagery without and having more flexible guidelines on standardized shape. You just want to avoid things like edibles being shaped in a gummy bear. So, you know, the government can prescribe their standards, and then the companies, you know, design their product containers and shapes to fit within those.
Thank you. Would non-smokers' rights like this?
Yeah, just to add one quick comment that we would not be averse to having looser restrictions on the non-smoked versions of cannabis. As you've heard a number of times today, the smoked form is the most harmful to health and poses the most risk. So the vaped forms and edibles could have looser restrictions on packaging.
So a standardized packaging for some variants of the product, but not necessarily standard packaging for all.
Absolutely.
I see.
Yes.
Mr. Hamoud.
I don't think any of us are really experts when it comes to retailing cannabis in this country right now, or how it's going to all go down. I think one of the things that need to be taken into account too is what is a package going to look like for cannabis, and let's be honest, how big is the pack going to be for cannabis? I'm assuming it's not going to have 25 joints. I'm assuming it's not going to be similar to tobacco in that way, that it's probably either going to be an oil, or it's probably going to be some sort of a dried tobacco in a pouch, or something that's relatively small that they would call a dime on the road, or whatever it would be. But these are other things that need to come into consideration when you're talking about warning labels, names of the product, explaining what the product is, and trying to get it all to fit on what it is that you're trying to sell as the product.
Mr. Hammoud, you stated earlier that plain packaging is a race to the bottom in price. But we've heard a lot of testimony that says that a lower price basically drives the black market out of business. And that's one of our goals. So it seems to me in that respect that counters your argument against...
But you failed miserably on the tobacco side, because if you look at where the cost of tobacco is today compared to what the cost of illicit tobacco is, you got one way up here and you've got one way down there. And to go back on a question asked before, the people that have the most to lose by losing tobacco sales is the federal and provincial governments, who make the most money off the sale of tobacco, not us. Just want to clarify that.
So are you saying it won't decrease the price, race to the bottom?
If the federal government does what they intend to do, and their goal is to move people over from an illicit product to a legal product when it comes to cannabis, and if they really stick to their guns and do what they do and sell it for around the same price of what people can buy it on the illicit market, it'll probably work. But what you need to understand is that you have provincial governments who are starving, who are in need of revenue, who are probably going to do the same thing with cannabis that they've done with tobacco, to find a way to generate revenue for their provinces, and they're probably going to slowly tax it to the point...
But these are considerations beyond packaging, right?
Well, I understand, but I mean, you're talking about packaging, and you're talking about moving someone over to a legal product, and you just said to the lowest price.
Well, I'm talking to your assertion that the plain packaging would start a race to the bottom on price.
Yes.
Which would encourage black market, which, according to our other testimony, you start lowering the price enough that it prices the black market out of business.
Oh, if you start lowering the price. My perception of that is if it's not the government that's lowering the price.
I'm not talking about who's lowering the price, but if the price gets lower, it'll price the black market out of business. Is what
if the legal product gets lower.
Yes.
Is that what we're saying? Yeah. Yeah. Got it.
Ms. Glatter.
Thank you, Chair. All right. So one thing I'm disappointed about is that we're only talking about packaging and labeling, because promotion was another whole part of this equation. And so I'm going to risk putting you out of your comfort zone on packaging and talk a little bit about the restrictions. They've got restrictions on the entertainment industry that have sort of exempted them from what we're trying to do with everything else, which is to make sure that we're not appealing to children and we're not glorifying smoking cannabis or using cannabis. Do we, I know there's always that argument about censorship versus what we allow, but do you have any opinions about the promotion within the entertainment industry, starting with Ms. Beck?
Thank you. Well, I can't speak too intelligently about that industry, but I do know that in the Act there are allowances for promotion, specifically in shops that would be off limits to minors by law. So there could be information and promotions at the point of sale for adult consumers about the products. So there is greater leniency in that respect.
All right.
And I agree with that too. When it comes to promotion of the product, it should not be. It should be very similar to the way they promote tobacco. So if it's anything outside, that shouldn't be promoted.
All right, Mr. Hammond.
I think one of the reasons why I haven't spoken to some of the broad areas of promotion is because I think it's generally fairly well constructed. And as I read it, the Act would restrict any types of sponsorship. So in other words, a cannabis company can't pay to have their product in a movie or have someone use it or sponsor a sporting or dramatic event. As I read the exemptions, it's just saying that I, as the scientist, can represent cannabis products in certain ways, that it could be in a movie, but it's not allowed to be paid for as a form of sponsorship. If that reading is correct, then I think that that's an appropriate balance.
Okay, excellent. There was another good question that was raised about what size the packaging should be, which I think is really good, because especially when I saw the little promotions, the little slender ones, all that kind of thing, it does make a difference. We know that the adult possession has been set at 30 grams. I don't know how much room that takes up, but do you have any opinions on the size of the packaging that should be allowed? Start with Mr. Hammond.
I mean, we're quite right that cigarettes are very uniform in terms of how they're sold. But if we broaden the market a little bit to include smokeless tobacco and other nicotine products, we do see the sort of variability that you might see in the cannabis market. So with respect to the 30-gram amount, I mean, I think obviously manufacturers will shape and size their packages accordingly. And I think the question is you're just trying to avoid any structural size-related messaging that would contravene what's in the Act. And so one of the reasons for those standardized packages with cigarettes is because we have what are called super slim and slim cigarettes, which promote the belief that smoking helps you stay thin, which is a very potent predictor of youth smoking. So I think that was it was to get rid of all these novelty packaging where, they really don't look like a cigarette pack, they look like something else. So I think there will be more variability in the cannabis market. I think there's room for that variability without it being a problem.
Other opinion?
We've worked for a number of years to control the size of tobacco packaging. Starting in the early 1990s, we had kiddie packs banned. They were packs of 5 cigarettes, largely because they were affordable to youth, not because of the size per se. So I think that may be a consideration in the future. I think how large the package ends up being on the market will largely be determined by how much it costs, and if it's too expensive, consumers won't buy it. But packages of individual joints, for example, may be affordable and attractive to youth, so I think that needs to be monitored over time, and there should be some regulatory flexibility to further restrict packaging sizes if it becomes necessary.
Yeah, I mean, going back to your 30 gram and the recommendation, I mean, after being a part of many meetings with medical doctors and everyone, getting a sense of what I didn't realize that 30 grams could be like 60 joints or as high as 90 joints, depending on how you cut it, they say, or do whatever you need to do to kind of make it work.
$300.
That's a lot of money. Like that to me seems like a very large sum to have somebody in possession with, and you're allowed to share it, which kind of amazes me as well too. So you could have 4 people each with 30 grams and they could be sharing it with 4 other people and so on and so on. And it doesn't make any sense to me from that perspective. And I think that needs to change, really, because that's a lot.
I'm out of time, I think.
Yeah, sorry. So, yeah, from the question of package designs and different things, I think it has to be a little different because there's so many different varieties of what you're going to be able to put together. And I do agree with them. 1 joint or 2 joints maybe isn't the way to go, but it's all going to come down to pricing as well, too, on whether they can move them over.
Okay, thanks very much. Now we go to Mr. Ayoub, possibly in French.
Possibly, for sure.
Possibly for sure in French.
I'm going to ask the question in French, so if you... Je vais démarrer mon petit chronomètre.
I'll start my watch clock. This is a very interesting discussion. There's one thing that I perhaps didn't hear, and I tried to be attentive throughout. We're talking about a non-uniform distribution of products. There's private cannabis products distributed by we don't know who yet. Is that what am I understanding that correctly? We're talking about distribution of private products with different packaging depending on the mark, depending on the producer. And I'm making an assumption here. Producing and distributing with one sole distributor, well, it's not the government who's going to be the distributor. There'll be special permissions and uniformity. We talked about examples, the example of milk, but if the same milk carton is used, the same cigarette pack, the same marijuana pack, will we forget about colors, forget about brand names, just the name and the THC that's indicated, potential health problems to ensure that people are up to date, and then the rest, well, there's no marketing, there's no promotion, there's nothing like that. And even currently, dispensaries or head shops, or rather marijuana medical dispensaries, do no ads or publicity. So are we looking for solutions that, when we should just ask the government to take care of this and eliminate fully the whole promotional side? Dr. Hammond, could you answer that perhaps?
If I understood it correctly, I think that's, as I read the Act, that is the objective, which is to eliminate any promotion that's going to encourage use or make it appealing to young people, but to recognize that manufacturers and consumers, there is still product information that will be helpful to guide their choice. And so, as I said in my opening remarks, the question is, well, how do you execute that in a framework? And I think what I and others are suggesting here is that most of the restrictions in the Act, I think, are perfectly well-founded and consistent with that. On the specific issue of using branding elements on packages, that is very difficult to police. I don't see any public health benefit, and it's the area that's most likely to promote use among kids. And so I think what you described is pretty much what's in the Act, with the exception of sort of understanding what the regulations might look like for packaging. And I apologize if I haven't answered your question properly.
Ms. Tilson.
Je ne suis pas tout à sûr si j'ai.
I'm not certain whether I properly understood your question, but
Understand the question, because I've got the question is important for me, at least. Now I'm in English, I know, but I'm going to switch in French very fast because I've got time. C'est l'élimination.
The elimination and control by the government.
You don't have any promotion. There's nothing left. No. There's only one cartoon, one advertisement from the government, and regulated by the government. So it's regularized, it's standard. There's no difference.
Ce n'est pas ce qu'on envisage.
That's not what we'd been imagining. There will always be producers and retailers. The government will dictate the rules for packaging and information on packages, and packs will be standardized in all provinces and territories. But there will always be many different producers, and based on the province, there would be different sales systems. I'm perhaps simplifying. When we have apples, I'm giving an analogy with apples. You know, Granny Smith apples, they're a Macintosh. There's no other labeling on them. They're products and they're brands. They were produced on Vancouver Island or in Quebec, but it's distributed by the government. So other than the name and the label, you don't need to do promotion of them. There doesn't need to be different packaging and identify the producers other than where it was made and what it contains. Perhaps I'm expressing myself poorly, but I feel like if the government takes charge of this, we eliminate that whole promotional side of things and packaging as well, that whole issue. It seems like we would eliminate all these necessary solutions and regulation. I think it's possible, but the federal government perhaps doesn't want to be in the business of selling marijuana. Well, this is a question that I'm asking you.
Very much. Now we go to Mr. Davies for the final question.
Thanks, Dr. Hammond. Again, I want to state from the beginning, I think there's broad agreement on everybody in this committee that we don't want any marketing towards children. We want safe, proper labeling. We want accurate, evidence-based warnings. We understand that it's a product with known health consequences. We want to make sure that we don't encourage use. So given that context, though, is there a danger in reaching overboard the other way? And what I'm thinking of is the old, this is your brain on drugs commercials with fried eggs in a frying pan, or the reefer madness approach. That if we go, is there a risk that if you go overboard and try to communicate information that the broad public doesn't believe, does that lack of credibility, do we risk a lack of credibility operating, because we're not operating in a vacuum here, right? There is an illicit market. If you go online, you can find Kit Kat Kush. Okay, you can see products online that you can order with Yosemite Sam and cannabis coming out of the guns, and those aren't going to stop. So, I guess what I'm saying is, we want to be very cautious and conservative on labeling, but is there a concern that if we don't get that balance right, that we will not be effective in pulling people away from the illicit market and risk a lack of credibility?
Look, that's a great question, and I don't envy any provincial or federal regulator in this issue, because you have people from both sides saying you need to loosen, you need to tighten. I think I can tell you this. We've done work with young people looking at health warnings for cannabis, and it's a surprise to most people to know that even smokers who are very marginalized in our society support the picture warnings. And I can tell you that most Canadians, especially young Canadians, are curious. They would like to know what the information is about the health warnings. Now, I always say that where a health warning goes overboard is where it is no longer credible, where it's not providing truthful, forthright information. And so I think that speaks to the importance of designing these properly. But on the issue of will consumers turn away from the illicit market because there are information about the health risks? I don't believe that to be the case. I think the difference between illegal and legal sales is going to be on price and availability and accessibility. I think a lot of the things that we're talking about today are in terms of information and promotion, which I think have less of an issue with respect to legal and illegal, if that helps. But, it's about finding a balance. But I think most scientists and people, and I think consumers, would say that balance includes providing reasonable health warnings for these products, especially, we haven't talked a lot about concentrated extracts, but most of what we know about cannabis in our scientific literature is about smoking and eating. But we have a brand new category of products, of highly potent concentrated products that are being consumed in different ways. So, that is something that the government should be communicating about as part of this process, and warnings is one possible way of doing that.
I'm just going to ask this because I'm curious. As a matter of logic, we've already heard that alcohol is more dangerous than cannabis. Why don't we take away colors, images, and branding from alcohol in this country? And for those that, there's been a suggestion kind of that, we can't do that, the cat's out of the bag. But we've done it for tobacco. Shouldn't we be doing this for alcohol? And if not, why not? From a public health point of view, why are we letting this one product continue to be branded with colors and imagery and things that are prohibited by the cannabis legislation if it's a more dangerous product and we know we can do it?
I think it's a reasonable question. Why don't we have nutrition labels on alcohol products? We have them on bottled water. We have them on every other beverage that's sold in this country except alcohol. There are other countries that have sought to prohibit marketing of what they call alky pops, coolers that are very much oriented at young women. I don't propose to give the government guidance on those issues because I'm not an expert. But if you're pointing out that there are differences that don't seem logical in terms of how different product domains are regulated, I would agree with you.
Okay. Thank you. Those are my questions.
Okay, that winds it up. And I'm just listening to all this packaging discussion and colors and logos and everything. And in the last break, I called a young, successful businessman in Nova Scotia. And I said, I know he participates once in a while with a little marijuana. And I said, where do you have to go to get marijuana? He says, I don't go anywhere. I said, what do you mean? He says, I just make a call. It's delivered to my door 7 days a week, 24 hours a day. And he doesn't care about the package much or what color it is or anything else. So, I mean, that's what we're up against. I had to laugh. I was so surprised. But anyway, that's what we're dealing with. But look, on behalf of the committee, I want to thank all the panelists, all of you, for your contribution and the knowledge you brought, your own experiences, and it's been really, really helpful to us. This is the first discussion we've had on packaging and labeling, and it's been very helpful. So on behalf of the committee, thank you very, very much. We appreciate your time, and especially on the video conference. We know it's a hard way to participate in a conference, but you've done a great job. So thanks very much. And with that, I suspend our meeting until 6 o'clock. Thank you. Move to the table. Thank you. Thank you. Thank you. We have video from Brazil and the United Kingdom and all kinds of stuff, so we just want to be... well, what did they call it? Everybody does it or something? Everybody. Well, I guess that was the marijuana.
Wrong study.
What was in that piece there? To order again. This is meeting number 67, continued on in our fifth panel for the day. Tonight's panel is going to focus on international considerations. I think it's going to be really interesting. I'm sure we're all going to learn. We have 3 video conference. Oh, we have them all. We didn't think we were going to have them all, but we do. So I'm going to introduce our video participants first. From the RAND Drug Policy Research Center in Brazil, Dr. Bo Kilmer, co-director. And from the United Kingdom, we have Transform Drug Policy Foundation representative Stephen Rolls. And from the Tosau Law Corporation, Kirk Tosau, I'm sure I'm not saying that name probably quite right, but you can tell us later, by video conference. And here present with us, we have Dr. Stephen Hoffman, Professor of Faculty of Health, Osgoode Hall Law School, York University. Now, we're going to open with each one makes a 10-minute statement, and then we go to questions by the members. So I'll invite Dr. Hoffman to go first with a 10-minute statement.
Great. First, thank you very much to the committee, to the chair, for this kind invitation to allow me to present. It's really quite an honor to be here. I'm here really as a private individual who's here with expertise in international law. So by way of background, I'm a full professor at York University in the Faculty of Health and Osgoode Hall Law School. And as far as I can tell, I'm the only public international legal scholar in Canada who focuses on health issues. So I'm really pleased to be here to be able to convey that aspect, which I understand is an aspect of this issue that hasn't yet come before this committee. So thank you very much. And my testimony here today is informed not only based on my own research, but also based on my previous experience having worked in the international system for the World Health Organization, as well as in the UN Secretary General's office. I've also published on this issue, and in fact, one of my shorter articles I circulated to this committee for translation and for you to read, and I'll refer to it later in my testimony. My interest in being here is really about that I'm hoping that when legalizing cannabis that we don't break international law in the process. And so my hope is that in trying to achieve a particular objective, that international law and multilateralism doesn't become collateral damage in this process. And so I think it's very clear, I'll say right up front, that the proposed legislation as it stands would violate the 3 UN drug control treaties and Canada's international legal obligations under them. But the good news is that we have options. And I'll sketch out those options. Some of them aren't great, a couple are more feasible. But ultimately, my hope is that that this committee and that Parliament insists that the government has a plan to address these international legal obligations before legislation is passed into Canadian law. So let me walk you through these treaties that I mentioned, the 3 UN drug control treaties that overall govern the way that the world manages narcotic drugs. And so I'll refer you to the material that I circulated. The last sheet was an appendix which lists some of the key treaty provisions which are implicated. But overall, I'll say there's 3 treaties. The first is a 1961 Single Convention on Narcotic Drugs. The second is a 1971 Convention on Psychotropic Substances. And the third is a 1988 Convention Against Illicit Traffic in Narcotic Drugs and Psychotropic Substances. And let me just emphasize that the treaty obligations in these laws are very clear. And among international lawyers, there's really no controversy around this particular situation that we find ourselves in. And so I can very happy to delve into the legalities during the question and answer period, but for now I just wanted to highlight a couple of key sections. The first is in Article 4C of the Single Convention, which you'll see at the top of the appendix that I circulated, which limits drugs use, quote, exclusively to medical and scientific purposes. And then later in the appendix, you'll see Article 36, subsection 1A, which requires state punishment for their possession, production, sale, and delivery. You'll see towards the bottom of the appendix that I circulated that Article 3.2 of the Trafficking Convention specifically criminalizes drugs possession, even if just for personal consumption, except that at the beginning of that provision, there's a pretty big loophole in that countries are allowed to not beholden to that if it violates their basic law. So it's a big loophole, the size that even a country the size of Canada can just drive right through it. So I think overall, looking at the treaties, there's no real controversy that they overall require countries to have state punishment, but not necessarily criminalization of a substance like cannabis. Now, of course, when looking at the treaties, there's always flexibilities in how they're implemented. So for one example, in the treaties, it doesn't actually specify what kind of state punishment is required. And so Portugal would be one example of a country that still prohibits drugs, but whereby people are not sent to jail and not face criminal penalties, but instead might have mandatory treatment, access to education, or a fine. Another flexibility in the treaties is that they don't specify that the provisions have to be enforced. So a country like the Netherlands still has a criminal prohibition against the possession, use, manufacture of drugs, except it's just widely stated that police won't be enforcing those provisions. And that's okay under the international law. A third flexibility is a constitutional override, which is whereby if a country's constitution specifically allows something that the treaty doesn't allow, the constitutional provision overrides the treaty. And so, for example, Bolivia took advantage of this in 2009 when they added a constitutional right for its citizens to possess and consume coca leaf, which had cultural significance, as a way to then take advantage of that flexibility. But flexibilities have limitations. And so one thing that's clear is if you look at the case of Uruguay, we see that as a country that is actually breaking international law at the moment. The country has claimed that it sees the human rights norms, and they're arguing the general human rights norms, they're arguing trump the specific requirements of the UN drug control treaties. And that's maybe a great political statement, but that's just not how international law works. Similarly, if we look to the U.S. example, the U.S. would also currently be violating international law, but it's harder to fault the U.S. given that in the U.S., the federal government has the legal ability to sign on to treaties, but it's the states that have the criminal law power to fully implement them. So in that case, in the U.S., yes, they're breaking international law, but there is a federal ban, and it's harder to hold them culpable. Whereas in Canada, it's the same level of government, the federal government, where both powers are there to sign on to treaties as well as then implement them through criminal law or other mechanisms. Now, we do have options in Canada. First, we can change our constitution. We can renegotiate the treaty. Third, we can obtain special exceptions. Fourth, we can try to use some creative lawyering to work our way out of this. Or fifth, we can withdraw from these treaties. Now, I think 4 of those options are not particularly feasible. 3 in particular are not. And I'll say, the way I'll impart that is that I think convincing the 32 countries currently that have death penalties for drug smuggling to actually renegotiate the treaties or to actually grant Canada a special exception seems as politically impossible as adding a constitutional right here in Canada in our Canadian Charter of Rights and Freedoms to the possession of cannabis. I think probably everyone here would agree that's probably not politically feasible, although I defer to you on that. From my perspective, I really tried to be a creative lawyer and think through, if I was hired to try to think through how would I get around this international legal obligation, the best creative workaround I could find was trying to use the treaty's scientific purposes exception. So as I mentioned, in the treaties, they generally have a ban on and require states to prohibit narcotics, except for medical and scientific purposes. So theoretically, we could imagine if the government and if Canada signaled that actually the legalization of cannabis is part of a big scientific experiment around seeing the intergenerational effects of cannabis consumption or something like that, you could actually make a legal argument. But then for the International Court of Justice to uphold that, it would actually have to be a real thing. There would have to be major research funding to make that happen. The other potential workaround that some people have argued is related to something called principled noncompliance. This is where a government or a country would be saying, on principle, we're going to not comply and violate the treaties. Now, I think it's a cute political strategy, but as an international lawyer, that's just not the way international law works. And basically, that would be the equivalent of civil disobedience, except when it's an individual doing civil disobedience, they're in a position where they can't actually withdraw from the law, whereas Canada as a country, we can withdraw from treaties. And so that gets me to the fifth option we have, which I think is the most feasible, which is to actually withdraw from these UN drug control treaties. And I don't think that's a problem necessarily. I think that joining a treaty is an exercise of sovereignty. Removing ourselves from a treaty is also an exercise in sovereignty. Now, of course, it's a bit weird probably for an international lawyer like me to be recommending to withdraw from treaties, and I'll agree it's not my ideal solution, but it's certainly better than violating treaties, which is something I don't think any of us would want to see. And additionally, these treaties that we're talking about, these aren't the best treaties out there. As I mentioned, the first one stems from 1961. They're rather outdated, they're from another era, and actually they're kind of mean in the sense that they treat people with addiction as being, in the text of the treaty, evil, instead of as people who deserve dignity in treating a medical problem that they might have. Now, the challenge with withdrawing from treaties is that you have to give notice. And so in this case, if the goal was to have cannabis legal in Canada for non-medical purposes on July 1, 2018, then Cabinet would have had to give notice of withdrawal before July 1st, this past July 1st, so July 1st, 2017. If Cabinet today withdraws from the treaty, it means the earliest that we could legally legalize cannabis would be January 1st, 2019. And if Cabinet waited for the spring, or this upcoming spring, then the earliest that Canada could legally legalize cannabis under international law would be July 1st, 2019. Now, one thing that people are often ask me is, why does this international law stuff actually matter? And I have to say there is actually a pragmatic reason. It's not just that it would affect our reputation, but actually by not following international law, it actually undermines the best mechanism that we have in Canada to solve the problems, the big problems facing this world. And Canada can't condemn other countries for violating international law if we ourselves are planning for it. And if just one read of a newspaper would see that we really need a rules-based order in our world today. And so just to conclude, I think I just wanted to emphasize the important role that this committee plays in all of this. I think a lot of people think of international law as something negotiated in fancy places, New York and Geneva. But actually, international law, or the practice of international law, happens in rooms like this, at committees like this, by people like you. It's the collection of micro-decisions deciding whether are we going to allow legislation that's going to break international law to go through, or alternatively, are we going to take the small steps needed to make sure that, yes, legalize cannabis, but do it in a way that doesn't break international law. And so I'm really pleased to be here to be able to share that international legal expertise. And I hope my ultimate recommendation would be for Cabinet to immediately give notice of withdrawal to these treaties before any legislation is approved. Thank you very much. I'm happy to answer questions.
Well, thank you very much for outlining those options. Appreciate them. Now we're going to go by video conference to Dr. Bo Kilmer from Brazil. Dr. Kilmer.
Good evening, Chairperson Casey, Vice Chairperson Davies, Vice Chairperson Weber, and other distinguished members of the Standing Committee on Health. Thank you very much for the opportunity to testify before you today. I am a senior policy researcher at the nonprofit nonpartisan RAND Corporation, where I co-direct RAND's Drug Policy Research Center. Over the past 2 years, I've been fortunate enough to travel to Canada multiple times to meet with researchers, policymakers, members of the task force, to talk to them about cannabis policy and provide an objective assessment about what is happening with cannabis legalization in the United States. I was invited today to testify about my general thoughts on C-45 and on some of the international implications if it passes. I want to make it clear that RAND does not take positions on legislative bills or ballot initiatives. My goal for today is really to help inform cannabis policy debates at the federal, provincial, and at the municipal levels in Canada. I will divide my comments into 3 sections: prices, taxes, and the international implications. With respect to prices, many of the outcomes featured in debates about legalizing cannabis will be shaped by its retail price. For example, those seeking to reduce the size of the illicit market will want the retail price to be competitive enough to move users to the newly legal market. On the other hand, those concerned about an increase in problem cannabis use and cannabis use disorders will want to prevent retail prices from significantly declining because cannabis users are price sensitive. Now, over time, legalization is expected to dramatically reduce the production and distribution costs of cannabis for many reasons. Most importantly, you're getting rid of the risk. Right now, when someone buys heroin or marijuana or cocaine, a lot of what they're doing is compensating the drug dealers and everyone else along their supply chain for the risk of arrest and risk of incarceration. With legalization, that goes away. Also, firms will be able to take advantage of economies of scale as they move from producing in backyards and basements to larger farms and facilities. And also, it'll just be easier to take advantages of advances in technology if the activity is legal. Now, for those who are actually concerned about an increase in cannabis consumption and use disorders that are related to a price drop, there are several options that jurisdictions have. I want to briefly talk about 6 of them. The first option to help inflate the price would be to implement a government-run monopoly. And in fact, it sounds like that's what Ontario is thinking about doing. When the government has that control, it can set the price. The second option is just to minimize competition. If you are going to allow private firms to get involved, you can minimize the number that are competing, and so that should help reduce the drop in price. The third option would just be to cap production. A fourth option would be to impose costly licensing fees and/or regulations, such as accurate testing protocols. For example, requiring cannabis producers and or processors to submit to rigorous product testing for potency and adulterants, it ends up driving up costs to the firm, which are then passed on to the consumer in the form of higher prices. This can also help protect public health. The fifth option for keeping the prices higher is just to require minimum pricing, and Canada does have experience with that with respect to alcohol. And the final option would be to levy cannabis taxes. But before I get into more detail about cannabis taxes, I want to make it very clear about the trade-offs involved when we're talking about prices. Realize that if your goal is to eliminate the illegal market as quickly as possible, you're going to want to minimize regulations, and you're going to want that price drop to happen as quickly as possible. Now, if you're concerned about the public health implications of a price drop, you're going to want to take actions to inflate that retail price. It's important to acknowledge this trade-off and realize that people have different goals for legalization. And I think by just acknowledging that, it can lead to more productive discussions throughout the country. Now back to taxes. Let's make it clear, nobody knows the best way to tax cannabis, and there are trade-offs with all the options. For example, taxing as a function of price is attractive because it's very easy to apply. For example, Washington State levies a 37% tax at the retail level. But the main drawback with that particular option is that the tax revenue per transaction will fall as the price falls. Another option is to tax as a function of weight. For example, Alaska applies a $50 per ounce tax at the wholesale level. Once again, it's also easy to apply, but some are concerned that it creates incentives for the producers to sell more potent cannabis. You know, we know very little about the health consequences, both the risks and the benefits of these higher potency cannabis products that are being sold in the stores in Washington and Colorado. Realize that most of the research that's been done on the health effects of cannabis was largely based on people who were smoking lower potency cannabis in the 1980s and the 1990s. We've got a lot of research to do. Now, another option is to tax cannabis as a function of THC, which would allow the government to nudge cannabis users to lower potency products. Such an approach is similar to how many countries typically tax alcohol, with higher taxes imposed on products with higher ethanol content. The final report of the task force recommended that Canada develop strategies to encourage consumption of less potent cannabis, including a price and tax scheme based on potency to discourage purchase of high potency products. But C45 is largely silent on this issue. I now want to focus my final comments on the international implications, and they will, and I'll largely focus on movement of people and cannabis across international borders, as well as I want to say a few things, a few words about the banking situation in Uruguay. I will not speak to Canada's international drug treaty obligations and the various options Canada could pursue if it legalizes cannabis for non-medical purposes, including doing nothing. I will note, however, that what cannabis does, and perhaps more importantly, how other countries respond to those actions, could send a signal to other countries about their drug treaty obligations. Given Canada's size, its proximity to the United States, and its status as a member of the G7, national legalization in Canada could have a much larger international impact than the legalization of cannabis in Uruguay. With respect to the movement of people across international borders, drug tourism will happen if provinces and territories do not limit sales to Canadian residents. And if provinces and territories allow public consumption in cannabis cafes or cannabis lounges, this will make tourism even more attractive. There's also the issue of Canadians being denied entry to the United States because of cannabis consumption or a previous arrest. It is unclear whether the United States will change its approach if Canada legalizes cannabis, and if it does change its approach, whether it will become more or less strict. With respect to the movement of cannabis across borders, we must acknowledge that this is already happening via legal and illegal channels. Currently, Canada legally exports cannabis products to some countries for medical or research purposes. As for smuggling cannabis and money across the U.S. border, the amount, as well as the direction, will depend on cannabis production costs, retail prices, risk of arrest, and oversight on both sides of the border. Now, finally, Canada should pay attention to the cannabis banking issue in Uruguay. While Uruguay legalized cannabis for non-medical purposes in December of 2013, residents could not purchase it at pharmacies until July of 2017. And then in last August, it was reported that U.S. banks would stop doing business with banks in Uruguay that provided banking services to pharmacies selling cannabis. In response, the New York Times noted that the Uruguayan banks warned some of the pharmacies over the last few weeks that their accounts would actually be shut down. Now, it is unknown whether U.S. banks would apply the same pressure to Canadian financial institutions doing business with Canadian entities supplying cannabis for non-medical purposes. But if C-45 passes, this possibility should not be ignored. In sum, the federal and provincial governments will confront complex decisions if C-45 passes. Because it is hard to predict the international and domestic consequences of these choices, jurisdictions considering alternatives to prohibiting cannabis supply should proceed cautiously and build flexibility, especially with respect to prices and taxes, into the proposed regulations. With that, I will close, and I look forward to your questions and comments.
Well, thank you very much for that background. Now we go to Tusaw Law Corporation, Kirk Tusaw, by video conference. Have I said your name right?
Yes, you did. Thank you.
Okay.
Chair and members of the committee, my name is Kirk Tusaw. I'm a barrister based in British Columbia, formerly practiced in the United States, which perhaps is why I'm on the international panel. But I represent clients across Canada exclusively in cannabis law and policy, and have done so for the past decade. My firm currently acts for hundreds of people charged with cannabis offenses in Canada, many younger, few with other criminal records, and all of whom do not deserve to be treated like criminals for their cannabis-related activities. I was part of the legal team that successfully challenged the prior medical cannabis regime on charter grounds in the Allard case and litigated R.V. Smith, the only medical cannabis case to reach the Supreme Court of Canada. It resulted in a unanimous per curiam decision finding the CDSA unconstitutional because of its prohibition on access to medical cannabis derivative products. I commend the Government of Canada on its decision to move towards a rational and empirically based model for production, distribution, and possession of cannabis by Canadians. Before making substantive comments on Bill C-45, I'd like to take a moment to speak about why Canada is taking this important step. The Government of Canada posits two main reasons for legalization: to protect young people and to eliminate the black market. As a father of four, ages 7 to 17, and you may hear them outside the room later today, I certainly agree that protecting young people is an important social goal. The best way to protect young people is to stop criminalizing them. By far, the most harm done to young people related to cannabis is done by the criminal justice system, not the use of the substance itself. As a lawyer who has represented hundreds, if not thousands, of people unjustly charged with violating the cannabis laws of both the United States and Canada, I support eliminating the black market in the sense of allowing those that are now involved in the cannabis industry or wish to be involved to do so lawfully. When we speak of the black market as it relates to domestic cannabis production and consumption, we are not speaking of what most Canadians understand to be organized crime. We are not speaking of gangs. Instead, the domestic black market is comprised almost exclusively of ordinary Canadians, otherwise law-abiding, that make their living, pay their bills, and support their families by working in the cannabis industry. They do so for a variety of reasons. Some are committed to the plant and the cause. Some are entrepreneurs, employers, and small business people that simply want to be part of a vibrant industry that produces a product that brings people joy with very little in the way of negative effect. Almost none are violent or otherwise harmful to society in any way. And so while I agree that eliminating the black market is a critical goal, I strongly urge this committee and the governments of Canada and the various provinces and territories to understand elimination to be synonymous with transition and not with incarceration. This includes provinces like Ontario that are moving towards a misguided and unworkable government monopoly on retail sales. Private dispensaries are preferred by consumers, both domestically and in other legal jurisdictions internationally, and already do a great job providing dignified, reasonable access to cannabis. There are other, more important reasons to end cannabis prohibition. Canada is a constitutional democracy committed to notions of individual freedom and individual responsibility. This requires allowing Canadians to make autonomous decisions about their own bodily integrity without undue interference or criminalization of their choices by the state. Prohibition has caused incalculable harm both to society and to individuals entangled in the criminal justice system. 26,000 Canadians were charged with simple possession of cannabis just last year. Many will have difficulty crossing the border into the United States. Over the course of this failed policy, hundreds of thousands of Canadians have been criminalized to no good end. Each time a Canadian is arrested, handcuffed, and caged for cannabis-related activity, an injustice is done, harm is caused, and we all suffer. Moreover, Cannabis prohibition detracts from respect for the rule of law. Millions of Canadians violate the law by possessing cannabis each year. Some of these citizens have achieved positions of great prominence in our society. That is because either through accident of luck, social or racial privilege, or powerful connections, they've been able to avoid entanglement in the criminal justice system. Hundreds of thousands of Canadians are not so privileged. When millions of otherwise law-abiding and decent people feel it unnecessary, impractical, or harmful to obey the law, respect for the rule of law suffers. And when police officers are tasked with enforcing laws that are ignored by millions of Canadians, the relationship between the police and the citizens suffers. It is far past time to right these wrongs. Amnesty for Canadians charged with cannabis offences is long overdue, and I urge this committee to recommend amendments to Bill C-45 that would eliminate the criminal records of, at minimum, those convicted of simple possession of cannabis. This would go a long way to restoring their ability to travel, in particular to the United States. Turning to the substance of Bill C-45, I say with regret that much work remains to be done. This bill takes us in the right direction, but does not, and in its present form cannot, achieve either the goals that I have identified or the goals that Canada seeks to accomplish. Bill C-45 continues to criminalize young people for possessing more than 5 grams of cannabis, an extraordinarily small amount. It is very likely that post-legalization, thousands of young Canadians will continue to be entangled with the criminal justice system, doing irreparable harm to the future course of their lives. I agree with age limits related to sales of cannabis to Canadians by commercial entities. Parents, not shopkeepers, should be making these decisions. Age limits for sales, however, is an entirely different thing than imposing criminal penalties on young people for simple possession. I urge this committee to recommend amendments to Bill C-45 to remove any possibility of criminal penalties being applied to any young people in this country for activities related to cannabis. Bill C-45 also contemplates criminal penalties being applied to adult Canadians who possess more than 30 grams of cannabis or grow more than 4 100-centimeter plants per household. These are arbitrary numbers. These criminal restrictions are decidedly unlike the way that our country regulates alcohol, a vastly and inarguably more dangerous substance than cannabis. At this moment in Canada, a 19-year-old can walk into a liquor store and purchase enough alcohol to kill that person and all that person's friends and acquaintances. Indeed, there's enough alcohol in 1 bottle of vodka to kill the consumer. Similarly, there are virtually no restrictions on individual Canadians' rights to brew beer or make wine for their individual consumption or for non-commercial sharing with friends and acquaintances. Canadians can also currently grow 15 kilograms of tobacco per year, enough for some 15,000 cigarettes. Given that reality, it is ludicrous, or to put it in legal terms, arbitrary, overbroad, and grossly disproportionate to allow Canadians to be arrested and caged for simply possessing any amount of cannabis, or for possessing cannabis deemed to be illicit, which is, in any event, a wholly unenforceable distinction. There is no empirically, morally, or legally sound reason why cannabis should be treated more strictly than alcohol. There are also practical difficulties related to these arbitrary restrictions. Cannabis, particularly outdoors, can easily grow 5 or more meters high in its natural state. Do we really need or want a rule that would require Canadians who wish to grow a few plants in their gardens to continually tie down the branches or otherwise artificially manipulate the plant during its growth to keep it no more than 99 centimeters high? 100-centimeter limits are the height of absurdity. In addition, the 4-plant per household limit arbitrarily penalizes those living in large households. These limits, backed by criminal sanctions, will certainly lead to legal challenges based on Section 7 of the Charter of Rights and Freedoms, which requires the liberty of Canadians not to be infringed by arbitrary, overbroad, or grossly disproportionate laws. The restrictions on possession amounts and plant numbers and sizes for personal, non-commercial production of cannabis also detract from the goal of eliminating the black market. Allowing Canadians to be self-sufficient and to obtain their cannabis by growing for themselves supports the transition away from reliance on the black market. I urge the committee to recommend amendments eliminating limits on what Canadians can possess or grow for non-commercial purposes and removing the artificial and unenforceable distinction between licit and illicit cannabis. At the very least, possessory limits should be increased substantially, and plant limits should increase and be calculated per person, not per household. Also critical to ensuring a workable transition away from the current vibrant, enormous, but unlawful market for cannabis in this country is to make the process of becoming a commercial producer and distributor of cannabis as easy as reasonably possible. Most details related to becoming a commercial producer of cannabis are not contained in the bill and are instead left to regulations to be determined. If those rules mirror the current situation involving production for medical purposes, they will be too onerous, there will not be enough people or companies able to participate, there will be an insufficient amount of lawfully produced cannabis available to Canadians, and the black market will continue to thrive. The black market will also continue to thrive throughout the entire supply chain, from production to processing to sale, if legalization does not include products that are becoming increasingly popular. Edibles, concentrates, and products like vape pens must be legal. Trends in Canada and other international legal jurisdictions, in particular in the United States, demonstrate the increased popularity of these methods of consumption, which are also potentially less harmful to the consumer and less bothersome to non-consumers. And on a practical note, there are literally hundreds of companies operating in Canada making these products right now in a professional, safe, and sophisticated manner. These products are not going away and all rely on someone growing the raw plant material to make them. If they are not legal, then as always, consumer demand will be filled by persons operating outside the law. Better by far is to allow the existing industry to come out of the shadows and into the light. I urge the committee to recommend amendments to Bill C-45 that legalize cannabis derivative products, eliminate barriers to entering the lawful industry for persons currently participating in the unlawful marketplace, and to carve out from federal oversight the intra-provincial production and sale of small batch craft cannabis. Thank you for the opportunity to address the committee, and I look forward to your questions.
Well, thank you for your very clear presentation. We appreciate this. Now we'll go to Transform Drug Policy Foundation, Mr. Stephen Rolls from the United Kingdom. Welcome.
Thank you very much, and thank you for the opportunity to address you on this important issue. I am the Senior Policy Analyst for Transform Drug Policy Foundation, which is a UK-based charity and think tank. We're involved in policy analysis and advocacy in the field of drug policy, specifically drug policy reform. And our speciality has been to focus on models of legal regulation and advocacy to bring them about. We've been involved in this work for more than 20 years now. And our work has substantially focused on cannabis in recent years because of the nature of the debate. We've produced a detailed book, which is available online as a PDF download, that looks at the detail of cannabis regulation models, from production through how you would regulate the products in terms of things like preparation and price and packaging, and taxation issues, some of the things that Bo touched on, how you regulate vendors in terms of training and licensing requirements, how you regulate the outlets where cannabis would be available from in terms of things like opening hours and storefronts, and how you regulate access. Who has access to this market? So issues like age controls or membership clubs. And I'm obviously happy to speak to any of those particular issues that the committee's interested in the question section afterwards. We also have specific chapters on cannabis-impaired driving, cannabis-related tourism, and cannabis and the international treaties, which I'm going to come on to in a moment. I think before I go into the specifics, there was just a few general comments, which I think to a large extent are going to echo things that other speakers have said, both tonight and during the week. I think the importance of evidence-based policy is clear to everybody, and therefore it's vital that proper evaluation and monitoring mechanisms are hardwired into the policy framework from the outset. It's obviously important to know what's working and what's not working, and to have a system that is able to respond to that evidence in a flexible way. It may be that the system is too loose and needs tightening up. It may be that the system is too restrictive and needs to be relaxed in some ways. But we need to be constantly monitoring the evidence, looking at what works, and responding to that in a scientific and responsible way. I think my second point is that clearly there is a tension between the interests of public health and the interests of commerce and commercial entities. Public health will tend to seek to moderate and reduce use, whereas commercial entities are essentially profit-seeking and may seek, as a result, to increase sales or initiate new use. That's not to say all commercial entities are going to behave irresponsibly or in an unprincipled way, but there is clearly a tension there. And I think it's vital that we learn the lessons from alcohol and tobacco regulation around the world and look at what's worked and what hasn't worked. And that's very much what's informed Transform's work in terms of developing our proposals and propositions and analysis around cannabis regulation. I think there's a particular focus, bearing that previous point in mind, on the need to regulate retailing of cannabis and access to cannabis markets in particular, with a particular focus on advertising and marketing. Whilst I very much support the freedom of people to consume cannabis and to be able to access it and buy it, I'm less enthused by the freedom of profit-making commercial entities to aggressively market potentially risky products as a sort of lifestyle accessories. And again, looking at the experience with the bad old days of alcohol and tobacco regulation, I think we need to learn those lessons and make sure we don't repeat those mistakes. The final point on just general introductory point is the need to start cautiously. I don't think there's any need to rush into a program of legalization. There are many things we don't know. I think it's absolutely fine to err on the side of caution initially, see how it's working, have an initial system bedding in, and then move cautiously forward on that basis, looking at what's working and what's not working. We don't have to make everything available overnight. We can move in stages. Part of the work that I've done on this issue was working with the Canadian Task Force, the Federal Canadian Task Force, and I thought their report was an outstanding piece of work. And I was very happy to be an advisor. Bo was also an advisor with that group. And along with Transform's other work, we have also supported the work that's taken place in Uruguay. I was an advisor to the Uruguayan government, developing their regulation models. And in various forms, we've worked with a number of other governments. We've been very actively involved in the debate in Mexico, various European countries, in Jamaica, and elsewhere. But the task force, I thought, did an excellent job. And really, the issues I've had with the bill, as far as I've scrutinised it, which I have to be clear is not in forensic detail, is generally where they have diverged from the recommendations of the task force. I would certainly echo some of Kirk's comments about criminalising young people. That really is not sensible. It's not going to deliver any of the outcomes that we all seek. And I also think there are some absurdly harsh sentencing proposals within the bill, particularly around, I noticed there was a potential maximum 14-year sentence for supplying drugs to minors. And whilst that's obviously that does need to be an offence, I looked at the Canadian law and saw that it's 1 year for doing that for alcohol and 90 days, I believe, for tobacco. So it's clearly disproportionate and it's inconsistent. And I think that kind of thing undermines the rule of law and doesn't support the goals that are outlined at the beginning of the bill. And it's certainly not going to help protect young people. So I would encourage the laws to be, the amendments to modify those absurdly disproportionate sentences. Coming briefly onto treaty issues, I have some disagreements on political strategy with what Professor Hoffman said, although much of what he said I was very much in agreement with. Clearly, the treaties were drafted in the 40s and 50s, nearly 60 or 70 years ago, the 1961 treaty, and a lot of it was based on treaties from even further back, the 1912 sort of Opium Hague Convention and others. These are hideously outdated treaties that were written in another time when the political, social and cultural landscape was vastly different to the one we live in today, and they are simply not fit for purpose. So I don't see this as being the tensions that have emerged for Canada. I don't see these as Canada's fault. I see them as the fault of a broken, outdated international legal system in terms of drug control that is badly in need of modernisation. There are, as Professor Hoffman has outlined, there are a number of ways in which these things, these tensions that have emerged, could be resolved. But I think I'd absolutely agree with Professor Hoffman that if Canada does proceed, the legislation will put them in non-compliance with their obligations, or at least some of their obligations, or with regards to cannabis in the treaties. The treaties can be amended, but that requires a consensus, and that is very unlikely to be achieved at the UN, given the lack of support amongst many countries for these sorts of reforms. The treaties can be modified. That doesn't require a consensus in terms of rescheduling cannabis, so cannabis could actually be removed from the treaties altogether by a scheduling decision. That requires a majority vote at the UN, but again, that seems highly unlikely given the balance of opinion within UN member states. Individual member states do have options, and Professor Hoffman has outlined some of these. Withdrawal is one of them. I would disagree about the desirability of withdrawal. It seems to me that it could come with serious political consequences. There are international trade deals that are linked to participation in the treaties. The UN still has its system of judging countries in terms of their application of the UN drug treaties. And also there are parts of the treaties which are very useful and important and for which a consensus does exist. The most obvious one there being the control and regulation of the trade in medical drugs and controlled medicines. And we would not want to see that jeopardised by individual states withdrawing. There is the possibility of withdrawal and reaccession with a reservation on cannabis, but that comes with its own issues and challenges. I can certainly talk about that during the question and answers if people are interested. And there is another option which was touched on by Professor Hoffman, which is certainly one I think is strategically perhaps the most favourable from my analysis, which is to continue with implementing domestic reforms whilst in what we would call principled non-compliance. And clearly, open non-compliance with the international legal obligations is not desirable. However, in some circumstances, temporary periods of non-compliance may be necessary. Indeed, domestic laws and practice change in a wide range of fields, and non-compliance is a fairly common feature of international regime evolution and modernisation. And to be very clear, the problem at hand here is not Canada opting for a regulatory approach to cannabis. Rather, it is the outdated legal treaty framework that gives rise to this need for a temporary and transitional period of principled non-compliance. As such, the recognition of the fact that Canada can no longer comply with the Convention's obligations regarding cannabis need not be seen as disrespect for international law, in my opinion. On the contrary, if accompanied by reasonable arguments and the expressed intention to resolve the situation over time, taking a stance of principled non-compliance can, in fact, confirm that the treaty commitments do matter and that they require careful consideration. And there are ways in which Canada could proceed. For example, they could attempt, in parallel to their domestic reforms, to entertain treaty amendments and treaty modifications. Now, problems may arise with that, and they may not succeed, but they are showing a commitment to resolving their problems and resolving their obligations. They can also...
Mr. Rawls, we have to move to questions pretty soon. Okay, thanks.
Okay, well, I will conclude. I can take questions on some more of the detailed issues around that as we proceed. But it's just to say that we are moving into, in many ways, uncharted waters with regards to treaties. So there are many questions outstanding in terms of how individual countries or countries working together should proceed to resolve the tensions that cannabis regulation is presenting.
Okay, thanks very much. Now we'll go to questions. We have our first round of 7-minute questions, and we're going to start with Ms. Sidhu.
Thank you, Mr. Chair. Thank you, all the presenters. My question to Mr. Rolls. One of our goals with this legislation is to reduce the black market and organized crime. Do you think any other jurisdictions with legalized cannabis had success with this?
It's actually quite early to tell. In Uruguay, the cannabis stores only opened very, very recently. It was in a matter of weeks ago. Probably the best evidence, and I think Bo could probably speak to this better than I can, would come from Colorado and Washington, where the retail stores have been open for a couple of years now. It's quite difficult to estimate the degree to which the criminal market has been undermined, because they are, whilst some people have estimated, I think, that as much as 60% of the market has now moved into the legal sphere, there is an issue in that that those states border other states that are still prohibitionists. So a lot of people are obviously crossing state lines, buying cannabis in the legalized state places, and then leaving again. So it's quite difficult to make an estimate. So I would probably bounce that question over to Bo if he's happy to take it.
And you just give a statement if treaties outdated non-compliance. Can you tell about the treaty modification? Can you explain a little bit?
Well, there are various mechanisms that are clearly outlined within the treaties themselves, and I'm sure Professor Hoffman can speak to this as well, by which the treaties can be modernised. So amendments can be tabled, and then they are then either accepted or subject to a conference of the parties, or they are rejected. And modification is a mechanism of scheduling a particular drug. So the drugs are placed in a particular schedule that, rather like, I'm not sure how the Canadian system works, but the schedule that they're placed in determines how strictly those particular drugs are regulated and controlled. And cannabis could potentially be rescheduled from Schedule 1 down into a less strict schedule that might make it more accessible in some ways, or it could be rescheduled, it could be descheduled and actually removed altogether from the treaties. It's not entirely impossible.
So in your view, if we can, somebody can do that in that modification side, and there's nothing to violate the international law. So.
No, but the problem is that those decisions have to be made by the group of member states, and there are many member states who would oppose such a move. So it becomes very, very difficult. Whilst there are a growing number of member states who are exploring options for regulation and are exploring options, are keen to explore issues around treaty reform to allow those to proceed without creating these tensions, there's also a large group of member states who are very much opposed and would act as a bloc. So in the short term, at least, whilst it might be worth pursuing issues of amendment or modification to show goodwill and also to make sure these issues are being actively discussed in key UN forums, they are unlikely to prove successful in the short run. And that then means that if Canada is to resolve these issues, it may have to act either unilaterally or with a group of like-minded states who they can act in conjunction with.
Oh, thank you. And my next question's to Mr. Kilmer. You said different option for taxation. You also submit the paper. We heard this week that setting a tax rate for cannabis complicated decision with imported implication. Could you talk about your proposal you submitted by weight, taxation by weight and taxation by THC level, and discuss any benefits or concern with these?
Oh, sure. There are a number of different ways to tax cannabis. And I want to make it clear, nobody knows the best approach. In my testimony, I only highlighted 3 of them. There are many other approaches, but I do want to spend some time talking about the 3 that I discussed. The one that is most popular here in the United States is an ad valorem tax. So that's taxing as a function of the price. Now, as I said in the testimony, the advantage to that is it's easy to set up. We're comfortable doing that. We do this for other products. There are 2 potential drawbacks with a price-based tax. First of all, you have to be smart about bundling, because if you're not, someone can just, I'll sell you this pipe for $30 and give you the cannabis for free. So people may do things like that as a way to avoid the tax. So you have to be smart about bundling. And the other issue is that as the prices go down, the amount of tax revenue you're going to generate is not going to be as high as you thought it was going to be. And this is important because now there are a lot of people getting into this, kind of different consultants and people that are trying to make projections about what's happening, what's going to happen with tax revenues by year 2025 and year 2030. And you have to be skeptical of some of these estimates that are coming out, because I don't think they're necessarily accounting for the fact that there could be this large price drop. And a second approach is to tax as a function of weight. And once again, the advantage, and so like I said, Alaska does this. They tax at the wholesale level, it's a $50 an ounce tax. And, the advantage to that is it's very easy to apply. It's very easy to collect. The potential drawback with that is that it creates incentives for the producers to produce more potent marijuana as their cannabis as a way to kind of avoid the tax. And as I said, we know very little about the health consequences associated with some of the high-potency products that are being sold. Just to give you some insights in terms of what's happening in Washington State, I've been working with a team that's been analyzing all of their data from their traceability system. And so it's their seed-to-sale system. They're tracking the plants all the way through to the final sale and keeping track of prices and potency. And, Canada's selling Washington's selling about $100 million worth of cannabis products every month. Of that, probably 70% of that is cannabis flower. And of the flower that's being sold, more than half of it is reported to be of THC levels of 20% or higher. Now, there might be some inflation there, so maybe it's only 18%. But at the end of the day, some of the flower that may be 10 to 12% THC, you're just not seeing much of that in the stores. And then also the fastest growing segment of the market in Washington isn't edibles, although edibles get a lot of attention. It's actually the concentrates. So these are your waxes, your oils, and also the vape pens that are like the e-cigarettes, but instead of having a nicotine solution, they'll have a hash oil solution. And so that's kind of the fastest growing segment. And to be honest, we don't know much about the health consequences of these higher potency, either the flower products or the oil products. And but I also want to make it very clear that when we talk about the health consequences, we need to be talking about both the risks and the benefits. And there's also this issue of titration, that it might be the case that, whereas before someone used to smoke a whole joint that was 5% THC, well, maybe if it was 15%, they would only smoke 1/3. It turns out we don't have much research on this issue of titration. I know of a few studies that have been published in Europe, but none in Canada or in the United States. So there are some concerns there about a weight-based tax kind of creating incentives for people to use these more potent products. Thus, leading to a third option is a tax as a function of THC. In fact, that's what many jurisdictions do when they're creating their alcohol taxes. It's the tax will be a function of the ethanol content. And what this does is it gives the jurisdictions the ability to kind of nudge some users toward these lower potency products. And so the advantage of that is you're taxing as a function of intoxication, and to the extent that we think that intoxication is associated with a number of public health harms, this could kind of help reduce those harms. On the other hand, the system could be hard to set up. It's all going to depend on how good you feel about the rigor that's in your current testing and labeling regime. If you feel good about the labels that are going on those packages and what's being reported, then taxing as a function of THC is easy. However, if you don't feel good about your testing regime, if you don't feel as if it's accurately portraying what's in those packages, you still have other options. And so one of the things I talked about in the testimony is that in the short run, if you don't feel that your testing regime is providing useful information with respect to the THC or CBD content of the plant material, you could always, it's easy to tax the concentrates and oils as a function of THC, but for the flower, you could actually have an alternative minimum tax. Whereas you could either, the tax would either be determined by the stated THC that the company puts on the package, or either a price or a weight-based tax. And the way they would set that up is that whichever tax ends up being higher, that's the tax that you would have to pay. So that's a solution that you could implement in the interim while you're developing a rigorous testing regime.
Thanks very much. Time's up. Ms. Gladue.
Thank you, Chair, and thank you to all of our witnesses for appearing. I want to go back to the topic of treaties. I think it's completely unacceptable that the Liberal government, by choosing an arbitrary implementation date, would put us in a position where Canada would breach 3 treaties that may jeopardize trade deals that are dependent on us complying to them. I think that's ridiculous, and I think it's naive to think that we could have any kind of integrity on the world stage by violating the treaties. I think principled noncompliance was the term used. This is ridiculous. We are always calling out other countries that don't abide by the treaties they've signed with the UN, and we will lose that ability if we don't address this situation. So I think this is completely irresponsible. In terms of withdrawing from the treaty, I think, Mr. Hoffman, you said that if we gave notice now, we could then legalize in January of 2019? Is that right?
Yes.
Okay.
Yeah.
No, and then the other option that we would have is to try to somehow get recognition that these treaties are old and either get cannabis taken off or do some kind of modification. Can you tell me, how long that would take and whether you think there's any likelihood of success?
Yeah, so thank you very much for the question. I think the reality is that that countries have a very different view of how the best way is to regulate narcotics, including cannabis. And the challenge then is we have this multilateral treaty, with most countries in the world are part of. And as a result of differences, it means it would probably take quite a bit of time to negotiate a change to that treaty that would allow the current legislation as drafted to be legal under those international treaties. It can be happening. It can happen. Certainly, renegotiating them would be the ideal, and and if Canada did that, that would be great because it would give a legal avenue to do what's being proposed. But the reality is that if I'm interested in making sure, not only in the long term, but also the short term, that we're not breaking international law. And so the reality is we would not be able to successfully negotiate change in the treaty before, for example, a July 1st, 2018 deadline.
The only option that we would have then is to not legalize marijuana, but to do what Amsterdam is doing and basically stop enforcing criminal charges.
Canada has several options, but the one that's most feasible for both allowing the legalization of cannabis as well as to not break international law would be to actually withdraw from the existing treaties. Certainly, if the government would be able to do, for example, decriminalize cannabis, that would be allowed under the treaties. Also, like the Netherlands, the government could decide not to enforce the treaties. That would be allowed under international law. But under the current proposal, it's to legalize and regulate cannabis, which would not be possible under the current the 3 treaties as currently written.
All right, thank you. Another concern I have has to do with the ability to cross the border into the U.S. So we've had testimony from various people that have indicated because it's illegal federally in the U.S., any Canadians that have charges or that declare that they have smoked pot will not be allowed to enter into the U.S. Do any of our witnesses know of a potential way around that or what the solution to that is? I think Mr. Rollis is trying to.
Oh, sorry. I've got no visual here, so I can't see anything. Unfortunately, I'm looking at a black screen. Sorry, the signal's gone up, but I can hear what's going on.
All right, go ahead.
Well, the obvious solution would be for federal legalization to take place in the United States. That would resolve the. That would presumably resolve the problem, and may not be that far away. I mean, many states have legalized or are about to. The Democratic Party have a path to legalization as part of their policy platform now. Obviously, the current administration isn't terribly interested in that, but that issue may resolve itself in time. It can't be that far away before federal legalization takes place in the US. Until then, you are beholden to whatever the UN, the US determines. But of course, it's worth remembering that you have borders with some legalization states as well. So I don't know quite how that's going to work, because presumably it would be quite strange to stop people who had cannabis convictions going into states where cannabis was legal. So there is this quite strange tension between federal and state law as well. But it's a rapidly evolving field, so this may all change very soon.
Well, thank you very much. Mr. Tuso, I think you made a comment that you don't think Ontario's plan to have this government monopoly is workable. Could you expand on that?
I certainly could, and thank you for your question. There are a number of practical difficulties with a government monopoly coupled with a federal jurisdiction over production. Let's take a simple example. Presumably, the government of Ontario is seeking to exert its purchasing power to try to negotiate lower per gram costs of purchasing cannabis from the federally licensed producers. If those federally licensed producers, all of whom currently have direct-to-retail distribution systems in place, are not satisfied with Ontario's offer to purchase the cannabis, they may well just decline to sell to them, in which case consumers in Ontario will essentially have no access to cannabis through Ontario's government monopoly model. Certainly, if I were running a licensed producer and Ontario tried to come in and suggest to me that I should sell to them for $3 or $4 a gram, and I'm selling direct to consumer currently in other provinces for $8 to $12 a gram, why would I sell to Ontario? And then you have a situation in which residents of Ontario either don't have access or they have to go through the artificial step of obtaining a doctor's prescription so that they can then access the medical cannabis model, which would give them direct access to the licensed producers. That's one small problem among many. Another problem is that there's already a very vibrant distribution system operating in the gray market in Ontario. There's probably somewhere in the neighborhood of 100 to 200 private dispensaries selling cannabis to consumers in Ontario right now. These entities are not just going to disappear. And if you don't transition the black market into the lawful market, then you're setting up a system of competition. The only way to shut down the competition is through the use of likely draconian police state tactics. Prohibition hasn't stopped any of these people from doing what they're doing. In fact, prohibition has led directly to the situation that we find ourselves in right now. So there's just no practical way. And here's what I think the fundamental misconception is. I think a lot of people think that legalizing cannabis is the creation of an industry. It's not the creation of an industry. The industry exists. It's vibrant. It's massive. There are literally thousands and thousands of people engaged and working in this industry in every province in this country. There are millions of different products out there. There are very sophisticated businesses working in this sector right now. And so we're not creating an industry. The best that we can hope for is to compete with the existing industry. And the best way to do that, as I say, is to transition those people that already have the expertise, that are already doing the job and doing it quite well and quite successfully, into the legal marketplace. Anything else is likely doomed to failure.
I think I'm out of time.
Yes, thanks very much. Mr. Davies.
Thank you, Mr. Tusaw. I'm going to be directing most of my questions at you. So I'll start with you. I think you very articulately described the problems with criminalization And I think to give the government credit, I think that's something that it itself has recognized and is some of the fundamental rationale behind this bill. I think Prime Minister Trudeau has recognized that criminalization has simply pushed products underground and led to the creation of an illicit market that doesn't really work. You've also pointed out, though, that this bill, Bill C-45, essentially retains a criminalized approach to cannabis. It is criminal sanctions for possession over 30 grams. There's criminal sanctions for growing more than 4 plants. There's criminal sanctions for selling, in fact, with penalties up to 14 years. So if criminalization doesn't work generally, my question to you is it not somewhat misguided to sort of take a quasi-criminal approach to C-45? Or are we going to have problems down the road with the maintenance of the criminalized approach in this bill?
Oh, I think we're absolutely going to have problems with maintenance of a criminalized approach in this bill, and I think it's not just a little bit misguided, it's deeply misguided. Now, I think that there are probably some practical and some political reasons why the government has chosen to proceed in this fashion. The political reasons are quite clearly to legalize cannabis and to try to deflect political criticism from typically the right, but some aspects of the left, about this process and these steps that we're taking, and to try to therefore do it in the most small c conservative way possible. The practical consideration may well be that we know the Supreme Court of Canada, in a ruling in the Malmo Levine case, said that the Parliament retained the power to prohibit simple possession of cannabis as an aspect of the criminal law power. If this is not a criminal law enterprise, it becomes a little less clear what the jurisdictional basis for the federal government's involvement in this area of commerce actually is. I think those are surmountable obstacles. At the end of the day, I think we need to look at just some fundamental fairness. Cannabis is safer than alcohol. Fundamentally, empirically, that is beyond question. Cannabis is safer than tobacco. There's no good reason why we're going to treat cannabis in a way that's significantly more strict than we do alcohol. Alcohol in our society is a source of tremendous harm, and it's also a source of tremendous pleasure and joy. I enjoy a good glass of wine. I like to go to my local vineyards. I'm a regular patron at the brewery, small craft brew pub down the street from my house. I have a keg of their beer in my garage. I'm not anti-alcohol. But I recognize the harm that it does to our society. All of those things, by the way, the vineyards down the road, here in the Cowichan Valley, we have probably 20 wonderful vineyards, many more in the interior of our province. The small craft brew industry that's rapidly growing here in British Columbia, those are provincially regulated enterprises, as well they should be. The federal government's role really ought to be minimized in this area. And quite frankly, with the greatest respect to what the government's done so far, it hasn't done a very good job regulating access to medical cannabis. The medical cannabis system that was started by court order in 2001 has been struck down by the courts repeatedly in litigation that I'm sure has cost the government of Canada tens of millions of dollars.
I'm going to stop you there because I've got a few other questions. I want to talk about edibles, sure, concentrates, and other non-smokable products. Again, as you know, the government has not included those in this bill. I've gotten a number of different answers from the government. They say that it could happen imminently. It's down the road. They didn't have time to do it. I'm not quite sure. But given Colorado's experience and Washington and Alaska's with successful regulatory regimes about edibles, do you see any reason why we shouldn't put edibles and concentrates into the legal framework now? And what are the consequences of not doing so?
Well, in fact, there's every reason to put those products into the legal framework. The consequences of not doing so are the continuation or perpetuation of the black market, all the way from growing the raw plant material that you use to make the products through the point of sale. And in fact, we're seeing this even in municipal jurisdictions that are regulating cannabis dispensaries but have taken the step of banning edibles. People want these products. Consumers want these products. And anytime consumers demand a product, someone's going to rise to fill that demand.
Now, you Sorry, you described the majority of people involved in the marijuana industry as law-abiding, nonviolent, entrepreneurial. these are the black market we talk about, really. I mean, there's a tendency to think Hell's Angels and organized crime, but you described a very different picture of the thousands of people who are currently involved in this industry. And you have said that we have to remember that virtually all of the cannabis produced and sold in this country right now is done so unlawfully. But if the government wants to eliminate that portion of the industry, this bill is not the way to go about doing it. Can you expand on that? Should we bring those people into the legal market? Does C-45 do that? And if not, what should we do to help facilitate that transition?
Not only should we do that, we have to do that for this to be successful in eliminating the black market. The fact of the matter is that there are tens of thousands of people, if not hundreds of thousands of people involved in the illicit industry today. I've represented many, many of these people. I'd invite them all to my home to have dinner with my family. They're wonderful, good people, and there's no reason for them to be considered or lumped into this category of organized crime with its connotations of violence and gang-related activity. That's just not what's going on. I think in perhaps thousands of disclosures that I've seen in criminal cases, a small fraction have contained any evidence of any involvement with what Canadians traditionally believe is organized crime. And you've heard from Professor Boyd, I believe, and his research in this area that shows 95% of people are not involved with organized crime. So how do we bring them out of the shadows and into the light? Well, we have to make it easy for them to participate. We have to get rid of some of the onerous barriers to access that exist in the medical production system, the unnecessary security requirements, the government micromanaging and requiring 800 or 1,000-page standard operating procedures to be provided in order to get a license. The government should be setting baseline standards that private enterprise has to meet. If you meet those standards, you get to participate in the illicit or in the new licit system. And that's how we do it. It sounds simple because it is simple, but we need to get rid of this sort of paradigm of considering people that are in the cannabis industry today as somehow criminals that we have to prevent from participating in the future. They're not going to stop. Why would they? Prohibition hasn't driven them out of business. Legalization certainly won't.
Time's up. Okay, Mr. Oliver.
Well, thank you very much, and thank you for your testimony here today. And Mr. Rules in particular, it must be early in the morning there on Friday, so thank you for hanging in with us this late into the night or early in the morning on your end, so I very much appreciate that. In terms of the RAND Corporation's work, we've had a lot of information on not-for-profit and for-profit and cases being made either which way. Has the RAND Corporation studied this? If you think about our three objectives of getting the product out of the hands of young people, of deterring organized crime and ensuring safe product and legislated product, does profit versus nonprofit, has the RAND studied that? Do they have any conclusions on that particular question?
Well, we've done a fair amount of work looking at the various models that jurisdictions could consider if they're thinking about doing something other than prohibiting cannabis supply. And so going back to, there was an earlier question about the government monopoly. And I mean, here, this is where we actually can learn from from all the research that's been done on alcohol. And it's very clear that kind of the state monopoly approach on alcohol is much better for public health than allowing for-profit companies to supply the good. And a lot of this comes down to what we would call Pareto's law, or the 80-20 rule. And that it's for alcohol, it's 20% of users that account for 80% of the consumption and expenditure. So when the alcohol companies, that's who they're targeting. They're targeting those heavy users. In some work I did for the White House Office of National Drug Control Policy, we also found that it was 20% of the users of cannabis that accounted for 80% of the expenditures. These are your daily and near daily users. So if you're going to allow for-profit companies to produce and sell and advertise, this is who they're going to target. They're going to be focusing on those heavy users. So that's one of the things you have to consider if you're going to allow for-profit companies to get involved. One of the advantages of the state monopoly system is that the state could control the price, and it could also limit the amount of it could make it easier to limit the products. It could also potentially limit advertising, although you have to realize that, I mean, as you see with gambling too, governments do advertise. So, I mean, there are drawbacks with all these options. Kind of in the middle of those two options is the not-for-profit approach, and that is, instead of allowing for-profit companies to produce and distribute and sell, you could just have nonprofits, perhaps those that have a focus on public health or on child welfare. I mean, at the end of the day, you're helping to create a new legal industry. I mean, there's been cannabis transactions in Canada and the United States for decades, but this is your chance to create this new entity. And as I hoped I made clear in my testimony, we really don't know how this is going to play out, especially with respect to public health. And so you can have a few different approaches here. If you go from prohibition all the way to the for-profit model, and then you decide 10 years later, oh, you want to try something else, it's going to be a lot harder to put that genie back in the bottle once you have all these companies and their powerful lobbyists. If you're risk-averse, the other approach would be maybe start with a government monopoly, see how that goes, and then if you want to change that, then maybe move to nonprofit, and then from there, you could potentially move kind of incrementally toward a for-profit approach. And especially with respect to all of the high-potency products. As I said, I mean, that's largely what you're going to be seeing. My guess is that that's what you're going to be, that's what you're going to see sold in the stores unless there are limits on those. And right now, we just don't know much about those health consequences. So, I think you're going to want to proceed cautiously.
All right. Thank you for that. And Mr. Rolls, just in terms of edibles, so our current schedule, edibles are not legalized. And we've heard from some of the people that were working on the drafting of the legislation that the advice from Colorado, they got into edibles very quickly, and there was a lot of problems and a lot of issues, and they had advised to go slowly with that. But we've heard from others that if we don't move into edibles, then the organized crime piece or the black market will continue to supply them, and we're going to be continue to promote that. Colorado has since come a long way. I mean, they have quite extensive regulations and a regulatory framework around edibles. Do you think it would be wise for Canada to borrow from Colorado? Can you see any downside to doing that? Would it be a way to move us into edibles faster, do you think?
I mean, I have mixed feelings about it. I mean, I think you're right that Colorado probably did move too fast, or the model they put in place for edibles was inadequate, and it did create problems. But at least I think it was at least showed a success of the regulatory system, that it acknowledged those problems, and a lot of those rules were then tightened up. So now I think they have single servings only, a clearer packaging, markings on the edible products themselves, and a series of other regulations that have helped reduce some of the challenges that they faced. I think it's obviously going to be very important to look at that and learn the lessons from it. And Washington, they've also had some similar issues. I mean, one of the things that we've advocated for is that the new legal market shouldn't diverge too far from the existing illegal market in terms of the range of products that are available. And to that extent, what I mean is that you wouldn't suddenly open up necessarily a vast array of new products that aren't currently being sold or consumed, because if you do that, there could be unpredictable impacts in terms of consumption behaviours and potential public health impacts. A lot of people have argued that edibles are intrinsically less risky than, for example, smoked cannabis, because you avoid the risk to lung health that you get from smoke products. I think that's a reasonable argument, but there is a counter argument that edibles are intrinsically more difficult to titrate and dose, because the effect takes so much longer to play out. So there are clearly health benefits on one hand and health risks on the other hand. I think on balance, I think it's probably a positive that edibles would be made available, but I think it's also reasonable to be cautious, particularly in the places in Canada where there isn't already either a medical edible market or sort of dispensary medical edible market. I don't think there's any need to rush into edibles, and I certainly don't think there's any need to rush into concentrates. I think it would be perfectly, from my perspective, it's perfectly reasonable to propose that they could be part of perhaps a second wave of regulatory expansion once the sort of herbal cannabis market had been established and bedded in, and initial teething problems had been dealt with. I think it's okay to be cautious on this, but I certainly wouldn't suggest banning them. And I think it's also reasonable to point out that, if you have herbal cannabis available, turning herbal cannabis into an edible product is not that difficult. You can just bake it in a cake, or you can mix it with some butter and, make it into almost. It's not that difficult. There's not some, to my mind, terrible, egregious denial of accessibility to edibles if you have access to herbal cannabis.
Okay, time's up.
Thank you.
And that completes our first round of questions. We'll now go to 5-minute questions and start with Mr. Weber.
Thank you, Mr. Chair, and thank you to the presenters as well. I do concur with my colleague here. I think it's absolutely unacceptable that we are violating UN treaties to pursue legalization of marijuana in this country. And I don't know the direction of what the Liberal government is going to do, whether they're going to obviously either withdraw from the treaties or just violate the treaties. I would like to know from that government what they plan on doing. A question for Dr. Hoffman. I enjoyed your presentation, the options, the different options that we have. Convincing other countries to renegotiate obviously sounds impossible, according to Mr. Rolls. Creative lawyering, of course, this is a big scientific experiment here in this country. Perhaps we can pursue that. Of course, as you said, we need major research dollars to make that happen. But obviously, it looks like we are not going to comply. We are violating the UN treaties. We'll either withdraw. What will the ramifications be, the consequences to our country by violating these UN treaties?
Thank you for the question. I really would love to emphasize that the consequences actually are quite severe, in the sense that it's not just our reputation, it's not just Canada's standing on the global international scene, that if we violate international law, we are actually undermining the best mechanism we have to get countries to work together and solve some of the biggest challenges we face in the world. I mean, one just needs to think about examples like Syria's use of chemical weapons, or North Korea testing nuclear weapons, or even closer to home, the United States imposing illegal trade barriers against softwood lumber. I mean, Canada wants to be in a position that we are able to rely on our fellow countries, our partners around the world, to follow these rules that makes Canadians safer, that makes Canadian businesses prosper. And yet it's very difficult for Canada to be taking moral stances on international laws if Canada itself is also violating them. And I think it's in my mind, it's very clear that Canada can't pick and choose which international treaties to follow without encouraging other countries to do the same. So when one thinks of the context of this, I know it's just one law, it's just to do with cannabis, it's just drugs, but I think Canadians, and I think all of you, probably do care about international law when it comes to things like nuclear weapons, when it comes to human rights abuses, and we can't pick and choose without encouraging other countries to do the same.
Mr. Rawls, go ahead.
Oh, yes.
Yeah, I mean, I agree with the legal analysis there. Canada would be in non-compliance with the cannabis section of the treaties, but I don't think withdrawal is a way to respect the treaty system. I think it's far more disrespectful to simply withdraw from the treaty system than to make a principled argument that the treaties are not serving the interests of member states and that they need to be modernised to bring them into line with the needs of member states. I mean, the power of the treaty system is essentially the consensus of member states that supports it, and that consensus is crumbling. And I don't think in any way, if a case, it's immoral to move into technical non-compliance of one element of these treaties, if a case is made that it is being done in order to serve higher UN goals of human rights, public health, development and security issues. I think the case can be made that is in defence of the higher goals of the Charter, that one part of one treaty is moving into technical compliance. And if I can read a sentence from the Global Commission on Drug Policy, which is a series of a group of former heads of state and UN luminaries, including Louise Arbour, who is, I think, the former Canadian and a former UN High Commissioner on Human Rights. They said that unilateral defections from the drug treaties are undesirable from the perspective of international relations and a system built on consensus. Yet the integrity of that very system is not served in the long run by dogmatic adherence to the outdated and dysfunctional normative framework. The evolution of legal systems to account for changing circumstances is fundamental to their survival and utility, and the regulatory experiments being pursued by various states are acting as a catalyst for this process. Indeed, respect for the rule of law requires challenging those laws that are generating harm or that are ineffective. So I think, and I would also point to Uruguay, who have by I think common consent moved into a position of non-compliance. The sky has not fallen. The UN treaty system has not collapsed. Uruguay is not seen as a pariah in international human rights or at the UN. They still have a very great deal of respect. They've had a long history of respecting human rights law and being a very great advocate for the treaty system, just as Canada does. So I think there's a little bit of over-dramatisation here, that somehow the whole system would somehow cave in if you move into a technical non-compliance for a period, especially if you're making a clear moral case on UN grounds based on higher UN principles, and you are clearly showing an effort to resolve the tensions that have emerged. So I would caution some of this, I think, rather over-dramatising the situation. It needn't be this terrible cataclysmic situation. You can progress things without the whole system collapsing. I just wouldn't worry quite as much as some of the committee members seem to be.
Time's up. Now we go to Dr. Rialson.
All right, thank you very much, Chair. Thank you all for coming. Just as a little bit of a side on international law, yes, you can be banned from the United States for saying you smoke pot, but and I just looked this up, you can be banned from the United States for admitting to be a member of the Communist Party, and that is still the law today. So whatever that says. So, Mr. Tucson, I'm speaking. I'm sorry if I said that incorrectly. And keep in mind, I'm coming from the point of view as a staunch supporter of the legalization of cannabis, but I have to take exception to something you've said about those who participate in the illegal market or the black market. And again, I cannot paint all with the same brush. There are some gentle people who are just simply entrepreneurs. But I spent 17 years practicing emergency medicine in Winnipeg when it had the dubious distinction of being the murder capital of Canada. I looked after an unconscionable amount of violence, including gunshot wounds and stab wounds. A large proportion of that was, in fact, the black market in drugs, and most of that was cannabis. And that was all verified. So I think we have to caution our judgment as to what we call the black market and understand there is a very dark and dangerous element to this. And this is part of what we want to control and undermine. Now, one of the things that you had said in your submission was you did not want a government monopoly. You said that Ontario's plan was very ill-advised. However, experience in Colorado and Washington had shown that when you undercut the price, or when you keep the price low, you can undercut the black market, and in fact, that's working very well. Colorado is now at least 70% of their market is now legitimate and may be trending to close to 90%. If you had a government program that was not profit-driven, would that not be a more efficient vehicle to sell this in a way that's not profit-driven and therefore can keep the price low and undermine the illegal market?
Well, let me just point out the Colorado system is a system of private enterprise, not a government monopoly. So that's.
However, on that, I should just point out that that was not by choice, but so that they wouldn't violate federal law. But please go on.
Well, it was by choice of the voter. But be that as it may, I think government doesn't have a particularly good track record of competing with the marketplace. Here's the difficulty. Many of these suggestions may be all well and good if we were starting with a tabula blocka, if we were at a clean slate talking about something that had never been done before, never been seen before. But we have an existing massive industry in cannabis in this country, and the government monopoly is going to compete with that industry. And it can either compete on price and customer service and attractiveness, which is going to require some advertising, some things that the government may not want to do, or it can compete using the police forces to try to enforce its monopoly, which is something that is going to offend the charter and I think should offend anybody that believes in a free and democratic society. So many of these suggestions might make sense in a vacuum. They don't make sense on the ground as we sit here and stand here today. It's sort of like talking about the treaties. Canada's been in technical noncompliance with these treaties since it began to sell marijuana by not collecting it through private enterprise since at least 2005. So we're already in violation of all these treaties. These treaties are also responsible for creating a paradigm of prohibition that's led to the international black markets and all these drugs and devastation, destruction, and death across the world, including the opioid epidemic that's ongoing everywhere in this world, and particularly in this country and in the United States. So we're not starting from a blank slate. We're starting from trying to claw our way back from a failed system that does a tremendous amount of damage.
However, if I may interject, on the opioid crisis, a huge contributor to that was over advertising by a private company that was selling OxyContin.
The overprescription of opioids is definitely a big contributor, but the reason people are dropping dead in the streets is not that. The reason people are dropping dead in the streets is because they can't get clean product of known potency because of prohibition.
All right, yeah, thank you. I have no further questions.
Now we go to Ms. Gladue.
Thank you, Chair. Mr. Hoffman, which trade deals are maybe jeopardized if we breach these treaties?
When it comes to trade, I think what's most implicated by the treaties is actually the trade in medicines, in the sense that it was mentioned that these treaties do govern not only the illegal use of narcotics, but also the medical use of them. And so from that perspective, that is one advantage of the treaties as they exist, and the treaties do regulate the trade of medicines quite well. I'd be happy to look into this, happy to get back to the committee about exactly other treaties, but when we talk about these treaties and trade, often what we're talking about is trade in medicines.
Yeah, I'd appreciate it if you could. And to Mr. Rule's comments, I'll let Canadians decide how dramatic they think it is that Canada will breach these treaties, especially after I remember my NDP colleagues calling for action on this, even in 2016 already, being aware that the deadlines were approaching. Mr. Tuso, you have made a comment about the home grow aspects of C45, especially with the very prescriptive charges about heights of plants and that sort of thing, that they violated or that you thought that they would get a court challenge under Section 7 of the Charter. Can you elaborate on that a bit?
Well, Section 7 of the Charter requires Canadians not to be deprived of their liberty, in particular, by laws that are arbitrary, overbroad, or produce grossly disproportionate consequences. So if you have a person in a household, say of one, and they're able to grow 4 plants legally. And then you have a person in a household with 2 adults. They can still only grow 4 plants legally, but let's say they grow 6. Their liberty could be infringed because of that 4 plant per household restriction. That seems to me to be utterly arbitrary, and it certainly captures conduct that is overbroad. In other words, it does nothing to further the goals of the legislation, the purposes of the legislation, and it unjustly and unnecessarily criminalizes Canadians who engage in that conduct. And I expect that if we have these arbitrary limits in place, the first person stopped with 31 grams instead of 30 grams in their pocket, the first person that grew 5 plants instead of 4, I'm happy to take those cases, and I expect to win those cases. I don't want to continue to fight these battles in court. I sort of thought that by legalizing cannabis, I'd be out of a job as a criminal defense lawyer. But they're subject to challenge. I think the challenges are easy to make out. And I just think, what's the point? You can brew as much beer in your basement as you want and give it away to your friends. Why should cannabis be any different? It's safer, and frankly, it's easier to make.
It's certainly problematic. I have a question about secondhand smoke. We had some discussions about what to do about secondhand smoke. Is anybody aware of anybody in any other jurisdiction internationally that has a regulation with respect to secondhand smoke?
Most jurisdictions seem to ban
cannabis?
Yes. Or tobacco that we could pattern something after.
Most legal jurisdictions ban public consumption of cannabis. That's, I think, an argument in favor of designated consumption spots like vapor lounges. I think that's an important component of legalizing cannabis. You have to give people a place to consume it socially.
And I would just say, so California, they're in the process of legalizing, and it's supposed to go live in early 2018. One of the aspects of California's law, which is different from what we see in Washington and Colorado, is that California is going to allow for marijuana lounges, so on-premises consumption. And I have to say, from a public health perspective, it's unclear about how this is going to play out, especially when we talk about impaired driving. We know, I mean, if you have a bunch of people who used to consume at home and now they're consuming at a marijuana lounge, that could increase the number of people that are driving under the influence of cannabis. On the other hand, if you have people who used to just go to the bar and get drunk and drive, and now they're just going to the marijuana lounge and getting stoned and driving home, that actually would probably be a net win for society, because we know that the bulk of the research suggests that people who are driving drunk tend to be getting more accidents than those who are driving stoned. But still, driving stoned is the bulk of the research suggests that driving stoned is worse than driving sober. And one of the interesting things is going to be, well, what happens with respect to people who drive under the influence of both alcohol and marijuana? That's where there's a real significant risk in terms of increasing the probability of getting into an accident. And it's unclear about how these on-premises businesses are going to influence that. And so that's where I think public policy, can have play an important role in terms of thinking about whether or not to allow this and allowing for zoning. And one of the things, as the provinces will be, may likely be making decisions about this, one of the things you could do is hold off on that and kind of watch what happens in California and learn from their experiences. But I think they're also going to be dealing with this indoor air law, and so. It's unclear to me what's going to happen in terms of, will you be able to vape inside, maybe dab inside, but if you want to smoke a joint, you'll have to go outside. I'm not sure how that's going to play out, and I expect there's going to be a fair amount of variation in California that Canada could learn from.
Very good. Thanks very much. Time's up. Now we go to Mr. McKinnon.
Thank you, Chair. My questions, I'll start at least with Mr. Kilmer. And I think this goes a little bit along the lines of earlier questions. So what are the impacts of not putting appropriate controls in place at the outset for edibles? What will happen to the market? Are we going to be able to control it later? And I guess I'm going to ask about, what do you think of a cookie cutter approach, if you will, for copying and pasting the Colorado approach to edibles?
Well, I think when we're talking about edibles, people think about, oh, there's flour and then there's edibles. But when we begin thinking about non-flour products, you also have to begin thinking about the concentrates and the waxes, that can be up to 80% THC in the vape pens. And as I said, I want to make it very clear, we don't know much about the health consequences. I know that a lot of people might be using them, but we really don't know much about the health consequences, whether or not they be the benefits or the risks of these particular products. And one of the issues you have to consider is that if you're going to allow for-profit companies to produce and sell these products and you don't put any limit on it, say 5-10 years from now you decide, oh, wait, maybe we don't necessarily want to allow a certain product, or we don't want to allow flavoring in the vape pens, it's a lot harder to kind of crack down on those products once the industry is already in place and the lobbyists are powerful. So one approach here would be to take it very slow and maybe not necessarily allow some of these products. Yes, there may be demand for them in the black market, but this gets to the trade-offs that I was talking about. In that, if your only goal was to reduce the size of the illicit market, you wouldn't have many regulations. You'd want to have the price go as low as possible to drive out all of the producers. But there are some potential public health consequences associated with that in terms of an increase in cannabis consumption and also the potential for an increase in cannabis use disorder. So that's that tension there. So, for example, if you do limit products, yes, there may still be demand for that in the illicit market, but at least you won't see it in stores. You won't see it advertised. And so it's a trade-off there, and that's where so much of this comes down to people's values and preferences for risk. And what their priorities are. If your priority is on public health, you'd want to take it very slow. With respect to just doing a cookie-cutter approach to what Colorado did, I would step back and kind of look at what other jurisdictions are doing as well. Washington took they kind of had more of a wait-and-see approach, and they don't necessarily allow as many products as are allowed in Washington State. And in fact, there's also variation in terms of the amount of THC that can be allowed in a single serving. There are a couple different states where the limit is at 10 milligrams, and in 2 other states the limit is at 5 milligrams. And I don't know of much research that's kind of looked at that. So I would not necessarily just take what Canada has done and apply it in Canada. I would look at what's been happening in the other states as well, and take a very slow approach, because it sounds like that if they're going to allow for-profit companies to get involved, it's going to be a lot harder to make changes down the line. So take it slow.
Great, thank you. Question for Mr. Toussaint. So I want to drill in a little bit more, as well as Dr. Ellefson said, about black market activity. So my riding is Lower Mainland riding of Coquitlam, Port Coquitlam, and it's a public perception that there is a great deal of violence, gang-related violence in the Lower Mainland, and it is a public perception that is related to the illicit pot market. Would you say that's an incorrect perception? And if so, what do you think is driving that activity?
Well, I think it is an incorrect perception, and I think the empirical evidence, particularly what Professor Boyd, I think, shared with the committee, demonstrates that about 95% of the people involved in the cannabis trade are not involved in organized crime, as that term is commonly understood by Canadians. Undoubtedly, there's too much gang violence. There's too much fighting over the street corners. But by and large, that's not about cannabis. That's about other substances. The problem, of course, is that we continue to take a prohibition-based paradigm to the use of substances or certain substances by Canadians. The real solution to gang violence is to end drug prohibition entirely and to take a more focused public health approach to drugs generally. I do want to say a little bit about public health, though. Public health isn't just about the health consequences or benefits of using a particular substance. Public health also includes considerations of undue and unnecessary criminalization of people, use of the courts, use of the legal regime, misuse of police resources, distrust between the police and the policed, and all of those things are amplified by taking some sort of restrictive approach to people accessing relatively safe products like cannabis. I know we can say over and over again there's not a lot of research. It's the most heavily researched illicit substance in the history of humanity. People have been using it for millennia. There are not a lot of significant negative health outcomes associated with the use of cannabis. People have been smoking hash for thousands of years, which is high-potency cannabis. So I think we need to be a little cautious about making claims about perceived possible future harms. The history of humanity demonstrates otherwise.
Okay, thank you.
Okay, thank you very much. Time's up. Mr. Davies.
Thanks. I only have about 5 minutes, so I'm just going to sort of make a brief response to Mr. Rolls and Mr. Kilmer on your comments on edibles, because I find it quite astonishing. You each seem to argue that it's not essential or even desirable to legalize edibles or other products because of, here's what interchangeably you said, because of the difficulty, the complexity of titrating and dosing, and in other cases because we don't understand the public health impacts. So you're content to leave that to the black market where there's absolutely no regulation whatsoever. That strikes me with greatest of respect as absurd. So we're going to leave these products to the titration and dosing of people operating in the black market. Because we know that we've heard evidence that 30 to 70% of the consumers consuming cannabis are using these products. So it strikes me, if you're really concerned about public health, you would absolutely want to bring those products within the legal regulated market, where Colorado has brought in, you're quite right, Colorado legalized edibles and other products, and they had an initial swift outlay, and then they learned the lessons and came back with regulations on single servings, child-proof containers, stamped products, no products marketed to children, known dosages, even concentrations. That's what Colorado does now, and you seem to be arguing that, no, let's not do that, let's leave that to the black market, where none of those things can happen. And the other point I would just make about leaving it to baking at home, well, baking at home, I mean, you have absolutely no ability to control dosage or concentration. So I just want to make that statement. Mr. Tusaw, I want to turn to you about, do you have any experience with Canadians being denied entry to the U.S. simply by admitting that they used cannabis?
I don't have any direct experience. I have some anecdotal experience with that. It's generally speaking, it's hit or miss. I have clients that have convictions for trafficking offenses of cannabis that have no problem going to the United States. I have people that have merely been charged but not convicted with cannabis offenses that are denied at the border. It's really left up to the whim of the individual border guard, and unfortunately, it's a thorny problem. There's not a legal solution necessarily to it. It involves political change in the United States. And it involves Canada perhaps taking a stand on behalf of its citizens to say to the United States, look, we're your biggest trade partners. We're your most important allies. We share a long border. Stop banning our citizens from entering your country for negligible reasons.
Mr. Hoffman, I have a quick question to you. I don't really understand the government's motivation on this treaties because clearly we're going to be in contravention of our treaties. We've missed the deadline for withdrawing from the treaties. So we haven't withdrawn, and in recognition of our new reality, nor do we have an explanation for why we're staying in. Do you think that this is because the government may think that this will jeopardize their attempt to get a seat on the UN Security Council?
That could definitely be the case. I don't know I don't know what the government is thinking on this matter, but I think it could equally, violating a treaty could also jeopardize a seat on the UN Security Council. So in that respect, I don't think
either way we have a problem.
Well, but I think at least one way we can say that we're not violating international law, which I definitely want to emphasize that it is a serious thing. Yes, these laws are not perfect. In fact, as I stated, they're a bit mean. They're rather mean. Yes, we should ideally seek to renegotiate them to make them better, but just being in non-compliance with it is just not a good way forward. And you're never going to hear a lawyer tell you that you can break the law. That's just not
with impunity.
That's right.
Mr. Tusa, just quickly, what about the fact that the federal government is still prosecuting people today? Any advice to the government on what you'd like them to do?
It's a travesty. There are 26,000 Canadians saddled with criminal records for simple possession of marijuana last year while we were moving towards legalizing this product. Their lives are irrevocably harmed by this law. And I just want to underscore what I said earlier. Canada has been in technical noncompliance with the drug treaties since at least 2005, when it allowed private companies to begin selling medical cannabis to Canadians without the government collecting and redistributing all of that cannabis. So we've been violating these treaties for a better part of a decade. There's been no negative repercussions whatsoever.
Thank you very much. And that's it. Unless anybody wants to have another panel. Do you want to have is there a desire to have another panel? I don't think. Anyway, but I want to thank our presenters very much for their contribution to our study here, and especially Mr. Rawls for being up all night. And but you've been a great help to us. You've helped us understand a lot of different perspectives. So thank you very much for participating. And with that, I end meeting 67.